Hi everyone! Good morning! Kamusta kayo lahat? Nandiyan na ba kayo? Hello, may kausap ba ako? Hi, Anna Marie from OLFU. Good morning sa'yo. Good morning, iPhone, kung sino ka man. Good morning! Hi everyone! Kamusta? Naka-breakfast na ba lahat? Good morning! Ayan, 7 o'clock na. Okay, kakatapos lang po magluto. Pwedeng kumain habang nagkaklase tayo. But I encourage na mag-notes kayo. Ayan, so let me open my screen. Share my screen. Ayan 'no, habang kumakain pa yung iba, introduce ko muna yung sarili ko. I am Shannon Felipe. I'm a graduate of UP College of Nursing. I took the PNLE last November 2021. Top-notcher ako. And sa ngayon, ay wait lang. I think mas relevant kung yung story ko yung i-share ko. Kilala niyo na ba ako, by the way? Nagkita na ba tayo before? So yun, yung story ko, bale, graduate nga ako noong 2020, na-postpone yung board exam that November, and then nag-resume ng 2021, mga June, July. So nag-aaral na ako ganyan-ganyan hanggang wala pa ako sa top rank nung time na yon. So, I felt na hindi pa ako confident, kaya hindi ako nag-take ng board exam. Most of my classmates already did, pero ako, hindi ako nag-take ng board exam. Kasi, ayan, si Abigail pala yon. Ayan. Kasi, hindi ako nag-take ng board exam dahil nga, feel ko hindi pa ako confident. Tapos, pangarap ko rin talaga na mag-top. So, ayun, nag-decide ako na hindi muna mag-take, pero kailangan ko maghanap ng trabaho. So nakahanap ako ng work um sa home college ko. So nag-work ako under my professors then. So working student ako while studying for the November 2021 board exam. So ayun. So thankfully nakapag-top naman, nakuha ko naman yung gusto ko. Ayan, at eto na nga ako ngayon. Marami akong trabaho ngayon. I have 3 jobs. Yung isa na 'to, yung sa top rank. Yung pangalawa, tumutulong ako sa business ng mom ko. And pangatlo, research and communications associate ako sa isang, global organization siya, na funded by WHO, ayan. So, marami pala akong aso dito, kaya I'm sorry in advance na if ever marinig niyo man sila, may mga times na mag-mute ako at mag-off ng cam para patahimikin sila. And then we will resume. Ayan. So, ayan lang, short introduction lang. Ayan. So, for today, for this morning, we will be tackling recalls 2 and P1 to 3.5. Ayan. Wait lang. Ayan. So again, I'm Shannon. So before anything else, ayan, key test taking strategies muna tayo. Ano ba yan? Wait lang pasensya na talaga guys wait lang. Ayan. So una muna, yung question, paki-screenshot pala 'to. Okay? I think this will help you guys kasi dati sobrang gulong-gulo din ako like paano ba mag-exam ganyan. May mga kailangan ba akong tandaan? So ito lang yung mga tips para dun. So sa question, we have to focus on the data, read every word and make a decision about what the question is asking. So wag magmadali when reading the question. Take your time but also keep the time in mind. Dapat may orasan kayo. Ayan. So note the subject and determine what content is being tested. So kung ano yung focus ng question or yung mismong tinatanong, yun yung hahanapin natin sa options, okay? Visualize the event, note whether an abnormality exists in the data provided. So you have to put yourself as much as possible in the shoes of the client, okay, para mas madaling sumagot. Look for the strategic words. So strategic words make a difference in determining what the question is asking. So yung mga words like priority, first, next, ganyan. Determine whether the question presents a positive or negative event query. So mamaya we will be using that technique, okay? And avoid asking yourself, well, what if? Because this will lead you to reading into the question. So wag mag-overthink. Okay? Wag na magtanong-tanong pa kung ano yun lang yung nasa question, yun lang yung sasagutin mo. Okay? How about the options? So always use the process of elimination when choices or options are presented and read each option carefully. Once you have eliminated options, reread the question before selecting your final choice or choices. Okay? So effective yung elimination option. Okay, and there are also times na hindi applicable yung elimination. Later, we will tackle that. Look for comparable or alike options and eliminate these. So, ito yung kaso most of the time. May mga questions sa same naman yung meaning, ganyan. So, bakit mo pipiliin yun, di ba? Paano mo mapipili yun kung same yung option? Unless merong, kunyari, option A or B, ganyan. Di ba? Next, determine whether there is an umbrella or encompassing option. If so, this could be the correct option. Ayan. So, may mga times naman na itong answer na to, lahat na ng option pwedeng pumaloob dito sa option na to. So, as much as possible, more often than not, yun yung sagot. Okay? Identify any close-ended words. If present, the option is likely incorrect. So, yung may mga option na only, ganyan, usually yun yung mga close-ended and usually mali yun. Okay? Use the ABCs, airway, breathing, and circulation, Maslow's hierarchy of needs, and the steps of the nursing process, yung ADPI, to answer questions that require prioritizing. Okay? Use the RACOM techniques to answer communication questions, and remember to focus on the client's thoughts, feelings, concerns, anxieties, and fears. So, yung sagot natin, mas maganda kung nagfo-focus siya talaga sa client. Kasi may mga options na nagfo-focus sa healthcare provider, ganyan, sa ibang tao. Kung hindi naman yun yung focus ng question, wag mo yun isagot. Okay? Hindi rin siya yung focus ng dapat sa option na pipiliin natin. Use delegating and assignment making guidelines to match the client's needs with the scope of practice of the healthcare provider. Use pharmaco guidelines to select correct option if the questions or options address the medication. Ayan. So number 1 na tayo. First situation. Barangay Winterfell is a barrio located on the north side of the municipality of Westeros. Sansa, the community health nurse, developed an advocacy leaning towards mental health promotion. One nurse, Sansa, understands that using the public health model, her patient is the... Okay, so pinag-uusapan natin dito, community health nurse, mental health promotion. So nasa community and ginagamit natin yung public health model. So with this, dapat yung patient natin yung community. Okay? Wala nang iba. Okay. Dito sa next slide, may explanation yan. Ayan. So yung individual, kapag tinanong sa question, point of entry in the community, ayan, yun yung individual. Kapag naman sinabing basic unit of care, family yon. And of course, yung community, it's the main client in the context of CHN, and it's also the point of entire care. Yung country, pampagulo lang yan. Yung population groups naman, it's the point of specific care. Okay, this is NP1. So dito makikita nyo sa baba yung NP and recalls to yung exam natin. Okay? So, 5, 4, 3, 2, 1. Bibilang pala ako ha before I go to the next page. Number 2, to grasp the community's overall mental health status, the incidence and the prevalence of mental illness, Sansa employed epidemiological studies in this situation. Incidence refers to the number of. Okay, so kapag sinabing incidence, ito siya. Incidence, it pertains to new cases. Kapag prevalence naman, old plus new cases. Ang tinatanong dito, incidence. So, new cases. So, saan dito yung new cases sa options? You can scan it, okay, to eliminate. So, new cases of mental illness to total population, new cases. New cases din. Dito, people at risk to develop mental illness, walang new cases. So, X. New cases, wala din dito. Itong D, this is probably prevalence. Okay? Kasi all existing cases, old plus new. Okay, so X yan. Boy and dog X. So we're looking at apple and cat. Okay? Dito, ang pinakaiba niya, new cases of mental illness in the total population. Ito naman, new cases of mental illness over a specified period of time in the population at risk. Okay? Ito, population at risk lang. Ito, total population. Tapos, itong cat, may over a specified period of time pa siya na part ng option. Okay? So, saan dito? Kapag sa incidence, dapat ang population lang na kinoconsider natin yung at risk lang. So, the answer here is cat. Okay? So, 2 is cat. 5, 4, 3, 2, 1. So, ito nga yung sagot. Ito, prevalence yung dog. Yung A, ang tawag dyan sa definition na yan, new cases of mental illness in the total population, new cases of diseases in the total population, overall attack rate yung tawag dyan. Okay, good to know lang. 5, 4, 3, 2, 1. Number 3, Nurse Sansa understands that primary prevention is a very important concept, especially in terms of her advocacy. So, mapapansin nyo, yung mga in the underline ko, yun yung kailangan nating bigyan ng pansin or i-emphasize. She applies this concept through A, program development and intervention for adolescent with mental illness. Okay, wait lang. Before that pala, let's go to the next slide. Okay, and discuss the levels of prevention. So kapag sa primary prevention, di ba may tata tayo, primary, secondary, tertiary. Sa primary prevention, it's usually directed to the healthy population. Tapos, it includes elimination of risk factors. So, yung vaccination, primary prevention yan kasi it eliminates the risk for that disease, di ba? Tapos, kapag sinabing specific protection, kapag may ganyan na tanong, primary prevention din yan. Usually gloves, ganyan, use of gloves, use of mask, ganyan, primary prevention. Secondary prevention naman, kapag nag-identify na tayo, nag-treat na tayo ng health problems at the earliest possible time. Excuse me. So it includes case finding or surveillance, contact tracing, prompt treatment, early diagnosis, and detection. Sa tertiary naman, it limits disability progression. Okay, so balik tayo dun sa tanong. So dito, ang hinanap natin ulit primary prevention. So dito sa A, program development and intervention for adolescents with mental illness. So secondary to. Kasi may intervention na naganap. Diba? At the earliest possible time sana. Early treatment. Ayan, nandiyan na. Treatment of new cases of mental illness. Secondary din yan. Case finding for the population at risk for mental disorder. So case finding, secondary din yan. Case finding and surveillance. So natitira na lang is D, pero tingnan pa rin natin. Reducing the rate at which new cases of mental illness develop. Tama to kasi this is probably because of the elimination of risk factors, di ba? So, primary prevention ang dog. So, 3 is dog. 5, 4, 3, 2, 1. Ay, mabilis ba ang facing? O sige, ano natin, babagalan natin ng onte. Kahapon kasi nag-overtime kami. Kaya, hopefully sana hindi tayo mag-overtime today. Dami kasing concept. Ayan. Number 3, Nurse Sansa understands that primary prevention is a very important concept, especially in terms of her advocacy. Ayan. So, primary prevention ulit. She applies this concept through. Okay. Ay, sorry. Parang ewan lang. Na-discuss na natin to. So, next number. Ayan, sabaw pa. Medyo sabaw pa ngayong umaga. Pasensya, guys. Ayan. So, primary prevention entails mental health promotion. This activity can be considered consistent with the principle of. Ayan. So, kanina na pag-usapan natin na yung secondary prevention, di ba? It includes treatment already and care. So, meron ng intervention. So, pumapasok dyan yung sa interdisciplinary care at multidisciplinary care. Okay? So, X na tong dalawa kasi secondary yan. So, ito namang autonomy. Di ba autonomy refers to the right to make decisions and to refuse treatment. Okay? So, usually pumapasok na rin yan sa secondary. Okay? X yan. Ngayon, ang natitira, self-help. Okay? By elimination. So, that is the answer, cat. 4 is cat. Okay? 5, 4, 3, 2, 1. Ayan. So, yung difference pala ng interdisciplinary care tsaka multidisciplinary care, kung nagtataka kayo, yung interdisciplinary care, it's collaborating toward the common goal, while yung multidisciplinary care, yung team members nag-work sila independently based on their respective discipline. Ayan, sorry dito. Respective discipline yan. Okay? Next. Situation. Sexuality is a major issue in psychosocial health that is often not emphasized or considered taboo by many nurses. So, underline lang natin sexuality. Good thing you are a nurse who is non-judgmental when it comes to issues in sexuality. Okay, so when answering a question in the board exam, kahit hindi dito sa situation na to or sa question na to, dapat hindi rin tayo judgmental and therapeutic tayo. Okay? So number 5, Tyrion 25 admits to you that he has multiple sexual partners. Which among the following will you do regarding this? Okay, so tingnan natin. A, counsel him that it is shameful for men to have multiple sexual partners. So this is actually judgmental already and it's non-therapeutic. So, X to. B, educate him regarding safe sex practices. Pwede. Para alam ni Tyrion paano protektahan yung sarili niya over sexually transmitted disease. C, terminate care right away. For it is dangerous to be dealing with people like him. So again, judgmental tong statement na to, X yan. Refer him to a psychiatrist. Ito naman, dapat kapag magre-refer tayo, it is the last option already. Na-exhaust na natin lahat ng interventions for the client. Okay? So, X to. So, boy is the correct answer for 5. So, 5 is boy. 5, 4, 3, 2, 1. Ayan, boy. Cersei comes to a clinic to complain of involuntary vaginal spasms that make it difficult for her to have intercourse. This is referred to as. Okay. So kapag mga ganitong options, 'di ba, mahirapan kang pumili kung hindi mo talaga alam. So, ang tip diyan ay use context clues kumbaga, or parang hati-hatiin mo yung mga terms na hindi mo alam. So, unahin natin tong letter C, vulvodynia. Ito. Para di na ako mahirapan magsulat at di rin kayo mahirapan na alamin yung sulat ko. And liitan ko lang ng onte para may space pa yung iba. Ayan. So, this is the chronic pain in the vulvar area. So, vulva or vulvo means vulvar area. It's outer part including labia majora, labia minora, and clitoris. Okay, dynia is pain. So, that's pain in the vulvar area. Vulvodynia. Okay, how about itong vestibulitis? Okay. Itong vestibulitis, it can actually be nasal or vaginal. But since pinag-uusapan nga natin the vaginal spasm, so let's assume nasa vagina siya. Okay? So itis, of course, means inflammation. Tapos yung vestibule naman, it's a subset of the vulvodynia. Wait lang. Yung vestibule, it's also part of the vulva. Okay? So, ang ibig sabihin natong vestibulitis is subset of vulvodynia, part siya ng vulvodynia, where severe pain is felt in attempts of touching or penetrating it. Okay, yung vagina. Okay, so, yan yung vestibulitis. Parehas tong mali, C and D, cat and dog, kasi hindi naman siya nagto-talk about spasms. Okay, how about dyspareunia? So, ito. So, this means difficulty or abnormal. Parunya, sexual intercourse. So, there's difficulty in sexual intercourse. Ang actual definition niya, painful sexual intercourse. Okay? So, dito, makikita natin, difficult for her to have intercourse. Pero wait, let's see what vaginismus is. Okay? Kapag vaginismus, dito na lang. Wala na space. Ayan. Vagin, meaning vagina, di ba? Ismus means spasm or contraction. So, actual meaning vaginal spasm, which is involuntary. Okay, so answer here is vaginismus. Okay, C is apple. 5, 4, 3, 2, 1. Wait lang. Guys, kung sino yung seno to na. Kung sino may screenshot ng number 5, please. Pasend sa GC. Thanks. Kasi hindi ko na to mabalik eh. Save ko lang. 5, 4, 3, 2, 1. So 6 is apple. Ayan. So ito pala, dito, ayun yung vestibule, vulva vestibule, dito siya banda. Ito. So kapag may penetration or touching, masakit. And that is vestibulitis. Ayan. Ito yung definition nila, which is same lang din kanina. Ayan. So 7, which among the following medications can decrease sexual desire? Or ito yung tinatawag na libido. Okay? So isa-isahin natin yan. Yung morphine, it's an opioid. It's an opioid. Samantalang itong phenytoin, it's a barbiturate. Okay? Ngayon, opioid and barbiturate are both CNS depressants. Okay? So dahil doon, systemically, nagde-decrease din yung libido. Ay. Wait lang. Ayan. How about itong atenolol? This atenolol is a beta blocker, di ba? So ang action niya, it decreases the cardiac output, leading to decreased blood pressure and decreased tissue perfusion. Ngayon, dahil doon, nagkakaroon ng systemic change din. And so, nagkakaroon ng decreased libido. Okay. So, ang sagot dito, since lahat sila nag-lead to decreased libido or sexual desire, answer here is dog. Okay, 7 is dog. 5, 4, 3, 2, 1. Okay. Number 8. Homosexuality, heterosexuality, bisexuality are varieties of which of the following? Okay? So, may tinatawag tayong SOGI. Kung familiar kayo doon, ito siya. So, sexual orientation, merong gender identity, yung meaning niya, gender and gender expression. Ayan. So, kapag sinabing sexual orientation, yan yung it refers to the one who we are attracted, to whom we are attracted to. Okay? And then yung gender identity, this refers naman to the personal sense of one's gender. Okay, kung trans ba siya, cis, non-binary, or genderqueer. Okay? How about gender expression? From the word itself, kung paano i-express ng tao yung gender identity niya. Okay? Wait lang. Ayan. So, isa-isahin natin tong options. Yung transgenderism, this is actually a derogatory term that refers to the quality or characteristic of being transgender. Yung, yung gender identity nga, para lang may kopya din kayo, this is the personal sense of one's gender. So, ayan. Okay. And then yung intersex naman, intersex condition. So, it refers to a person born with a combination of male and female biologic traits. So, mukhang babae siya sa panglabas, pero yung ari niya pala is panglalaki. So, may mga ganong condition. And lastly, yung sexual orientation, again, this is to whom we are attracted to. So, ito, yung homosexuality, heterosexuality, bisexuality, this refers to the attraction nga. So, homosexuality, ibig sabihin, we're attracted to the same sex, heterosexuality to the opposite sex, and bisexuality to both same and opposite sex. Okay? So, dog is the correct answer for number 8. 8 is dog. 5, 4, 3, 2, 1. Ako na lang mag-send ng screenshot ng number 5 later. Ayan. Situation. Mr. Ned, a 42-year-old engineer, was brought to the emergency department of Hospital C. The nurse accommodating him learned that he complains of sudden severe headache, numbness of the right side of his body, and difficulty speaking. The nurse immediately administered oxygen to the client. So dito, mapapansin natin, the client is experiencing or showing signs and symptoms of stroke. Okay, pasensya na sa sulat ko. Ayan. So, yun nga, the nurse immediately administered oxygen to the client. So the question, through this intervention, which is yung pagbigay ng oxygen, the risk for the following complications is lessened, including, so the question is asking about the risk of the complication na nalilesen through oxygenation. Okay? So, ano yung risk na yon? Kapag hindi nagbigay ng oxygen to the client, nagkakaroon ng hypoxia and hypercapnia. Okay? And that leads to cerebral vasodilation. Okay, ganito. Kapag may hypoxia and hypercapnia, which usually happens in stroke, 'di ba? So yung circulating blood sa systemic and sa cerebral part of the body, nag-lessen nga yung oxygen. So may hypoxia. So ang tendency nun, magkakaroon ng cerebral vasodilation kasi importante yung brain sa katawan natin. So ang compensatory mechanism ng katawan ay vasodilate yung mga veins sa utak. Okay? Ngayon, ang nangyayari doon, nagkakaroon nga ng increased blood flow to the brain. Para, ayun nga, magkaroon ng oxygen. Pero, eventually, nag-i-increase yung ICP, intracranial pressure, dahil sa increased blood flow to the brain. Okay? And, this may lead to seizure, neurological damage, and ultimately death. Okay? So, importante na magbigay ng oxygen. So dito, ang pinaprevent talaga ng oxygen among the options, hindi yung fluid accumulation of the lungs. Teka. Hindi yung fluid accumulation of the lungs, increase intracranial pressure, yan yung pinaprevent, yes. Hindi pulmonary emboli, hindi rebleeding. Okay, so answer is boy. Increase intracranial pressure. Okay, ayan. Ito siya. So, 9 is boy. 5, 4, 3, 2, 1. Excuse me lang. The attending physician orders that Mr. Ned undergo a non-contrast CT scan. So non-contrast, ibig sabihin hindi na kailangan kung tanungin kung may allergy siya sa iodine, ganyan. The nurse understands that this diagnostic examination is performed to determine, so sa CT scan, madedetect kung may bleeding or ischemia na nangyayari sa brain using visualization. So hindi siya nagde-determine if may damage ba sa motor functioning ni Mr. Ned. Pwede niyang ma-determine siguro yung appropriate treatment and yung volume of the brain. Pero, syempre, mas priority kung makita niya kung meron bang ischemia or bleeding sa brain. Kasi nga stroke tong pinag-uusapan natin. The client is exhibiting stroke. So 10 is apple. 5, 4, 3, 2, 1. Ayan. Oxygen is immediately administered to Mr. Ned, who is suspected to have had a stroke in order to. So again, we discussed oxygenation a while ago in stroke patients. So in stroke, 'di ba, kapag hindi nabigyan ng oxygen yung client, nagkakaroon ng hypoxia and hypercapnia. So answer here is dog. Okay? Hindi ito yung focus, hindi focus yung to improve the respiration of the client, to prevent respiratory deficit, and to prevent further neurologic deficit. Yung pinaka-prevent niya talaga yung hypoxia and hypercapnia. Kasi that leads to increased ICP. Okay, 5, 4, 3, 2, 1. Situation. You are a nurse working in a medical ward at St. Bartholomew Medical Center. The following questions apply. To have a patient who suffered from multiple trauma in the nearby street was seen by the nurse. She responds initially by, so kapag ganito, we don't position properly the patient. Kasi hindi natin alam kung meron ba siyang injury sa spine. 'Di ba? So, kung kilala niyo si Eddie Garcia, ang nangyari sa kanya, nagkaroon siya ng fall at minove siya kaagad. So, directly, that led to his cause of death. Kasi may problema pala siya sa spine that is related to his respiration. So, ayun. Namatay siya. So, tatandaan niyo guys na huwag dapat galawin yung pasyente kapag may mga ganito kayong nakita. Okay, second, providing oxygen. Okay, kapag pala ganito, mga emergency and disaster ganyan, ito yung tatandaan natin. So, ABCD, airway, breathing, circulation, disabilities. Kapag naman for cardiac arrest, yung hindi gising yung pasyente, kung nag-cardiac arrest siya, ang priority ay C, compression, tas airway and breathing. Okay? So, yan yung tatandaan natin. So, dito, yung letter B, this is in breathing, yung oxygenation, di ba? Ito naman, opening the airway. Kasi ito, pwede itong susunod na gawin after opening the airway. Kasi yung priority natin is airway. Okay, so 12 is cat. 5, 4, 3, 2, 1. Diagnostic catheterization, cardiac catheterization was performed to a client to determine the presence of coronary artery disease. The following are the correct nursing responsibility post-cardiac catheterization except. So, tingnan natin kung ano yung hindi nursing responsibility post-cardiac catheterization. So, let's look for something negative. Okay? A, observe the catheter access site for bleeding or hematoma formation. Tama, kasi may invasive procedure tayong ginawa. Bed rest must be maintained for 2 to 6 hours after the procedure. Teka lang. Tama. Instruct to perform exercise as allowed by physician. So, sinabi naman dito as allowed by physician. Tama rin to. And itong D, monitor for signs of hypertension and tachycardia. Actually, this is wrong kasi dapat we monitor for bradycardia. So, brady dapat and hypotension as well as nausea due to risk of, ayan, sulat ko dito. Due to risk of vasovagal reaction or hindi natawag na syncope or yung fainting that is most of the time harmless but rarely it can be lethal. Okay? Yung sa exercise naman, generally it's recommended 6 weeks after. Okay? And kapag after 6 weeks nga, i-recommended na mag-walk 30 to 40 minutes per day daily. Okay, eto. Yan. Yung sa bed rest naman, this is done if sa lower extremity yung ginawa yung cardiac catheterization, yung 2 to 6 hours after the procedure. Pero kapag upper extremity naman, yung cardiac catheterization, bed rest lang until vital signs are stable. Ito. Ayan. So, kapag upper extremity, until vital signs are stable for bed rest. Okay? Ayan. So, answer here is dog. Kasi nga, hinahanap natin ay negative statement. Okay? 13 is dog. 5, 4, 3, 2, 1. Okay, next. 14. Ayan. The patient was admitted to the trauma ward and is being assessed by the nurse. Okay, trauma ward. Which of the following parameters must the nurse observe when using the modified champion trauma scoring? Okay, so this is the modified champion trauma scoring. So it includes the Glasgow Coma Scale, the GCS, systolic BP, ayan, respiratory rate, and then yung coded value niya. Kung ano yun. So, hindi kasama dito ang diastolic blood pressure. So, saan dyan yung 1, 2, and 3? It's CAT. 14 is CAT. 5, 4, 3, 2, 1. Situation. The local health board established a reproductive health clinic in the Barangay Health Center. Two nurses, Holmes and Watson, were assigned to handle services to address problems related to sexuality, reproductive health, and fertility problems. Ayan. So, Nurse Holmes classifies cases according to the major categories of the reproductive tract infections. Which of the following is not? Ayan, yung mga strategic words, not part of such classification. So, dito, yan, para may notes din kayo. So, yung reproductive tract infections include 3 types of infection. The sexually transmitted diseases, ayan, endogenous infections that result from poor personal hygiene, and yung iatrogenic infections as aftermath of invasive procedures like catheterization, IUD insertion. Ayan. So, hindi kasama dyan itong urinary tract infection kasi dapat nasa category siya of urinary tract infection. Okay? Magkaiba yan, reproductive and urinary tract. So, boy is the correct answer for 15. 5, 4, 3, 2, 1. So, ito. Watson handles the screening of gonorrhea every 2 weeks among female sex workers in the implementation of PD 856. In differential diagnosis of discharge among infected clients, which of the following colors discharge? Will Watson take note to identify gonorrhea from other causes? Okay, so ito notes. 4 color discharges. Okay, so ang gonorrhea daw, may thick green or yellow discharge. So, saan dito sa options ang may green or yellow? So, itong A, meron. Mucoid white, hindi yan. Hindi yung boy. Yellowish white, yes. May yellow siya. Grayish white, walang green or yellow dyan. So, X yan. So, we're looking at A and C. Okay? So, tingnan natin. Greenish yellow as differentiated from mucoid white of trichomoniasis. Ang C naman, yellowish white as compared to trichomoniasis, greenish yellow. So, ano bang color ang discharge ng trichomoniasis? So, tingnan natin dito. Ito, thick, thin, or frothy, and yellow-green. So, hindi siya white. So, X na tong apple. Correct answer is cat. And 16 is cat. 5, 4, 3, 2, 1. 17. Nurse Holmes was invited by a women's group to give a lecture on healthy sexuality. In the expectation check, he noted that there are previous misconceptions expressed by the participants. Which of the following statements are correct? Okay, so may mga misconceptions daw about sexuality. So tingnan natin yung options. It is the obligation of the wife to give in to sex every time he asks for it. So yung tanong pala, we're looking for something positive. Okay, so yung letter A, obligation ba ng wife to give in to sex every time he asks for it? Diba International Women's Day pa lang? So, hindi obligation ng wife. So, may right pa rin to refuse yung wife every time na magtatanong yung husband. Okay, so negative statement to. Sexuality is fluid and may change. Tama, positive. Effeminate men are gays. So, not all effeminate men are gays. Okay, so negative statement to. Homosexuality, being gay or lesbian, is an abnormality. So, negative statement din to. So, we're looking for something positive, diba na statement, and B is a positive statement. So, boy is the correct answer for 17. 5, 4, 3, 2, 1. 18. One of the clients was positive to gonorrhea. Nurse Watson explained that gonorrhea and chlamydia, if left untreated, can lead to PID, or pelvic inflammatory disease. Such condition may cause infertility due to... Okay. Okay, so yung gonorrhea and chlamydia, mataas ang risk niya na mag-lead niya to pelvic inflammatory disease. Ngayon, ang nangyayari, wait lang. Sa PID, nagkakaroon ng pelvic or general peritonitis. Wait lang, ito na. Lagay ko rin dito para makita nyo. So, nagkakaroon ng pelvic or general peritonitis, abscesses, strictures, and fallopian tube obstruction that may develop. So, scar tissue may occlude the tubes resulting in sterility. So, yung mga scars talaga yung dahilan kung bakit hindi na pwedeng mag-attach yung ovum. Okay? Sa cervix, vagina, ovaries, fallopian tubes, and uterus. Okay, so dahil sa scarring, and that is cat. 18 is cat. 5, 4, 3, 2, 1. 19. Nurse Holmes further explained that the test used to determine tubal patency using a radiopaque material is the... Okay, so yung A and B, post-coital infertility test and Sims-Hunter test, same lang yan. So yung sabi natin kanina, di ba, kapag may mga same na options, probably this is wrong. Kasi paano ka makakapili dyan? Di ba? But this is a test. This is used to test sperm interaction with cervical mucus. Okay? How about Friedman's test? Ito naman, it aids in the early diagnosis of pregnancy. And ito namang hysterosalpingography. It's an X-ray test to outline the internal shape of the uterus and show whether fallopian tubes are blocked. So, the question, ayan, test used to determine tubal patency using radiopack material. So, makikita dito kung ang fallopian tubes are blocked. So, answer here is dog, hysterosalpingography. So, 19 is dog. 5, 4, 3, 2, 1. This is NP1. Ito nyo siya makikita sa baba. Situation. Leadership and management are significant concepts for nurses. Being the head nurse of the medical unit of New Amsterdam Hospital, Nurse Max applies various techniques of nursing management. Okay, so leadership and management yung focus natin sa situation na to. As Florence Nightingale theorized, nurses must utilize the environment of the patient to assist them or her towards recovery. Nurse Max is aware that the biggest problem of hospital clients is, so kung mapapansin nyo sa option, this is about the environment. Ang hinahanap dito ay yung biggest problem. So we're looking for a statement that is negative. Okay? So yung ventilation, something positive. Positive din tong hospital bed, positive din tong lighting. Ang negative lang yung noise kasi nga maingay. Diba? So 20 is dog. 5, 4, 3, 2, 1. 21. Nurses must ensure an infection-free environment for their clients. Max mentions to his staff that a protocol that serves as the first line of defense against infection is usually yung mga first line, of course, ang yung unang ginagawa, and at the same time, it's easy to do. Kaya nga, first line. Okay? So yung, saan ba dito yung pinakamadaling gawin? That is hand washing. So, 21, the answer is apple. Okay? Itong cleansing, it's a simple, parang similar lang din siya sa hand washing. So we will differentiate now disinfection and sterilization. Kapag sinabing disinfection, it destroys microorganisms except spores. Kapag naman sinabing sterilization, it destroys microorganisms including spores. So, ano nga ba yung spores? So spores, they are microorganisms in vegetative state encapsulated in a protective covering that is heat and chemical resistant. Okay, so hindi siya madaling ma-destroy yung mga spores. Kaya nga, sterilization lang yung nakakagawa nun. Okay? So, for 21, it's apple. 5, 4, 3, 2, 1. 22. Nurse Max handled 16 patients during her shift. He delegated the routine morning care of patient X to Sharp, a nursing aide. In this case, you are aware that the person most accountable for the performance of care is. Okay. So in this case, may delegation na naganap. So sa delegation, usually may dalawa yan, yung accountability and responsibility. Kapag sa accountability, it remains with the person who delegated the task. Pero kapag responsibility, nata-transfer yan. It can be transferred to the person whom you delegated the task to. Okay? So yung accountability, in this case, yung tinatanong, nagre-remain siya kay Nurse Max kung sino yung nag-delegate. Yung responsible naman, pwede siyang ma-transfer to Sharp, nursing aide Sharp. Okay? So delegation, accountability is Max. So answer here is cat. 22 is cat. 5, 4, 3, 2, 1. Max supervised Sharp during provision of morning care and advised her that it is important that she understands how to provide care in order to. So anong purpose ng pag-understand how to provide care? Okay? A, is it to perform the procedure quickly? Diba? Kapag sasagot ng board exam, dapat ideal setting tayo. Hindi tayo dapat nagmamadali. Okay? But in real life, I know na in most cases than not, nagmamadali tayo kasi marami tayong pasyente, di ba? Pero sa board exam, ideal setting, okay? Dapat hindi tayo nagpa-perform ng procedure quickly. Dapat dahan-dahan to ensure the safety of the patient. Explain the procedure to the client, pwede. Let's consider. Teach another nursing aide the procedure. This focuses on the nursing aide already, di ba? As much as possible, yung option na pipiliin natin ay mag-focus sa client. So, X to. Complete the procedure safely. So, this is about the client. So, among boy and dog, ano kaya yung sagot? Mas priority yung safety ng client. So, pipiliin natin ang dog. 23 is dog. 5, 4, 3, 2, 1. 24. As the week is about to end, Nurse Max starts to make the daily case assignment of his staff for the following week without getting their inputs. He often commands his subordinates and strictly monitors their activities during their shift. So, pinapakita nito ay authoritarian si Max. Now, Nurse Lauren, the chief nurse, advises Max to consider his staff, seek inputs from them, and to act as a facilitator rather than a controller. This kind of approach is called. So, ang nire-refer dito sa question ay yung sinabi ni Chief Nurse Lauren. Okay? And this one, itong approach na to is a democratic approach. Okay? Kapag naman sinabing bureaucratic, it usually involves strict rules and regulation. Kapag naman laissez-faire, usually there is no control. Diba? Little or no control yan. And yung democratic naman, there is control to guidance by a facilitator. So, 24 is dog. 5, 4, 3, 2, 1. Situation, Nurse Len, a newly promoted senior nurse in OB ward, is attending a seminar on management and leadership in preparation for her work. Okay, Nurse Len learns the 5 principles of goal setting in which the senior nurse must provide enough time for OB nurse to improve performance. So, providing enough time. Ayan. Lang. Okay. So, dito makikita nyo sa gilid yung 5 principles of goal setting. Meron dyang commitment, clarity, challenge, complexity, and feedback. Okay? So, for the interest of time, ito. So, yung 5 principles of goal setting, it is by Locke. And ang tawag dyan, Locke's goal setting theory. Okay, so yung challenge, it is to spark interest and initiative. So, kailangan yan in goal setting para may mga tao na mag-join towards sa pag-achieve ng goal nga. And commitment, syempre, kailangan ng commitment of time, effort, ganyan, to be able to achieve the goal. Yung feedback naman, it is to gauge how the team is progressing. So, kailangan yan kasi titingnan kung saang process na ba sila, ganyan, kung nagpo-progress ba sila, ganyan, in the goal setting. Yung task complexity naman, it is to ensure that work doesn't become too overwhelming in highly complex goals. So you have to give enough time, can modify the goal, break large into small goals. Ayan. So, sabi dito, nurse must provide enough time to improve performance. This is called task complexity. Ayan. 25 is dog. 5, 4, 3, 2, 1. The nurse also learns that continuous training is a personal as well as an organizational goal. Okay, so training. Choose the statements that are true regarding continuous training. So we're looking at something positive kasi dapat true. So number 1, training employees is an excellent investment and a cost to an institution. So not all the time it should have a cost to an institution kasi pwede namang manghiram ng other lecturer, pwedeng nurse or doctor from another ward, tapos magtuturo siya sa ward na to, diba? So it doesn't have to be costly. Ay, wait lang, sorry. Wait lang, guys. Ayan. So, okay. Ayan. So, nasa naman tayo ulit. Ayan. Training employees is an excellent investment and a cost to institution. Dapat hindi siya costly. So, negative tong statement na to. Continuous training is more of personal responsibility than institutional. So, this is negative kasi dapat balance siya. It's both equally a personal responsibility and an institutional responsibility. Okay? Number 3, cross-training and job rotation provide an ongoing part-time learning experience. Tama naman to. Select the best people when hiring employees and invest their retention through continuous training. Tama. Okay, so ang hahanapin natin sa option ay 3 and 4. Saan dyan yung 3 and 4? That is Apple. 26 is Apple. 5, 4, 3, 2, 1. Noting the importance of nurse-patient relationship, Nurse Len reviewed Hildegard's Peplau's theory, which identified 3 phases. The first of which is when a pregnant woman is. Okay. So sa theory of nurse-patient relationship, may tatlo yan. Merong orientation, yung first step, working, tsaka termination. So the first step daw, the first of which is when the pregnant woman is. So this is referring to orientation. Orientation. So, kailangan hanapin natin dito sa option kung ano yung nagpa-pertain sa orientation part. Demonstrate self-reliance in caring for herself. This is dapat sa termination na to kasi self-reliant na yung pasyente. Okay? Boy, feels the need to seek professional assistance. Pwede to sa orientation kasi kailangan niya pa tayo. Understands the communication of Nurse Lovely regarding the services offered. This is in working phase. Begins to have feeling belonging. This is also in working phase. Usually, hindi pa yan yung feeling of belonging in the orientation. Okay? Boy is the correct answer for 27. 5, 4, 3, 2, 1. Situation. The nurse in the emergency department admits a 45-year-old female for vomiting blood. According to a family member who accompanied the client had gastric ulcer for several years. The nurse assesses that the client is in shock. Which of the following assessment findings indicate hypovolemic shock? Okay. So, tingnan natin. A. Systolic blood pressure is less than 90 millimeter mercury. Teka. So we're looking at something positive na dapat assessment finding ng shock. Okay? Systolic blood pressure is less than 90 millimeter mercury. Teka. Tama to. Pero kasi, nangyayari lang to at the latter part ng hypovolemic shock. Usually, kapag early or initially, kapag hypovolemic shock, dapat mataas ang systolic blood pressure or ang blood pressure kasi nagko-compensate pa yung katawan. Okay? Tingnan natin to. Pupils are unequally dilated. So this is anisocoria. Teka. Let me type para maintindihan yung sinusulat ko. Anisocoria. And usually this is because of brainstem injury. So wala siyang relate sa hypovolemic shock. pulse is less than 60 beats per minute. Usually kapag may hypovolemic shock, mataas ang pulse. Okay, so mali to. This is a negative. Respiratory rate is more than 30 breaths per minute. Positive. Okay. So, among A and D, apple and dog, ang mas definitive na assessment finding sa hypovolemic shock ang dog. Okay, kasi kahit initial or late sign yan, mataas pa rin ang RR. Okay, so 28 is dog. 5, 4, 3, 2, 1. Okay. Ito pala, kasi may mga question akong na-encounter before na sasabihin niya lang yung sign, kung ilan yung RR, HRBP, ganyan-ganyan, kung ano yung temperature niya, or yung other symptom, tapos hahanapin mo, i-identify mo kung anong type of shock siya. So, may sarili akong ganito, hindi ko to ginamit, pero this is the closest na meron ako. So, dito lang, ito yung hypovolemic shock, okay? And dito, pwede tong up yung BP niya kapag early, okay? Initially, mataas ang BP. Nagkakaroon na lang ng low BP or low volume of blood. Eventually, kasi nga, di ba, hypovolemic siya. Okay? So, answer here, again, is dog. So, 28. Okay, 5, 4, 3, 2, 1. Excuse me. 29. In the early stages of shock, the nurse expects the result of arterial blood gas analysis to indicate which of the following conditions. So, ito yung tatandaan nyo. Para tong naging hack ko noon for ABG. So, any condition that increases breathing leads to respiratory alkalosis. Okay, tandaan nyo to ha. Kapag nag-increase daw yung breathing, respiratory alkalosis yon. Any condition that increases breathing leads to respiratory acidosis. Okay. So, tapos pala, paano yung malalaman kung respiratory siya or metabolic? Kapag yung disease ay respiratory or merong increased breathing, decreased breathing, ganyan, usually respiratory yon. Kapag yung disease ay usually involves metabolic state, kagaya ng let's say vomiting, ganyan, diarrhea, metabolic yan. Okay? Ayun. So, ito pala, yun nga. Any condition that increases breathing, respiratory alkalosis yan. Pero kapag any condition that decreases breathing leads to respiratory acidosis. Okay? So, ito yung tinandaan ko before sa board exam. So, this is a hack. So, usually this is the case, pero tingnan nyo pa rin. Okay? Ngayon, in the early stages of shock, nagkakaroon ng compensation yung pasyente. So, nagkakaroon ng sympathetic nervous system activation. Kapag may SNS activation, everything is high except yung GIT tsaka GUT natin. So, kapag everything is high, di ba, mataas yung RR, there's an increased breathing leading to respiratory alkalosis. So, the answer here is boy. 29 is boy. Ay. 5, 4, 3, 2, 1. Ayan. 30. The physician orders intravenous infusion of packed red blood cells and normal saline solutions. The nurse assesses the client for which of the following. So, with the infusion of the packed red blood cells, diba, there's introduction of a foreign body to the client. Kasi hindi niya naman sariling packed red blood cells yun eh. So, usually, ina-assess natin dito kung magkakaroon ng anaphylactic reaction. Okay? Dahil nga, may foreign body na introduce sa patient. So, 30 is dog. 5, 4, 3, 2, 1. 31. The nurse understands that the best indication that fluid replacement for the client in hypovolemic shock is adequate when the, okay, kapag sinabing fluid replacement therapy or fluid resuscitation, ayan, it's the initial therapy as this helps restore circulating volume and oxygen delivery. And the best single indicator of adequate fluid resuscitation is the urine output. So it's not the blood pressure, hindi natin yan tinitingnan, but the urine output kapag sinasabing kung adequate na ba yung fluid resuscitation therapy. Okay? So tingnan natin dito sa options. So X tong A and CAT. So tingnan natin to. Dapat daw, ang recommended, 30 cc per hour. So ito, less than 30 cc kasi siya, kaya X yan. So, best answer here is boy. 31 is boy. 5, 4, 3, 2, 1. 32. The physician schedules the client for surgery within 6 hours. The nurse minimizes the anxiety of the client by answering the client's questions regarding the surgery in a calm manner, keeps the client warm, and advises the client to be on bed rest and dims the lights in the room. The reason for this intervention is to, ayan. So dito sa A, minimize oxygen consumption. Wala naman siyang problema sa oxygenation. Wala naman siyang problema sa infection. And itong stabilized fluid and electrolyte balance, usually, nakukuha na to ng IVF. Or, yun nga, IVF therapy. Okay, so best answer dito is CAT. Increase comfort of the client and their family, and her family. 32 is CAT. 5, 4, 3, 2, 1. Situation. PH and Luz works in barangay A and B in the municipality of General Luna. One day, a neighbor summons her to attend to a 7-year-old boy with high-grade fever. Upon reaching the house, local herbolaria, Nanay Abby, was already attending to the boy. She said that the boy played near the river and the bad spirits entered his body. The least appropriate remark, another strategic word to, the least appropriate remark the nurse should make is, okay, so underline na ulit natin itong herbolaria. A, go on, do what you have to do, then I will take over. Okay, so this remark is actually appropriate. Okay, kapag tinanong most appropriate, this is the answer. Okay, Nanay Abby, your intervention is entirely wrong. So, may definitive din dito na word, entirely, ganyan-ganyan. And at the same time, parang, with this statement, parang, this is inappropriate. Kasi, kailangan may respeto pa rin, 'di ba? Tsaka sasabihin mo to in front of the patient, 'di ba? So this is the least appropriate remark. This is the answer, but tingnan din natin yung C and D. Okay? It's good you're here. You can drive away the spirits that entered the boy's body. You have to be sure that all evil spirits have been driven out of the boy's body. So this is actually halos same lang sila, 'di ba? You're agreeing to what Nanay Abby is saying. And as nurses, we should be backed by science, diba? So, X to. Now, best answer dito ay boy, kasi nga, kailangan may respeto pa rin kay Nanay Abby. So, 33 is boy. 5, 4, 3, 2, 1. We have to correct them, yes. Pero, we have to respect them. Kasi dito sa last, last options.
May gising eh. Bilis na. Alas 8 na sabi mo, maglalaba ka. Bilis na!
Ayan. So, teka. So, ito kasing C and D, they're almost the same. So, paano ka pipili dyan, di ba? At the same time, parang hindi ka rin pwedeng mag-agree dito. Ang hinahanap din natin dito, least appropriate. So, best answer here is boy. After a few minutes, Nanay Abby took a big bowl of soup and gave it to the boy. The boy vomited, but Nanay Abby continues to feed him. The best remark of the nurse is, so kapag ganito, syempre as nurses, we need to correct this kasi pwedeng ang mangyari mag-aspirate yung pasyente. Okay. So what do we have to do? A, I also drink a soup when I get sick. How about you, Nanay Abby? Do you do the same? So, wala kang ginawa dun sa issue ng aspiration. So, X to. The soup could have been better if you put lemongrass on it. Wala ka rin ginawa sa possible aspiration na pwede mangyari. You have to stop feeding him because he might aspirate the soup. Yes, tama to. That's correct. Increasing fluid intake will help lower down the temperature. So, wala kang ginawa sa risk for aspiration. So, X yan. So, cat is the best answer. You have to stop feeding him because he might aspirate the soup. So, kailangan mong sabihin yun. Okay? 34 is cat. 5, 4, 3, 2, 1. Finally, Nanay Abby took out from her pocket a dried rose flower and placed it on the boy's forearm. She was about to cut the patient's forearm. What would Nurse Luz do first? So kapag ganito, syempre, kapag may breaking of skin na, this may lead to infection. Diba? Magkakaroon ng risk for infection yung pasyente. So we have to prevent that as nurses. Kahit na we have to respect ganyan. So, tingnan natin yung options. What would Nurse Luz do first? Let it go, hayaan mo na lang. So, as nurses, di pwede yan. X yung A. Tap Nanay Abby's shoulder, pwede to. But let's look at the other options. Ask the herbalaria the rationale for the intervention. Explain the possible harm of the procedure. So, itong dalawa, di ba nga, ang gusto natin mangyari, hindi mangyari yung cut. And Nanay Abby is about to cut the patient's forearm. So, kailangan muna natin i-stop yun before tayo mag-ask and before tayo mag-explain. Okay, so best answer here is boy. We have to tap Nanay Abby's shoulder to get her attention. So, 35 is boy. 5, 4, 3, 2, 1. Situation. Mr. Nathan is a director of the critical care unit of Hospital Naga. He utilizes the nursing process to communicate care to the client. Ayan. So, nursing process. He is called to the bedside of a client who is scheduled to have laparoscopic cholecystectomy. The client's pulse is slightly irregular. Mr. Nathan confers with the primary nurse regarding the interventions considering the client's condition. Which step of the nursing process is Mr. Nathan? So, ito pala yung tanong. I mean, yung nursing process lang pala yung tanong and ang dami niyang sinabi. Kapag mga ganito yung mga questions, kailangan pa rin natin basahin kasi this will help us in answering yung question na hindi naman ganun ka-related sa ano daw? Wait lang. Kailangan muna natin basahin yung question lahat so that it can help us determine the answer kung ano yung mismong question. Okay? And at in this case, ang tinatanong yung step of the nursing process daw. So, ang keyword dito is confers with the primary nurse regarding the intervention. So, nagpaplano pa lang sila. And the answer is cat. 36 is cat. 5, 4, 3, 2, 1. 37. Mr. Nathan calls for a conference with the staff members who are attending to the client. They decide to obtain a 12-lead ECG for a more definitive picture. They conclude that the client has no serious cardiac or pulmonary problems. Which step of the nursing is in effect in this situation? So they decided to obtain or to assess using a 12-lead ECG. So this is assessment. Boy. 37 is boy. 5, 4, 3, 2, 1. 38. Mr. Nathan consults with the attending physician and the anesthesiologist. He advises the primary nurse to proceed with the preparations and to remain alert for any adverse symptoms. So dito, ang keyword, consults. Okay? Which step daw of the nursing process is this? This is still part of the planning process. So answer is cat. 38 is cat. Kasi nagko-consult pa lang. 5, 4, 3, 2, 1. 39. Mr. Nathan confers with the client's primary nurse the following morning. Together, they determine that the client is ready for surgery. So after the intervention, they saw that the client is already ready for surgery. So the answer here is apple. 39 is apple. 5, 4, 3, 2, 1. 40. Mr. Nathan applies the human relations approach in this situation. He is aware that the key to productivity is. So, underline lang din natin yung human relations approach. Okay? And ito yung concept niya. So in the human relations approach, the focus is on the interpersonal aspect of managing people. So the more supportive the manager is, the more the members will work hard and will feel more motivated. Okay? So yun yung keys sa productivity. Now, ano yung option na nag-indicate nun? A, meeting the objective of the critical care unit. Wala tong humanistic approach. Okay? So X yan. It just talks about meeting the objectives. Firm control of the situation. Diba ang sabi nga, dapat supportive. So X to. The degree of the independence is allowed. This is correct. Kasi as much as possible, independent pa rin yung mga team members. Okay? D, the behavior of people under the direction. So, hindi naman yun yung key to productivity. Okay? Ang key to productivity is the degree of the independence allowed. Yung pagiging supportive ng manager. Okay? Na, ang effect niya lang ay yung members will work hard and feel more motivated. So, 40 is cat. 5, 4, 3, 2, 1. Situation. You are an OB nurse in an OPD of a hospital. Excuse me. You encounter pregnant women with complication. 41. A 35-year-old on her second trimester with insulin-dependent diabetes mellitus comes to you for some advice. What is the priority? And another strategic word, priority message for her at this time. A, infants of diabetic mothers are big, which can result in more difficult delivery. Tama naman to. Pero since we're talking about delivery here, sa third trimester na to mas appropriate, di ba? Ang client nasa second trimester pa lang. How about B? Breastfeeding is highly recommended and insulin use is not contraindicated. Tama rin naman to, pero gaya ng letter A, mas appropriate itong sabihin sa third trimester. C, achievement of optimal glycemic control is of utmost importance in preventing congenital anomalies. Tama. Her insulin requirements will likely increase beginning third trimester of the pregnancy. This is wrong. It begins in the second trimester. Second to third trimester yan, yung pag-increase ng insulin requirements. Kasi, mababa yung insulin requirements sa first trimester kasi kailangan ng glucose. Di ba insulin is anti-glucose. So, mababa yung insulin kasi kailangan ng glucose para sa growth, organogenesis. Okay? So, D is wrong. So, best answer dito ay cat, which is the priority. Okay, 41 is cat. 5, 4, 3, 2, 1. Ayan. Situation. Nurse John takes care of the De La Cruz extended family who resides in the house owned by Rosa's mother, Cristel. Rosa tends a variety store married to Mario, a government employee. They have 4 children, Alvin, Weng, Levi, and Mika. Alvin is working student of his second year in computer technology, Weng High School, graduate, Levi third year high school, Mika grade 6. There's 1-year-old baby girl who is a daughter of Weng. Weng, however, could not pinpoint the one who sired her child inasmuch as she had multiple sexual partners. This angered Mario, the father. Though he recognizes the remorse of his daughter, Mario still feels confused regarding the situation. He said he tried his best. So he tried his best to support his family and had always been considerate and kind. He and his wife would always give them reminders and advise calmly and never in a nagging manner. But still, they failed as parents. The possible nursing diagnosis of Nurse John of his family is, yan, so emphasis lang on family. A, impaired parenting. So, ang definition nitong impaired parenting, okay. It is a state in which one or more caregivers demonstrate a real or potential inability to provide a constructive environment that nurtures the growth and development of their children. So, keyword lang dito, they provide a constructive environment, yung mga parents. And since impaired yun, you have a problem with providing a constructive environment. At dito naman sa question, sinasabi naman nila na they tried their best to support the family. They have been considerate and kind, okay? So, wala naman silang problem or inability in providing a constructive environment, nurturing growth and development of their children kasi okay naman sila. 'Di ba? Okay naman yung mga parents. So, hindi to yung sagot. How about parental role conflict? So, with the term itself, yung role, may conflict daw sa role ng parents. Wala namang sinabi na may conflict sila sa role nila as parents. So, X to. Ineffective role performance. This can be applied actually to Mario. Kasi feeling ni Mario na hindi maganda yung performance niya sa anak niya. Ayan o, they still failed as parents. Okay, pwede to kay Mario. But let's also see interrupted family process. So, yung definition naman yan, ito. Ay. Lang. It is the state where a supportive family experiences a stressor, which in this case, yung pagkapanganak ni Weng, that challenges its previous effective functioning. So, yung, dati, di ba, okay naman sila, pero yung nung nanganak nga si Weng, nagkaroon ng stressor. Okay. So, ang answer dito, best answer is dog. And also, ito pala yung dog yung answer kasi this talks about the family. Tinatanong kasi sa question, possible nursing diagnosis ng family. Ito kasi kay Mario lang to eh, yung father, ineffective role performance. Okay? So, 42 is dog. 5, 4, 3, 2, 1. 43. Nurse John's conversation with Wang revealed that the young woman still suffers from a syndrome of failure. Failure to complete one's normal growth and development, failure to complete education, failure to establish a vocation and become independent, and failure to have a life. The Nurse John's intervention to this problem is. So, we're talking about Wang here. Okay? So, when choosing an option, kailangan mag-focus siya kung ano yung focus mismo sa question. In this case, nakafocus siya sa kay Weng. Okay, so maghanap tayo ng option na nag-focus kay Weng. Linear approach, meaning lang nun step-by-step process with regards to the individual in the context of the family, community, and culture that will combat shame and guilt. So, nakafocus to sa shame and guilt, itong option na to. So, we must focus on Weng as well as how we can help her, okay? Not necessarily about combating shame and guilt. So, X yan. Focus on the factors that will help protect Weng towards proximal stimuli for healthy growth and development to develop her resiliency in confronting current and future problem. Tama, we should focus on Weng and the factors that will help her. Lay down the foundation of the future by trusting human association and developing mutual trust initially with the nurse, then the family, and eventually the whole community. And I thank you. So, pang Miss Universe ang sagutan niya dito. And ito naman, sa future pa nakafocus yung option. So, as much as possible, dapat sa present time tayo. So, X. Transform interactions among family members, strengthen specific roles to strengthen family. So, this is about the family na and not about Weng. So, X yan. Best answer is boy. 43 is boy. 5, 4, 3, 2, 1. In one home visit, Nurse John was approached by the 15-year-old Levy. He was asking about condom use. He said he has a girlfriend with whom he is madly in love with but does not want her to get pregnant. Nurse John, most practical and best advice would be A. Postpone sex and suggest other ways to expressing love. Okay? Dito, it's not practical na i-advise natin to sa client. Kasi, you want him to get ready in case na he decides to go for it. Okay? So, this is not practical. X yan. Explain to him the difference between sex and love. Dapat yung option na pipiliin natin nakafocus sa client and not about ourselves. Okay? In this case, so X yan. Discourage him on having a girlfriend and focus more on his studies. So, as much as possible, we don't want also to discourage the client kahit na, di ba, 15 years old pa lang siya, ganyan. We must set aside our emotions din, ganyan. And at the same time kasi, kapag diniscourage natin yung pasyente, 'di ba, that would affect our rapport with them. Baka hindi niya na tayo pagkatiwalaan kasi nga nagdi-discourage tayo. Teach him by step correct, continuous, and consistent condom use. So this is the most practical and useful advice. So dog is the correct answer. 44 is dog. 5, 4, 3, 2, 1. Situation: Nurse Eloisa assigned as charge nurse for AM shift at the surgical unit. With this, she knows that she is responsible to lead and manage the unit and the staff. So leadership and management. While doing her rounds, head nurse Eloisa observes that Nika, staff nurse, performs one care to her patient without observing aseptic techniques. So Eloisa knows that the best approach that she can use to assist the staff nurse is to assign the staff nurse to a different unit. Agad-agad? So hindi. So paano matatama ni staff nurse Nika yung mali niya kung i-assign mo siya kaagad sa different unit? Dapat you help nurse Nika correct her mistakes. Okay? So boy, ask another staff nurse to accompany and guide Nika when performing interventions. So maghahanap ka pa ng ibang staff nurse, as a head nurse, nandyan ka na. So, hindi mo na kailangan yun. Ikaw na mismo yun. Kasi, assuming na mas experience ka as a head nurse. So, X yung boy. Discuss with staff nurse her observation and collaborate to think of ways she can improve. Tama to. Write a memo for Nika and mention that she will get fired if she does not improve her practice. So, ito naman, non-therapeutic to. So, X yan. So, cut is the best answer. 45 is cut. 5, 4, 3, 2, 1. Nurse Eliza reviews the unit's record. She notices that Ashley, another staff nurse, has been frequently absent for the past 3 weeks, and this has affected the quality of care received by her patients. Nurse Eliza implements the most appropriate strategy and issue Ashley a memorandum regarding his absence. So, agad-agad ba? Hindi rin. So, kailangan kung kaya na kausapin muna, internally muna, pag-usapan yung issue, yun muna, before ka magbaba ng memo. Boy, inform Ashley that his absences can be ground for termination. Pwede natin to gawin, but hindi ito yung most appropriate strategy para ma-solve yung problema nga or yung issue ng absences. Okay? So, X to. Talk to Ashley about the concern and remind him of the standards of the hospital. Tama. So, kausapin mo muna. Maintain an accurate record of the attendance of the staff. This is already given dapat. Okay? And it's not effective that much dun sa absences na issue. Okay? So, X yan. Best answer is cut. 46 is cut. 5, 4, 3, 2, 1. 47. Lem is a new staff nurse in a surgical unit. He was assigned to care for Mr. Rain, who is scheduled for craniotomy tomorrow. Okay, class, I have to make my pace faster. Okay, kasi 47 pa lang tayo. We have 200 questions left. Okay. He was assigned to care for Mr. Rain, who is scheduled for craniotomy tomorrow. After administering the scheduled medications for Mr. Rain, Lem knows that he is legally responsible to document on the patient's chart which of the following. Okay, ulit. Lem is a new staff nurse in a surgical unit. He was assigned to care for Mr. Rain, who is scheduled for craniotomy. After administering the scheduled medications for Mr. Rain, Lem knows that he is legally responsible to document on the patient's chart which of the following. So when documenting medications in the chart, so we have to document the client's drug interaction or reaction to the drug, yes. Client civil status not needed, peak concentration not needed, therapeutic range not needed. So answer here is apple. 47 is apple. Okay. 5, 4, 3, 2, 1. Situation: Nurse Vina, a nursing staff applicant, passed both written and oral examinations. Because she knows the head of office, she promised to submit all her credentials after she has fixed things up. She was appointed as Nurse 1, with a temporary status until she submits all her credentials, including her PRC license. Her evaluation performance was satisfactory. After a year, though, she had to renew her PRC registration and ID card. Okay, so what action must the nursing administration do first? So ano daw yung unang gagawin? A. Report the matter to the head office who had the discretion to appoint the nurse. Pwede to. Kasi kung saan yung direct na superior ni nurse, dun muna tayo magre-report. Verify with PRC. Teka lang. Verify with PRC regarding the status of Nurse Vina. So in this case, as much as possible nga, going internal muna before ka pumunta sa labas. Kapag hindi na solve internally, pumunta ka sa labas. Okay? And ito, external na kasi itong PRC. So, hindi muna yan yung unang gagawin. Okay? Confront Nurse Vina and terminate her agad-agad. So, X yan kasi dapat may due process pa rin tayo. Write a letter to the Civil Service Commission. So, external yan, X. And at the same time, hindi tayo sa Civil Service Commission, sa PRC tayo. Okay, so, answer here is Apple. 48 is Apple. 5, 4, 3, 2, 1. It was found out that Nurse Rina did not pass the NLE. What legal action should be filed against her? So, etong BNC, conduct unbecoming of professional and malpractice, X na to kasi hindi naman nakapasa sa NLE, so hindi siya professional. Malpractice is professional negligence, so X yan. So now we're looking at Apple and Dog. So dito, this can happen if nagsinungaling si Nurse Vina. Hindi naman siya nagsinungaling. Parang nirepresenta niya lang yung sarili niya na nurse siya. Okay, and that's misrepresentation. Dog. 5, 4, 3, 2, 1. In case Vina have medication error during her tour of duty, the head of office can be liable because of the law called, okay, so again, the head of office. So yung superior daw ni Nurse Vina can be liable because of, okay. So ito, para din may notes kayo, ayan. Yung respondeat superior, meaning yan that the master must answer. So yung employer daw is responsible for the actions of its employees performed during the course of their employment. Walang kinalaman dyan yung politicking. Yung res ipsa loquitur, this is usually in negligence and it means that the thing speaks for itself. Okay, so answer here is boy. Excuse me. 50 is boy. 5, 4, 3, 2, 1. By the way, guys, I can also send the screenshots ng mga slides later if you missed it, okay? Mag-focus muna kayo sa rational. 51, all nurses must understand that after graduation, they should pass the NLE. To be registered in the roster, they should take the professional oath with a except, so ano daw yung hindi kasali. So, when taking an oath, it can be with a board member or any other government official. Okay? So, ano dito yung board member and government official? This is a government official, board member to, and this is a government official as well. Diba? Ang hindi lang dyan kasali ay ang CAT. Okay? 5, 4, 3, 2, 1. 52. A nurse is leading a community meeting at the partial hospitalization program. One group member talks constantly and interrupts the other patients. The most appropriate action for the nurse to take is to. So may pasyente daw na bida-bida habang nasa community meeting. So anong gagawin natin? A. Explain to the member after the meeting that the group time should be shared. So after the meeting pa itong mangyayari, as much as possible, ngayon na. Okay? So X to. Ask the group members if they are satisfied with the way the group is working. So parang passive-aggressive tong approach na to. Kasi kailangan pa natin tanungin yung ibang members, ganyan-ganyan, kung satisfied ba sila. C, remain silent. Ito naman masyadong passive to. Kasi nag-remain silent ka lang. D, thank the group member for his contribution and ask the other members for their ideas. This is the best answer kasi this approach is respectful. Ayan. So this is the best answer, dog. 52 is dog. 5, 4, 3, 2, 1. Situation. Miss Nicole, nurse supervisor in Hospital Mangan, she attends an orientation seminar on hospital records management. 53. Miss Nicole understands that good client care on good record keeping, which of the following is not a purpose of hospital record keeping. Okay, so siguro last slide lang to before our short break kasi naka 1 hour and 30 minutes na tayo plus. Okay? So tingnan muna natin kung ano daw ang hindi purpose of hospital record keeping. Okay? A, records provide evidence of the hospital's accountability. By the way, we're looking for something negative dito na hindi purpose of hospital record keeping. And letter A, provide evidence of hospital's accountability is positive. Yes, it's the purpose of hospital record keeping. Boy, records are a key source of data for medical research or statistical reports. Tama, positive. Records provide personal information on the physicians and nurses caring for the client. So we don't provide personal information of the healthcare provider. So this is negative. Let's see, dog. Records provide data on health information system. Positive. So best answer here is cat. 53 is cat. 5, 4, 3, 2, 1. Okay, anyway, let's have a short break class for 10 minutes. Okay na ba yun sa inyo? Okay pa ba kayo? Yes, okay, sige. 10 minutes. Let's resume at 8:46 a.m. Okay? Thank you. See you again after 10 minutes. 15 minutes? Pwede naman din. Sige, let's make it 15. So, 36 plus 15. Char. 51. Sige, kain breakfast muna ng saglit. Let's resume at 8:51 a.m. Thank you, guys.
Mm.
Hi everyone! Dito na ba lahat? 8:51 na. Yes. Wait, taga-perps. Taga Las Piñas lang din ako. Sa may Verdant. Malapit lang ako actually. How about yung iba? Ready na ba? Malapit ka sa Las Piñas Doctors, tama? Ready. Okay, Gina ba? Ma'am, ano po sagot sa 53? Yes, LPDH. 53 is C kasi dapat hindi personal information. Tinatanong not a purpose. So 54. Okay, start na tayo guys ha. Start na tayo. G? Confirm naman sa chat. Ayan. Okay, G. Ay. 54. Miss Nicole is aware that when a client is readmitted to a hospital, the client's file is retrieved from the... Okay, so kapag hindi mo alam to, usually manghula kasi parang very knowledge-based siya. Okay? So, hindi siya physician file kasi client's file yung hinahanap natin. Hindi rin civil service file kasi wala namang civil service dyan. Okay, so it's either boy or dog. Okay, so may tinatawag tayong Master Patient Index System. Para sa notes nyo, ayan, the Master Patient Index System, it's an electronic medical record or database that maintains a unique index or identifier for every patient registered at a healthcare organization. So answer here is boy. Okay, 54 is boy. 5, 4, 3, 2, 1. 55. Miss Nicole is aware that when a client is discharged or dies, ay nasa terminal care, the following details should be entered in the client's record, which is the, hindi kasama dyan yung outcomes classification. Dito nanda na may NIC and NOC. Educational attainment, hindi. Ang pinakakailangan dyan ay yung final diagnosis kasi nga pag-discharge na siya or namatay yung pasyente, okay? This is required for medical certificate and recorded upon discharge. Others are irrelevant. 55 is Apple. 5, 4, 3, 2, 1. 56. The following statements are true about patients' hospital records except. So we're looking at something that is false, negative. That is a false and a negative statement. Ayan. A confidential records must be protected against loss, damage, unauthorized access, modification, and disclosure. Positive yan. Because it is true. Patients have the right to confidential treatment of information they provide to health professional. Positive. Health records are the property of community where the patient is treated. This is false. Kasi the health records are property actually of the hospital and not of the community. Okay? How about letter D? Hospital records may be released without the patient's consent when required in investigation for serious criminal offenses. This is true. Okay, so answer is cat. 56 is cat. 5, 4, 3, 2, 1. Situation. Nurse Barbara is assigned as a medication nurse for the whole week. Because of overflow of patients, their ward has recently catered to both adult and pediatric patients. Okay. Barbara is about to administer cotrimoxazole to a 6-year-old pedia patient. Which among the following is least likely considered in calculating for the pediatric dosages? So, ando yung pinaka hindi daw kino-consider dyan. Okay, so yung BSA, body surface area, kino-compute to using the weight and the height. So, by method of elimination, answer is head circumference. 57 is C. Okay, 5, 4, 3, 2, 1. Hazel is a 9-year-old patient diagnosed with gram-negative sepsis. She was prescribed with meropenem IV. The usual dose of the drug is 500 IV every 8 hours. How much is the approximate dose per day for Hazel if her body surface area is 0.57 meter squared? Okay. So dito, meron tayong 4 ways to compute for pedia doses when the adult dose is given. Okay, please take note of this. Ayan. So, yung una, ay wait lang, 4 ways, diba? Teka. Ayan. Ito pala yung number 4. Yung una, yung nomogram method, it uses the body surface area. Friend's rule, age in months. Young's rule, it uses age in years. Clark's rule uses weight in pounds. Okay? So, 5, 4, 3, 2, 1. Okay. Balik tayo dito. So, hinahanap dito is dose per day using the body surface area. So, we're gonna use the nomogram method formula. Ito yung formula. So, yung given is body surface area of child is 0.57. Ayan. Divided by yung 1.7 meter square. This is actually the average surface area, body surface area of an adult, yung 1.7. Constant to. So, 0.57 divided by 1.7 times yung normal adult dose, which is 500 in this case. Okay, so times 500 equals 167.6. Ngayon, di pa dyan nagtatapos ang computation kasi ang hinahanap dito, dose per day. Ayan, dose per day. Every 8 hours lang to 500 milligrams. So, ilang 8 hours ang meron sa isang araw? 8, 16, 24. Tatlo, diba? So, i-multiply mo siya by 3. Ang magiging sagot, 502.9. Round up, that's 503. So, ang sagot dito ay dog. 58 is dog. 5, 4, 3, 2, 1. Ayan. Barbara is given a patient with several comorbidities. Which among the following drugs has the longest duration of action? Ayan. For the interest of time, ito yung mga half-life duration nila. Lakihan ko lang. So, digoxin has a half-life of 3 to 5 days. Atorvastatin, 14 hours. Labetalol, 6 to 8 hours. Captopril, 2 hours. Okay? So, dito, ang pinakamahaba, yung in days, which is digoxin. Answer is A, apple. 59 is apple. 5, 4, 3, 2, 1. Regular insulin and NPH insulin are both ordered for a diabetic client. In mixing the two insulins in a single syringe, which is an appropriate nursing action. So, something positive. Shake vials in an up and down movement prior to withdrawing. This is a negative statement. Kasi dapat ni-roll lang natin gently yung vial in between our palms to redistribute the insulin. This helps in preventing the formation of bubbles. Kasi yung kapag may bubbles yung vial, mahirap i-withdraw yung gamot. Okay? So, A is negative. Boy, excess NPH insulin is returned to its vial to reduce cost. So, sinabi ko kanina, dapat ideal tayo when answering the board exam. We don't want to reduce cost. Ayaw natin tipirin yung pasyente. So, negative. Withdrawing protaminated insulin first before the other. So, protaminated, ito yung NPH. Or, this is, yung NPH kasi, it's an intermediate acting insulin. Okay? So, kapag ganito, meron akong technique para matandaan yan. Yung IRI, IRRI. Ano ibig sabihin yan? Yung I, yan yung intermediate. Mauna muna natin yan yung intermediate, before yung regular insulin, kasi usually regular insulin and NPH yan. NPH is intermediate acting. And then regular ulit, and then intermediate. Ngayon, anong gagawin natin dyan? You have to push the air into the NPH, and then push the air. Yung next step, push the air into the regular, and then aspirate the regular insulin, and then aspirate the intermediate insulin. Okay? So, yun yung step doon kapag mag-mix ng insulin. Usually regular insulin yan and NPH. Okay? So, mali itong cut. Kasi dapat, una muna na we need withdraw or aspirate is regular insulin. So, negative ton statement na to. Ngayon, naghanap tayo ng positive and walang positive. So, none of the above yung sagot. Dog. 60 is dog. 5, 4, 3, 2, 1. 61. Barbara administered Humulin R to a patient at 6 a.m. At what time does she expect the patient to exhibit pallor, confusion, hunger, and abdominal pain? So, Humulin R is a short-acting insulin. Yung onset niya, 30 minutes to 1 hour, peak is 2 to 3 hours, and duration is 4 to 6 hours. Ngayon, we're looking at something na what time daw na mag-exhibit siya ng hypoglycemic symptoms. Kasi pallor, confusion, hunger, abdominal pain, symptoms na yan ng hypoglycemia. So, usually, yung insulin kasi, di ba, anti-glucose siya. Pinapababa niya yung glucose. So, kapag mababa yung glucose, nagkakaroon ng hypoglycemia. So, kapag peak yung effect ng insulin, nagkakaroon ng hypoglycemia. So, we're looking at 2 to 3 hours after, magkakaroon siya ng hypoglycemic symptoms. Okay, so 6 a.m. daw in-administer yung drug. So 2 to 3 hours later, which is 8 to 9 a.m., ma-experience yung hypoglycemic symptoms. So, answer here is dog. 61 is dog. 5, 4, 3, 2, 1. 62. Barbara administered NPH to a patient at 12 noon. So, ano daw ulit yung wait. So, what time daw ulit na she will expect the client's blood sugar to be relatively low? Again, blood sugar is low, lowest sa peak. Okay, so after 4 to 12 hours, and that is 4 p.m. to 12 midnight. San ba yun dito? Boy. Okay, so 62 is boy. 5, 4, ay, dito B ha, N yan. Mali. N yan dapat. NPH, intermediate acting insulin. Okay, 5, 4, 3, 2, 1. 63. What is the appropriate gauge and length of a needle to be used in an obese adult for an insulin administration? Okay, so according to Cogier and Herb, for subcutaneous injection in adults, it is appropriate to use a gauge 24 to 26 needle, 3/8 to 5/8 inches long, 1 inch naman kapag sa obese client. So, we're gonna look for, among the choices, yung dapat in between siya, 24, 25, 26. So, lahat naman to, 24 to 26. Ngayon, since obese yung client, hanapin lang natin 1 inch. Okay, so, that is dog. 63 is dog. Okay, 5, 4, 3, 2, 1. 64. A client tells Barbara that his religious preference is Jehovah's Witness, which is a true statement regarding the use of blood products for this client. Okay, so yung Jehovah's Witness, usually sila yung mga clients na hindi nagpapa-blood transfusion kasi bawal sa religion nila na tumanggap ng other ng blood from other people or galing sa labas. Okay? So A, packed red cells are allowed in emergency and critical situation. Kahit emergency, hindi sila pumapayag. So we're looking for a true statement, positive. And ito, false statement, yung A, mali siya. The client may be given doses of erythropoietin Epogen to assist in the creation of new blood cells. This is true. But let's also look at the other options. Blood cannot be used with heart-lung equipment. Tama. Kahit heart-lung equipment, bawal. Kasi kailangan din ibalik yun sa katawan. So, bawal lumabas talaga. Blood may be accepted if it is taken from a blood relative. So, kahit relative, hindi. Negative. So, answer is boy. 64 is boy. Yan. 5, 4, 3, 2, 1. The FHSIS is recording and reporting system in the public healthcare in the Philippines. The following are the objectives of FHSIS except. So, hahanapin natin yung hindi kasama dito sa objectives. So, here on the next slide, ayan, fresh from Maglaya's book. Ito yung objectives ng FHSIS. So, let's check each option. So, hinanap dito natin ay hindi objective, negative. Ensure data recorded are useful and accurate and disseminated in a timely and easy-to-use fashion. Ito siya. So, positive to. Minimize recording and reporting burden, allowing more time for patient care and promotive activities. Tama. And dito siya. Provide standardized facility level database which can be used for more in-depth studies. Tama. And dito siya. And ito naman, by method of elimination, hindi siya kasali. Complete a picture of acute and chronic diseases. 65 is dog. 5, 4, 3, 2, 1. 66. As a nurse, you should know the process of how these information are processed and consolidated. The fundamental block of the FHSIS system is the. Okay. So this is the fundamental block. Ayan, the answer is A. How about letter B, output record? Ito yung pinaka-end na record, okay? So it is consolidated. Ito na. Paste ko na lang dito. Pero may notes din kayo, ayan. So fundamental block of FHSIS, yung family treatment record, consolidated information produced at the Provincial Health Office from the Barangay Health Station, Rural Health Unit, and Healthcare Centers. Yan yung output record. Ito naman yung reporting forms. It's also called as a tally form. So it's a form. It transmits data from one facility to another. So usually, it's transmitted to the Provincial Health Office. And yung target list or client list naman, it's the second building block of the FHSIS. Okay, so 66 again is Apple. 5, 4, 3, 2, 1. 67. The Montefield Health Service Activity Report is a form used in which of the components of the FHSIS. So kanina, ano ulit yung form? Ito siya. Ito yung pagkakasunod-sunod niya. Family treatment record, it's the individual health record. Tapos, nililista yan. Kung kasali ka sa isang program, nililista ka under that program. Yun yung target list or client list. Tapos yung tally or reporting forms naman, yun nga, form to, it can be, sulat ko dito. Tally reporting forms can be done weekly, monthly, quarterly, annually, and upon occurrence of events. Okay? So, eto nga, it is a form for transmitting data usually to the Provincial Health Office. Now, yung output record naman, ito na yung last na kino-consolidate nga lahat ng forms. Okay? So, answer here is, nahanap niya yung form, and monthly daw. So the answer here is the tally report. Okay, kasi tally form to or reporting form. Okay, so answer is CAT. 67 is CAT. 5, 4, 3, 2, 1. 68. In using the tally sheet, the recommended frequency in tallying activities and services is. So kanina, it can also be used in tallying upon the occurrence of the events. Paano kung yung events ay daily nangyayari, di ba? So as frequently as possible siya. CAT is the best answer. 68 is CAT. 5, 4, 3, 2, 1.
To monitor the clients registered in a long-term regimen such as the multi-drug therapy, which component of the reporting system will be the most useful? Okay, so kanina sinabi ko sa inyo na yung target list or client list, usually segregate yung mga pangalan ng mga pasyente into the programs. Okay, so ito yung mga purpose niya according to the PHN White Book. Okay, so tinatanong dito to monitor clients, ayan, to facilitate the monitoring of the services. So answer here is CAT. 69 is CAT. 5, 4, 3, 2, 1. Situation, 20-year-old male admitted to the burn unit of St. Bartholomew's Hospital. He sustained burns on the chest, abdomen, right arm, and right leg. The nurse assigned to his care anticipates that the client would be particularly susceptible to which of the fluid and electrolyte imbalances during the emergent phase of the burn case. Okay, so during the emergent phase of the burn case, usually we're expecting hyponatremia, not hypernatremia, and hyperkalemia. Okay? Ngayon, pagpipilian na lang natin metabolic alkalosis and metabolic acidosis. Ngayon, nung nagkaroon nga yung burn, ang naging effect nun sa tissue perfusion, nadi-decrease siya. So, nagkakaroon ng anaerobic metabolism causing metabolic acidosis. Okay? Ayan. So, answer is dog. 70 is dog. 5, 4, 3, 2, 1. 71. The nurse assesses the client for fluid shifting. During the emergent phase of the injury, shifts occur due to fluid moving from the, so usually yung fluid sa katawan in cases of burn, nag-shift siya from the blood vessel, so intravascular siya, moving to the interstitial space. Okay, ito. And that is due to the increased capillary permeability. So from the intravascular compartment to the interstitial spaces, which is the space between the blood vessel and the cells. Okay, so answer is CAT. 71 is CAT. Ay, 5, 4, 3, 2, 1. The nurse understands that fluid shift results from an increase in, so kanina nabanggit ko, it results from an increase in capillary permeability. Okay, so answer is boy. 72 is boy. 5, 4, 3, 2, 1. 73. The client receives fluid restriction therapy. The nurse adjusts the infusion rate by evaluating the client's. So kanina nga nabanggit ko na the best single indicator of adequate fluid resuscitation also in major burn patients ay hourly urine output, and the usual goal is 30 ml per hour. Okay? Answer is CAT. 73 is CAT. 5, 4, 3, 2, 1. 74. The clients receive total parenteral nutrition. The nurse understands this therapy will help the client. Okay, so TPN down. Etong C, this can already be achieved by IV therapy, IVF therapy, di ba? Yung water and electrolyte imbalance. Yung dog allowed the gastrointestinal tract to rest. Pwede siya, but it is not the primary purpose of the client. Kasi 'di ba kapag yung client may burn, usually ang kailangan ng mga clients diyan yung nutrition, nagfo-focus siya into building the muscles. So kailangan natin ng protein para diyan, as well as calories para ma-increase yung para sa metabolysis ng client, kailangan ng calories, okay? Kailangan ng energy ng katawan, okay? Lalo na sa pag-build ng muscle. So, best answer here is boy, kasi mas specific siya sa burn patient natin. Okay. 74 is boy. 5, 4, 3, 2, 1. Micah, 45 years old, postmenopausal, consulted a physician in OPD for abdominal pain. She has been stressed, irritable lately. She's more relaxed when she smokes and drinks alcohol beverages. She was advised by the doctor to be admitted for a suspected duodenal ulcer. Miss Micah was ordered to have blood typing. The nurse is aware that the higher incidence of duodenal cancer, ulcer, belongs to what blood type? So ito, kapag hindi nyo talaga alam, usually nanguhula na lang. So, ngayon, eto, kaya rin tayo nagpapa-exam, di ba, para may matutunan tayong bago. So, according to research, they showed that the individuals with blood type O had higher susceptibility to peptic and duodenal ulcers compared with individuals with other blood types. So, answer is dog. O. 75 is dog. 5, 4, 3, 2, 1. Ayan. 76. Okay, sige. I will clarify that. Yung 70, 74. Okay, sige. Thank you, Kyra. Same pala tayo ng school. Ayan. Ay, wait lang. Naka-private message pala. Sorry. Lol. Sorry. Okay. Anong number na natin? 76. Okay, sige. I will clarify yung 74. Okay. Take note ko yan. Tapos babalikan ko kayo dyan. 76. Gastrointestinal endoscopy was ordered in order to have better visualization of the gastric mucosa. After the procedure, the patient developed high-grade fever of 39.8 degrees centigrade with acute abdominal pain. Okay, so visualization daw. The patient developed high-grade fever after with acute abdominal pain. What priority? So another strategic word, nursing intervention should the nurse perform? A, assess the patient at once for possible perforation. So usually kapag priority, 'di ba, we can use the nursing process ADPI. So una dyan is assessment. Okay? Pero tingnan muna natin yung other option. Huwag tayong magmamadali. Take vital signs every 2 hours. So ito naman, monitoring siya. So it's not really a priority. Give tepid sponge bath. Pwede. Give relief medication as ordered, pwede. Pero ang pinaka-priority talaga dyan ay to assess the patient. Kasi possible na yung high fever niya pala ay it indicates peritonitis and perforation, which are medical emergencies. So 76 is A. Okay? 5, 4, 3, 2, 1. 77. Which of the following conditions is contraindicated for nasogastric tube insertion and need not be ordered by the physician? Okay? Yan. Circle lang natin yung not to be emphasized, lalo na hindi siya nakakapital. Okay, so in cases na ganito, sa NGT insertion, hindi tayo nag-i-insert kapag merong trauma sa mukha yung pasyente. In this case, meron kasi nag-surgery siya. Okay? So, contraindicated siya. Okay? So, we're looking for something negative dito, no? So, negative to kasi contraindicated siya dyan. Yung hypophysectomy naman, it's the removal of the pituitary gland. Dito siya. And, ayan, dito pinapadaan sa ilong yung equipment para ma-remove yung pituitary gland. Eh, di ba nga, nasogastric tube, ini-insert yan sa ilong. Okay? So, possible na magkaroon ng trauma yung pasyente. So, contraindicated siya dyan. Recovering from gastric surgery. Possible dito na meron at pwede rin namang hindi na kailangan kasi baka may peg tube pala yung pasyente. from the gastric surgery. Okay. So, dahil dyan, hindi tayo pwedeng pumili lang dito. Ang best answer ay dog. Okay? Kasi both to tama na answer. Best answer is dog. 5, 4, 3, 2, 1. Which of the following is an expected outcome in a patient with duodenal ulcer? The patient will A. Join friends for social drinks every weekend. So, something na expected daw, positive yung hinahanap natin. Itong join friends for social drinks every weekend pa, is something negative. Kasi, as much as possible, kailangan bawasan yung alcohol sa katawan. Bakit? Kasi 'di ba kapag may duodenal ulcer, yan dito, kunyari ito yung tiyan. Yan. Dito yung duodenum. Yun yung pinakauna after the stomach na small intestine. Ngayon, dito yung usually acidic yan, 'di ba, sa stomach. And dito merong sphincter. Ngayon, nagkakaroon ng leak dito sa duodenum ng acid, kaya nagkakaroon ng duodenal ulcer. Eh kung iinom pa siya every weekend, di mas lalong lalala yung duodenal ulcer. So negative yan. No longer join sports program. So definitive tong word na to, no longer, 'di ba? Pwede pa rin naman, but in moderation. Okay? So, positive to. Engage self, wait lang. Negative pala to kasi no longer Okay? Hindi siya expected outcome. Engage self with smoking cessation program. Tama to. Kasi yung smoking, it increases stomach acidity. So, ina-encourage na mag-engage siya sa pag-stop ng smoking. Okay? Mag-engage siya sa program na mag-stop sa smoking. Okay? Use Tylenol for control of pain. So, generally, it is safe for ulcers. Yung Tylenol. Pero, ito pa rin yung best answer kasi directly nakaka-affecto sa acidity and sa duodenal ulcer. Okay, so 78 is cat. 5, 4, 3, 2, 1. Nurse May is head nurse in a medical ward in New Amsterdam Hospital. The following questions apply. You are a staff nurse working in a tertiary hospital. While charting, you see your charge nurse documenting an administered medication even before it was given. What is your priority nursing action? So, priority daw. So, kapag mga case na ganito, pwede pa rin nating kausapan yung charge nurse. Okay. So, tingnan natin yung options. A, report to the head nurse promptly. So, gusto mong kaagad. Ideally, this is not encouraged. Kasi, mas maganda muna nakausapin muna yung charge nurse. Kapag hindi niya sinunod ganyan, pwede ka nang pumunta doon sa superior niya. Ganon. So, X to. You are under the charge nurse. You're not entitled to confront her. Pwede ka pa rin naman mag-confront kasi at the end of the day, priority naman natin yung patient safety. Forget that you saw what the charge nurse did. So, hindi tayo magpo-forget lang. Kailangan may gawin tayo as nurses. Tell the charge nurse that doing so may affect her integrity and may harm the patient. So, this is the best answer, dog. 79 is dog. 5, 4, 3, 2, 1. 80, you observed a nurse logging into an account of another nurse in your ward. What is your initial action? So, kapag ganito, para hindi niya na ma-access yung other data in the account, so what we have to do is to approach the nurse and stop her from logging in. Diba? Ito, call the attention of the head nurse. So, pumunta ka kaagad sa superior niya. As much as possible nga, didiretsuhin mo muna siya. Kakausapin mo muna siya. So, X to. Superior ulit to, X. Ignore. As much as possible, wag tayo mag-ignore. Mali yan yung mag-ignore lang. Kailangan may gawin pa rin tayo. So, Apple yung tamang sagot sa 80. 5, 4, 3, 2, 1. 81. Which of the following is an example of an intentional tort? So, sa intentional tort, there is intent to harm. So, tingnan natin yung options. The nurse did not come to the patient's room upon turning off the call light. Patient suffered a fall. So, this is negligence. Two nurses are talking about a patient in cafeteria when another nurse heard the conversation. Okay, they're talking about the patient na usually maraming tao. Sige, balikan natin yan. The patient reported that he felt bleeding in his rectal area. The nurse did not respond. Later found that the patient suffered hypovolemic shock. So, ganun din, negligence. A nurse administered 50 milligram of digoxin when it should be 25 milligram only. So, dito can be malpractice or negligence. So, usually kasi kapag negligence or malpractice, it goes under the unintentional tort. Okay? So, that leaves us with letter B. Okay? This is the answer kasi intentional yung pag-uusap nila about the patient na nasa cafeteria pa sila and usually crowded doon. So, may makakarinig talaga ng conversation nila. Kaya siya naging intentional. So, 81 is boy. 5, 4, 3, 2, 1. 82. A nurse should know that for malpractice to occur, 6 elements, dapat 4 lang to, should be present. Which of the following is not an element of malpractice? So we have 4 elements. Merong duty, breach of duty, causation, and injury. So ano dyan yung hindi kasali? Modifiability. So cat is the correct answer. 5, 4, 3, 2, 1. A patient asks the nurse what virtual office visit is. She responded correctly by saying, patients use their smartphones to consult with the healthcare provider's video. Okay, so virtual office visit. And usually it is through video, yes. Pero let's also see the other choices. The nurse communicates with the patient through electronic mail. So hindi enough yung electronic mail lang. Kailangan talaga as much as possible video conference siya. Patients download a software application. So kahit hindi may software application, pwede pa rin maging virtual office visit. A hologram, ito, masyadong into the future, is provided so that the patient and nurse can communicate virtually. So, hindi kailangan ng hologram kapag sinabing virtual office visit. Simple video call pwede na. Okay, so ito yung tinatawag nating telehealth consultations. 83 is Apple. 5, 4, 3, 2, 1. 84, the nurse is updating herself in the current trend in healthcare when she read about nursing informatics. Which of the following refers to nursing informatics? A, it is a science of using nursing knowledge to create applications. Okay, ganito. This is from Kazir, and ito yung nursing informatics definition according sa kanya. So ano yan dito? Which option states that nursing informatics is the science of using computer information systems in the practice of nursing? That is dog. Okay. 84 is dog. 5, 4, 3, 2, 1. Situation. The family of Santos is fond of dogs. A vendor who entered the gate without notice is bitten by one of the pet dogs named Lily. PHN at Shy attends to the vendor. Which of the part of the body of the vendor will be the most affected in the terms of rabies? Okay, so yung rabies kasi, it's a central nervous system disease since it infects the neurons. Okay, so neuroinvasiveness, it is a major defining characteristic of a classical rabies virus infection. So affected talaga dito yung head ng pasyente, yung sa brain part. 85 is dog. 5, 4, 3, 2, 1. To protect the vendor from the dangers of rabies, PHN Shy advises him to clean the wound thoroughly with soap and water, consult a physician, and receive anti-rabies vaccination. Which among the following virus can provide active immunity? Okay. So again, we're looking for active immunity. Okay. So sa immunity, di ba usually may apat tayo dyan, merong natural immunity, artificial, active, and passive. So let's discuss it. Review lang natin onte. Okay? So yung kapag natural immunity, hindi na kailangan gawin siya sa lab. Okay? Para magkaroon ka ng immunity. It's usually from the environment, from diseases, or any natural biological processes. Kapag naman sinabing artificial immunity, galing siya sa labas, it's exogenous, and it is lab-made. Okay? While yung active immunity naman dyan, ang palatandaan ko dyan ay yung A is for antibodies produced by the self. Okay? Yung effect niya, it's not immediate, but long-term siya. Okay? So yung vaccination, artificial active siya kasi gawa siya sa lab, and at the same time, nag-introduce siya ng antigen sa katawan. So ang effect nun, wait lang. Okay. Ang effect nun, nagpo-produce tayo ng antibodies. Okay? Kaya artificial active siya. Ito naman, example to ng natural active, frequent minimal exposure. Kasi naturally, okay, from the environment, nagiging active siya, especially if naka-encounter tayo ng patient, di ba? Kunyari, meron siyang tuberculosis. So, meron siyang disease. Di ba? Natural siya kasi it's from a disease. Ngayon, naging active siya kasi yung Mycobacterium tuberculosis na pwedeng mapunta sa atin in small amounts, doon tayo nagpo-produce ng antibodies. Okay? Ayan, kaya siya natural active. Ngayon, kapag passive immunity naman, antibodies mismo ang binibigay sa atin. So, it is introduced to the self. Yung effect niya is immediate, pero short term lang siya. Nawawala rin siya kaagad. Okay. So, example niyan yung mga immunoglobulin G, which is transferred through the placenta, immunoglobulin A, through breastfeeding siya na-transfer. That is natural from mother to baby. And passive siya kasi mismong immunoglobulin antibodies na yung ini-introduce sa baby. Post-exposure prophylaxis naman, such as anti-tetanus serum, HRIG or yung human rabies immunoglobulin, ayan, tetanus immunoglobulin, antitoxin, artificial passive siya kasi gawa siya sa lab. And mismong antibodies na yung ini-introduce. Okay? So, hinahanap ulit dito ay active. Kanina, napag-usapan natin yung mga immunoglobulin, passive yan. Kasi mismong antibodies na ini-introduce. So, yung active ay yung vaccine and itong 1 and 4. Diba? So, hanapin natin dito 1 and 4. Answer is cat. 5, 4, 3, 2, 1. 87. The vendor acquired rabies. What will PH and Shai do to protect those who took care of him? She should administer. Okay, so dito, ito. Kasi di ba usually, ang iniisip natin dyan, kailangan ibigyan ng pre-exposure prophylaxis kasi hindi pa naman nangyayari yung kagat, ganyan, para sa family of the client who's taking care of him, di ba? But, according to, the manual, yung post-exposure treatment, vaccine ang binibigay dyan, which gives active immunity. Long-term yung effect niya. Well, pre-exposure treatment, passive yan. Immunoglobulin yung binibigay. So, short-term effect. Siyempre, kapag inaalagaan yung pasyente, di mo naman alam kung kailan siya mawawala. Mas mabuti kung long-term effect yung makuha nila. Okay, kaya ibibigay natin post-exposure prophylactic treatment. So, saan dyan yung post-exposure prophylactic treatment? Yung A and yung dog. Ngayon, kanina daw ibibigay kay Bert and the vendor's family. Dapat pala siya ito. Okay, yung PHN. Okay? So, i-administer niya ba yan sa sarili niya? Hindi. So, best answer here is apple. 87 is apple. Okay, 5, 4, 3, 2, 1. 88. PHN SHI's intervention to protect all residents who own pets, especially dogs, should be done by. Okay, so ano yung magkakos ng protection dito para sa lahat? Massive campaign to families not to own pets at home. Negative yung statement, so you won't consider this. Coordinating with city municipal agriculturists. Mali. Massive campaign for responsible pet ownership, pwede. Coordinating with city or municipal officials to make an ordinance on stray dogs. So doon tayo sa mas concrete yung action, okay, to protect all residents, and that is dog. Okay, 5, 4, 3, 2, 1. Lang. Yung sa 76, teka lang ngayon ko lang nabasa. Yeah, walang sinabing perforation. Pero kasi, yung high-grade fever, it may indicate peritonitis and perforation na. Kasi kahagaling niya lang sa endoscopy. May pinasok dun sa intestines ng pasyente. Okay? So baka nag-perforate, kaya siya merong high-grade fever. Kaya answer dito ay A. So 88 na tayo, no? 89. Yung sa NGT kanina, sa gastric surgery, pwede naman siya, it may have NGT or may not have NGT. Okay? Best answer is all of the above kasi pwede yung A and B. Okay, situation. Enrique is a fourth-year nursing student currently having his community immersion in Barangay Pamplona 3. He, together with his professor, is conducting a home visit with one of his patients who is diagnosed with open-angle glaucoma. In the middle of their conversation, the client raised a question to Enrique. She mentioned that she has been prescribed with Latanoprost Salatan by the municipal doctor. She asked Enrique why she has to take this. Enrique responds that this medication. Okay. Okay, so sa letter A, dilates the affected eye. Hindi to yung kung bakit siya prescribe yung Latanoprost. Bale, hindi tayo nagbibigay ng medication para magpag-dilate ng mata ng pasyente, lalo na in an open-angle glaucoma or glaucoma. Okay, bakit? Kasi kapag nagpa-dilate tayo ng mata ng pasyente, yung iris niya lalaki, 'di ba? So, magkakaroon, it will be brought closer. Ayan, ito. It will be brought closer to the angle of outflow, causing further obstruction of the aqueous humor outflow. Okay? Kaya, ina-aggravate niya yung glaucoma. So, hindi tayo nagbibigay ng mga mydriatics. Moistens the affected eye. Hindi naman yun yung main purpose niya. Decrease the angle of glaucoma in her affected eye. And D, decrease the intraocular pressure in her affected eye. Okay. So sa glaucoma, ito yung nangyayari. Glaucoma is characterized by increased intraocular pressure due to the obstruction of the aqueous outflow. So ang mode of action ng Latanoprost is to directly affect this, yung intraocular pressure, increase intraocular pressure. So ang pinaka-purpose niya is to decrease the intraocular pressure in the affected eye of the client. Okay? Dog is the best answer. 89. Dog. 5, 4, 3, 2, 1. C yung 88. Okay, yung sa 88, I will clarify that with the research team, okay? Sige, babalikan ko kayo. Utang yon 88 and 74. Anong pa-SS ulit? Ito. Okay, 5, 4, 3, 2, 1. In utilizing the IMCI protocol, the nurse should initially what? So, di ba, any assessment, ang una muna natin gagawin, tatanong yung patient about chief complaint. So, answer here is ask the mother what is the problem of the child. Okay, bago tayo mag-look for danger signs, identify main symptoms, and observe the condition of the child. Okay, 90 is dog. 5, 4, 3, 2, 1. Situation, patient Gabby admitted with primary impression of leg fracture, was advised to undergo surgery. You are the nurse caring for Gabby. Which of these would you expect in the affected leg? So A, lengthening circumduction. So usually kapag may fracture, walang lengthening, shortening ang nangyayari dyan. Shortening adduction. So adduction, ibig sabihin mas malapit sa katawan yung extremity, and external rotation. Tama to. Warmth on the affected side. Not all may bend appearance, okay? And so malito. Involuntary flexion. Dorsiflexion and bleeding. Not all with bleeding, so mali din to. Okay? Itong shortening adduction, external rotation, usually talaga ito yung nangyayari kapag may fracture. So boy is the correct answer. 91 is boy. 92. Box traction was ordered for Gabby before she undergoes surgery. This intervention aims to, so yung box traction, this is a skin traction. Okay. Realign the fractured bone. So, etong purpose na to, this is for skeletal traction. Skeletal. Ayan. Decrease muscle spasticity. Pwede. How about other options? Promote good neurovascular status. This is actually an intervention for box traction kasi nga skin, di ba? So, kailangan natin i-check yung neurovascular status niya. So, hindi ito yung aim niya. Prevent infection. Wala namang sinabi. Actually, this is intervention din. Okay? Well, wala naman kasing opening dyan kapag skin traction eh. Usually, this is for skeletal traction. Yung prevent infection. Sorry sa sulat. Ayan. Mouse lang gamit ko. So, boy is the best answer. Decrease muscle spasticity by immobilizing the client through the traction. Okay. 5, 4, 3, 2, 1. How can you maintain counter traction in a box traction? Okay, so kapag sinabing counter traction, usually this is the use of the client's weight. Okay? So saan dito yung gumagamit ng client's weight? Place Gabby in supine position. Tama, gumagamit doon ng client's weight. The affected leg is flexed every hour. So as much as possible, kailangan ng immobilization kapag may traction. So every hour pa to, mali. Encourage Gabby to maintain high Fowler's position at most times. So, hindi naman indicated yan. High Fowler, so malito. Usually, supine position talaga. Place weights on the head of the bed with same weight as on the foot of the bed. So, client weight ang sinasabi dito, hindi yung weights na ini-indicate dito sa letter D. Okay, so mali yan. Best answer is A. Place Gabby in supine position. Enough na yon to maintain a counter traction sa box traction. Okay, 5, 4, 3, 2, 1. 94. Which of these actions is an appropriate intervention for patients on skin traction? A. Assess for neurovascular status every 24 hours. So parang ang tagal nito, mali siya. Dapat every 4 hours siya. At least every 4 hours. B. Provide pin site care every 16 hours. Although wala namang pin site dito kasi nga skin lang to. Yung pin site, this is for skeletal traction. Okay? And mali siya kasi dapat every 8 hours to. Masyado nang matagal yung every 16 hours. Remove the traction weights whenever the patient is uncomfortable. So never remove the traction. Magagalit yung doktor. And hindi na may immobilize yung client, di ba? So, mali yung C. Turn patient every 2 hours to the unaffected side. Tama to. And this is to prevent skin breakdown and promote skin integrity. 94 is dog. 5, 4, 3, 2, 1. 95, which is the most important nursing action in caring for Gabby with the box traction? A, provide water to hydrate the patient adequately. So, wala siyang masyadong relevance yung hydration. So, kay kiss yan sa box traction kasi immobilization to. Keep the rope touching the foot of the bed. Dapat yung rope hindi siya nagtatouch sa foot of the bed. Okay? Assessing the skin under the traction at least every 4 hours. Tama. But let's also look at D. Traction can be interrupted if the patient will void. Mali. Dapat hindi talaga ma-interrupt yung traction. So, ang gagawin dito, kasi di ba yung box traction usually sa paa siya? Di ba? Kaya rin nakaremain na supine position yung client to promote yung counter traction. Ngayon, kapag iihi yung pasyente, ang kailangan niya lang gawin, usually may trapeze yan. Okay? Na hinahawakan sa taas. And then, aangat niya lang yung upper extremity niya, lalagyan ng bedpan sa ilalim. And that's how they will void. Okay? No need for the traction to be interrupted. Answer is cat. 95 is cat. 5, 4, 3, 2, 1. Nurse Troy is a staff nurse in the otorhinolaryngology ward in Hospital Y. The following questions apply. Upon assessment of the patient's hearing acuity, the nurse uses the Rhine test. The patient reports that she hears bone-conducted sound longer in the affected ear than the normal ear. So usually kapag Rhine test, compare niyan ang air conduction and ang bone conduction. In this case, mas tagal niya daw narinig ang bone conduction. So BC is greater than air conduction, AC. Okay. What can nurse conclude from the patient's response? So, ito yung wait. Ayan. So, Rhine's test compares air conduction from bone conduction. Yung normal na finding dyan, dapat air conduction is better than bone conduction. Kapag naman conductive hearing loss, bone conduction is better than air conduction. Sensory neural loss, same as normal, air conduction better than bone conduction. In the patient's case, bone conduction is better, kaya that is conductive hearing loss. The answer is dog. 96 is dog. 5, 4, 3, 2, 1. 97. A patient was prescribed with the hearing aid and has been using it for a week. Which of the following condition does the hearing aid problem of the whistling noise indicate? So, yung whistling noise, according to Brunner and Sudart, sa mga may hearing aid, it indicates loose ear mold, improperly made or worn, and worn out. So, saan yun dito? Loose ear mold, yes. Wala namang serum in ear, dead batteries, ear infection na indicated with whistling noise. So, is the answer. 97, apple. 5, 4, 3, 2, 1. Sophia, 21 years old, law graduate. She wants to review for the bar but thinks she's pregnant. She said she has regular menses but does not know when ovulation usually occurs. This have something to do with her fertility period during her last sexual intercourse. Yan. As a nurse, what do you tell Sophia regarding ovulation? Ovulation usually corresponds to the life of the corpus luteum, which occurs approximately. So ovulation, it occurs 14 days before the start of the next menstruation. So that is 14 days before the first day. Answer is dog. 5, 4, 3, 2, 1. 99. The nurse proceeded to take the menstrual history of Sophia to find out if she is likely to be pregnant. Which of the following determines that the date of onset of the last menstrual period? LMP to. It is the So, hindi naman sa duration and character of the LMP nakikita yon. Hindi yan sa implantation building, hindi yan sa spotting. Yan. It is determined with when the bleeding ceases before the last menstrual period. Answer is dog. 5, 4, 3, 2, 1. The nurse also asked about Sophia's secondary amenorrhea that would most likely indicate her pregnancy. Secondary amenorrhea is cessation of menses for more than, okay, usually this is for more than 6 months or longer. Okay, wait lang. Okay, may dalawa kasi yan. May secondary, may primary amenorrhea. So, let's discuss that. So, yung primary amenorrhea, it's the absence of menses at age 15 years old. Okay? Kapag secondary amenorrhea, absence of period for 6 months or longer by someone who had a period in the past. After, ayan, in the past. So, secondary amenorrhea is cessation of menses for more than 6 months after regular menstruation cycle has been established. So, answer here is boy. 100 is boy. Okay, 5, 4, 3, 2, 1. Okay. Teka ha. Gusto niyo ba mag-break? Okay, break tayo. Ilang minutes gusto niyo? 20 minutes. Okay, longer break tayo. Okay, sige. Wait lang. Notes na nakasulat. Ayan. So, 20 minutes, guys. Let's resume at 20 minutes. Wait lang. 7:14. So, 10:14. Yes, 10:14 a.m. Ayan, ay. Pwede ako mag-send ng screenshots mamaya. Ayan, sige guys, break muna tayo. 9:14 resume.
Hi, everyone. Then 14 pala. Okay, 1 minute left. Ayan, 10:14 na. Andito na ba lahat? Recalls 2 na tayo. Ay, recalls na. NV2 na tayo. Ayan. How about yung iba? Dito na ba? Paki-type in nga sa chat. 1. Type nyo 1 if nandito na. Ayan. Okay, marami-rami na pala. Okay, sige. Gina, tara na. Tutulog na. Nako. Tinutulugan nyo ako kayo Wag ganon. Okay, Gina. Recalls 2, nursing practice 2. Okay. Situation. Sarah was rushed to the emergency room when she was discovered to have taken overdosage of sleeping pills. 1. Myths around suicide. But which of these should the nurse take as a reality? Okay. A. Only psychotic persons try to kill themselves. Okay. Ito may definite word na only. So usually ito yung hindi sagot, di ba? And in this case, hindi lang naman psychotic persons ang nagsusuicide. So X to. B. The suicide risk is over when improvement follows a suicide crisis. Not all the time. Okay, not all the time it is over. So okay, X rin to. C. Suicide attempts are manipulative plays. This is wrong kasi it is actually a cry for help. So D is the best answer. 1 is D. 5, 4, 3, 2, 1. Sarah is on an antidepressant treatment. A selective serotonin reuptake inhibitor was prescribed. This medication targets which part of the brain? Okay. So according to research, SSRI targets the prefrontal to RAF circuits in the brain. So sa frontal cortex siya. Boy is the answer. Ayan, 2 is boy. 5, 4, 3, 2, 1. The primary nursing diagnosis of Sarah is, so wala namang binanggit about coping, about self-control, about spiritual distress. Ang minention lang kanina about suicide. So A is the answer, risk for suicide. 3 is apple. 5, 4, 3, 2, 1. 4. All of these are basic suicide precautions, except, so we're looking for something na hindi kasama doon. So, mamark natin siya as negative. Allow the client to have visitors and telephone calls. Positive to. Stay with the client with all medications are taken. Tama. Kasi baka i-omit nila yan. May mga clients na ganun eh. Isolate the suicidal patients. We don't want to isolate the suicidal patient kasi baka matuloy yung pag-suicide niya. Okay? And mag-succeed pa siya. So negative yan. How about the search the client belongings to in his or her presence for potentially harmful objects. Tama. So answer is cat. 4 is cat. 5, 4, 3, 2, 1. 5. Sarah is being discharged after spending 6 days in the hospital due to depression with suicidal ideation. The psychiatric and mental health nurse knows that an important outcome has been met when the patient states. So, something positive kasi yung outcome na meet siya. A. I can't wait to get home and forget that this ever happened. So, gusto niya makalimutan. So, it indicates na parang something is wrong. Parang ganon. So, negative to. I have to leave here soon if I want to make it to the shelter before they run out of beds. So, negative statement to.
I have a list of support groups and a crisis line that I can call if I feel suicidal, positive. Kasi pa-discharge na siya eh. Usually, syempre sa labas ng ospital, wala na dun yung mga nurses, yung mga doctor, ganyan, and other patients. So, usually, out of the hospital, they get isolated. Kaya kailangan ng support groups and a crisis line. And so positive. I feel so much better. If I continue to feel this way, I can probably stop taking my medication soon. So, negative din to kasi hindi lang tayo basta-basta nagsistop ng medication even if the client feels better already. Okay? So, answer is cat. 5 is cat. 5, 4, 3, 2, 1. Situation. Last November 8, 2013, the most devastating super typhoon Haiyan, Yolanda, left behind a path of destruction on 1/3 of the Philippines, claiming many lives and causing unimaginable damages never been seen before. The following are the characteristic manifestation of post-traumatic stress disorder, except. So, mark natin to as negative kasi hinanap natin yung not a characteristic manifestation of PTSD. So, dito, this is a characteristic manifestation, di ba? Usually, in movies, napapansin natin yon. Yung mga clients with PTSD, yung mga soldiers, yan, nagkakaroon sila ng mga flashbacks. This is also a characteristic manifestation. Minsan, unresponsive sila sa surroundings nila. Yung anhedonia, this is also characteristic manifestation. This is the loss of ability to feel pleasure. Okay, ang hindi lang kasama dyan yung extreme attachment with other people, usually found in clients with dependent personality disorder or attachment disorder. Yan, 6 is apple. 5, 4, 3, 2, 1. All but one of the following is not a diagnostic criterion for the diagnosis of PTSD except. So, all but one not except. Tingnan natin yung options. Gawin natin yung elimination method, lalo na sa confusing question na to. Sa mga ganitong confusing statements, okay? Repetitive intrusion, recollection of reenactment of the event in memories. Yes, this is a diagnostic criterion. Numbing feeling, diagnostic criterion. Daytime imagery or dreams, diagnostic criterion. Ang hindi lang diagnostic criterion dito ay onset after 6 months of a traumatic event. Kasi, usually kahit 3 months pa lang, nagsistart na yung symptoms ng PTSD. So, in PTSD, the symptoms occur 3 months or more after the trauma. So, instead of 6, after 3 months. Dapat yan. Okay, 7 is dog. 5, 4, 3, 2, 1. 8. When the nurse is dealing with clients with PTSD, which of the following approaches is inappropriate? So we're looking at something na negative ulit. Kasi inappropriate. Consistent empathic approach to help the clients tolerate the emotional pain. Tama. This is appropriate. Promote and maintenance dependence. Promote dependence on the client. So this is inappropriate. Simple reorienting and assuring statements to prevent suicidal ideations. Tama. Appropriate yan. Trusting relationship to convey a sense of respect, acceptance of their distress, and belief in clients' reactions. Appropriate. Yan. So answer here is boy. Dahil sa promotion of dependence. Dapat ipapromote natin independence. 8 is boy. 5, 4, 3, 2, 1. For victims who refuse to talk, whether angry or remain mute and silent, a nurse should do the following except. So, markahan natin ulit yan ng negative kasi may except. Okay? Hindi natin dapat gawin. Maintain regular contact and greet them. Tama naman to. Acknowledge that you understand they are not to blame. Tama din. Kasi may pinagdadaan yung pasyente. Tell them you will not return to him, so he should as well speak up. Sabihan yung pasyente, kapag hindi ka nagsalita, hindi na kita babalikan, bahala ka dyan. Ganun ba? Hindi. So, negative to. Tell them that you're not upset or angry because they did not talk. Dapat professional. Ayan. So, answer is cat. Hindi natin dapat gawin. Yan. 9 is cat. 5, 4, 3, 2, 1. Ayan. Rehabilitation of children after a disaster may include all except. Okay, so something negative ulit na hindi natin i-include when rehabbing children. Avoid touching, hugging, reassuring them verbally. Okay, kapag sinabing reassurance, this is usually non-therapeutic. Kasi baka yung sinasabi nating reassurance hindi pala tama, 'di ba? So as much as possible, we don't want to reassure. Okay, non-therapeutic yun, negative to. How about the other options? Let's check. Letting the child to be close to adults who are familiar to them, tama. Organize storytelling sessions, singing songs, games, tama. Involve them in activities like drawing, painting, where they can express their emotions, tama. So answer is A. 10 is A. 5, 4, 3, 2, 1. Situation. Mrs. Pauline is an 88-year-old woman who has been hospitalized due to a complicated pneumonia. She has Alzheimer's disease, osteoporosis, and a tendency to wander. She has an IV in her left forearm, which is difficult to establish. Concerned that Mrs. Pauline might pull out her IV and wander off the floor, staff is considering possibility of using restraints on her. The staff is considering the possibility of using restraint. However, she repeatedly declares that she does not want to be restrained. The staff is faced with an ethical dilemma of autonomy versus. Okay, so sa autonomy, di ba, kanina minention ko, it is the ability to choose and to decline a treatment, di ba? So, ang kalaban niyan, hindi yung veracity, because veracity is truthfulness, hindi rin fairness or justice, which is almost the same lang, about equality. It is about the beneficence. Kasi yung beneficence, meaning na ito, for the benefit of the patient, which is yung restraint. Pero dahil nga yung client, may right siya to refuse yung restraint. So nagkakaroon ng ethical dilemma doon. So 11 is Apple. Okay, 5, 4, 3, 2, 1. 12. With the history of osteoporosis, a tendency to wander, which of the following should be a priority? Okay, kapag may osteoporosis, di ba, ito yung nagkakaroon ng weakness, general weakness of the bones kasi yung loob ng bone nawawala. Di ba? And priority din dito yung safety ng pasyente, lalo na she has a tendency to wander, di ba? So, saan dito yung may safety? Hindi naman priority yung sitter. This is not about the patient, yung option na to. Wheelchair privilege commode, medyo unrelated kasi may tendency to wander nga. Prevention of fall, tama. Provision of bedside, di naman. So, cat is the best answer for 12. 5, 4, 3, 2, 1. You're currently planning a recreational activity for Mrs. Pauline. Which of the following would be least likely appreciated by Mrs. Pauline? Okay? So something negative kasi least likely appreciated. D, listening to old familiar music. Positive to. Lalo na kapag familiar. Pwede sila mag-reminisce dyan. Going to family picture album, positive. Singing to or with her, positive. This promotes socialization. Ang negative dito yung A kasi this is age inappropriate. Okay, 13 is A. 5, 4, 3, 2, 1. While creating a care plan for Mrs. Pauline, which of the following interventions should you avoid? So something negative ulit na hindi natin i-include sa care plan. A, providing mouth swabs. Okay, this is okay. Positive to for hygiene. C, hand and body lotion, positive for dryness of hands. Labeling clothing items, positive to para ma-remember ng client. Yung negative dito is use clothing with buttons and zippers. Kasi sa elderly, fine motor skills can be impaired due to tremors. Ayan. So, boy yung best answer. 14 is boy. 5, 4, 3, 2, 1. 15. Mrs. Pauline has a dietary privilege of food preferences. Which question is most effective to communicate with her? Okay. So yung A, which way would you want your egg done? Scrambled, sunny side up, which vegetable mix, or boiled egg? So kapag ganito, ang dami mong question, may possibility maguluhan yung elderly. Kasi they would need to think, di ba? Ang dami mong tanong, maguguluhan sila, mako-confuse sila. So, the best way to communicate food preferences with the elderly is actually to give them options. Hindi mo na sila pag-iisipin ng sagot nila, papapiliin mo na lang sila. Okay, so ito kasi pinag-iisip mo pa sila. So, ito rin. So, best option ay boy. Do you want fried egg or boiled egg? 15 is boy. 5, 4, 3, 2, 1. Communication is an essential aspect in providing nursing care. It is important to know about privilege, communication, and the legal matters surrounding it. Nurse Emil is reading upon privilege communication, communication between which two people is not covered by a testimonial privilege. Okay. Okay, sige, let's discuss testimonial privilege. Lakihan ko lang dito. Okay, so according to the rules of the court, no person may be compelled to testify against his parents, other direct ascendants, children, or other direct ascendants, okay? Or someone na may relationship sila, gaya ng husband, wife, ganyan, healthcare provider, patient, teacher, student, ganyan. Yun yung testimonial privilege. Ngayon, dito sa options, hahanapin natin yung hindi nako-cover doon. Okay, so pwede yung husband and wife, pwede yung lawyer and client. Ang not included dito ay ang between a male and female going steady. Wala silang label. Okay? Hindi pa sure yan. Okay? So, 16, ang answer ay cat. 5, 4, 3, 2, 1. In a testimonial privilege ulit, the right to reveal privileged information belongs to. Okay? So, yung privilege information naman, nire-recognize ng korte na mayroon tayong privilege communication. Ayan, wait lang. The court recognizes a private protected relationship between parties involved where their communications are confidential and they can't be forced to disclose their contents. Okay? So, usually, ang may right lang to reveal the privilege communication ay yung nagsabi ng information na yun. Okay? Right to reveal privilege information. Yung nagsabi lang ng information na yun. So, that is the person who spoke. Okay? Not the clergy, listener, lawyer, hindi yan. Boy. 17 is boy. 5, 4, 3, 2, 1. 18. In which of the following situations does testimonial privilege between health professionals and patients exist? Okay. So, nagkakaroon lang ng testimonial privilege if it is established by the Code of Ethics, hindi. Established by the law, hindi. It is within the social norms, hindi. So it is given already, kahit hindi yan established ng law, merong ganyan. And if both parties agree to it. Okay? 18 is apple. 5, 4, 3, 2, 1. In which of the following situations are privileged communications between a nurse and a patient may be breached, except, so ano daw yung hindi pwedeng i-breach? Wait lang. I-identify na lang natin kung ano yung mga pwedeng i-breach. Okay? Yung privileged communication. Anong mga situation yon? Okay. So, ito ang hinahanap natin yung negative. Yung hindi negative, yung hindi nagbe-breach. Hindi pwedeng i-breach yung privileged communication. Okay. And if the information will cause harm to the nurse, the privileged communication can be breached kasi may harm na. If there is threat in the general health population, kailangan i-breach. So, positive yan. It should never be breached. It can be breached in situations that there's a threat, there's a harm. Okay? So, negative to. If the information will cause harm, this privileged communication can be breached. Okay? So, answer dito is cat. 19 is cat. 5, 4, 3, 2, 1. 20. Nurse Jason disclosed to a co-nurse that your patient is HIV positive. Which of the following actions the patient may do? Usually, kapag may breach of confidentiality, nagkakaroon ng kasuhan. So, the client may sue you for breach of confidentiality. Pwede itong gawin ng client, pero the most probable that can happen, they can sue you talaga. Okay, 20 is apple. 5, 4, 3, 2, 1. Meniere's disease is more common in adults in their 40s, with symptoms usually beginning with the ages 20s to 60 years. It appears equally common in both gender, and most clients have a familiar history of Meniere's disease. Okay, so yung Meniere's disease, it is also called as endolymphatic hydrops. Ayan. And it is the accumulation of the endolymphatic fluid in the inner ear. So it is usually manifested by vertigo. Ito yung most characteristic, tinnitus, hearing loss, and nausea and vomiting. Ayan. So ang question, 42-year-old Maria with diagnosis of Meniere's disease is seen in the clinic. The nurse would expect the client to complain of vertigo, tinnitus, and hearing loss. Okay? Correct answer is boy. 5, 4, 3, 2, 1. The nurse is assessing Maria, diagnosed with Meniere's disease. Which of the following statements by Maria would require further teaching by the nurse? So something negative kasi kailangan pa ng further teaching. I smoke 1 pack of cigarette per day. Malito. This requires further teaching kasi yung cigarette, it contains nicotine, which aggravates the symptoms of Meniere's disease, which is tinnitus, dizziness, vertigo. Okay. So B, when I have vertigo, I keep my eyes open and stare straight ahead. Actually, ang recommended talaga ay to keep eyes closed and do a deep breathing. Okay? Kasi yung vertigo, the disease spells, ayun, parang may spinning movement kahit di ka naman gumagalaw. Yung C, I have continuous low pitch roar in my left ear. This is the tinnitus. I continue to feel dizzy after the vertigo goes away. Tama to. Okay. So, best answer dito ay apple kasi it directly affects the aggravation. Okay, and hindi siya dapat mag-smoke ng cigarette per day. Okay? 5, 4, 3, 2, 1. The nurse finds Maria with Meniere's disease leaning over the sink in the room and clutching it with both hands. After determining that the patient is having an acute attack, which of the following actions should the nurse take first? So, yung priority. Okay, so kanina pinag-usapan natin yung symptoms niyan ay tinnitus, vertigo, di ba? So, pwedeng magkaroon ng falls. Okay, so tingnan natin yung option. Help the patient back to the bed and place a pillow on either side of the patient's head. Tama. How about the other options? Have the patient lie down where he is and check the patient's vital signs and pupils response to light. So kapag nagkakaroon ng vertigo, nakaka-experience of vertigo yung client, syempre nakatayo siya, no? She's leaning over the sink. So kailangan natin siyang pahigain, but dapat hindi gumagalaw yung pasyente kasi that movement would contribute to aggravation of the vertigo. So, wag natin galawin yung pasyente. So, malito. Give the patient an emesis basin. Hindi naman to yung priority. Notify the physician prepare to administer atropine sulfate. Hindi rin. So, first, ang priority ay to immobilize the patient and help them back to the pen for safety. Okay? 23 is apple. 5, 4, 3, 2, 1. 24. During an attack of Meniere's disease, the nurse can most likely anticipate administering which of the following drugs. Okay. So yung corticosteroids tsaka NSAIDs, hindi yan usually ginagamit sa pharmacotherapy ng Meniere's disease. Okay? Ang usually ginagamit dyan, pwedeng diuretics tsaka antihistamine. Yung diuretics, it can help with excreting the excess fluid. Pero best answer dito ay antihistamines because it directly reduces vertigo and nausea by blocking histamines. Okay? So, it directly affects the symptoms presented by Meniere's disease. Okay, 24 is dog. 5, 4, 3, 2, 1. 25. What important client teaching should the nurse provide regarding Maria's diet? Okay. A. Instruct to avoid foods rich in protein, So, mali to actually kasi proteins is allowed naman. Teach the client to read food labels, pwede. Instruct the client to limit salt intake at 2 grams per day, tama. Kasi 'di ba kanina may accumulation nga of endolymphatic fluid sa Meniere's disease. So, since where salt is, water follows, 'di ba? So, kailangan i-limit yung salt intake. So, be encouraged to have fiber diet, not related naman. So, best answer here is C kasi it directly affects nga yung accumulation. Okay? 25 is cat. 5, 4, 3, 2, 1. Sylvie seeks psychiatric counseling for his ritualistic behavior of counting money as many as 10 times before leaving home. An initial appropriate nursing diagnosis is, wala namang sinabi about social interaction, adjustment, and anxiety. Best answer here is ineffective individual coping. Yun yung initial natin na nursing diagnosis. Kasi baka yung client, meron siyang problema sa pagkukope. Kaya, nagkakaroon ng ritualistic behavior. Okay, so, 26, best answer is cat. 5, 4, 3, 2, 1. 27, obsessive compulsive disorder is best described by, okay. So, i-define natin itong OCD. So, sa OCD, may dalawa yan. Yung uncontrollable recurring thoughts, obsession yun. Kapag thoughts, obsession. Kapag behavior, compulsion yung tawag doon. Okay, so dapat yun present. So dito sa A, uncontrollable impulse to perform an act, ritually repeated, compulsion lang to. B, pathological persistence of unwilled thought, feeling or impulse, obsession. Persistent thoughts, obsession lang. Ito naman, recurring unwanted disturbing thoughts, alternating with behavior. So, this is the best answer. 27 is dog. 5, 4, 3, 2, 1. 28. The defense mechanism used by persons with OCD is usually undoing. It is best described in one of the following statements. Okay. Something unacceptable already done is symbolically acted in reverse. Yes, this is undoing. Kasi may ginawa kang mali dati. Ngayon, gumawa ka ng tama para ma-reverse yun. Ay, pangit. Wait lang. Type ko na lang. Undoing. Ayan. Ito naman, transfer of emotions associated with particular person, object, or situation to another less threatening person, object, or situation. Kapag may less threatening, this is usually displacement. Ayan. Unacceptable feeling or behavior is kept out of awareness by developing the opposite behavior of emotion. So, yung opposite behavior yung ginagawa mo. And this is reaction formation. Okay? Consciously, unacceptable instinctual drives are diverted into personally and socially acceptable channels. So, from unacceptable to acceptable, that is sublimation. Okay. So, tinatanong dito, undoing. So, ang answer ay apple. 28 is apple. Okay. 5, 4, 3, 2, 1. To be more effective, the nurse who cares for the person with obsessive compulsive disorder must possess one of the following qualities. Okay. Kasi 'di ba yung OCD, may mga rituals yan. So, ang management ng rituals ng OCD ay through limitation. Kasi 'di ba, yung mga rituals nila usually talaga ano yan, over yung mga rituals niyan. So, kailangan natin i-limit 'yon kasi nakakaapekto na 'yun sa ADLs niya, activities of daily living. Okay? And through that limitation, kailangan consistent tayo sa pag-limit sa client. So, set time and be consistent with implementation. So, yung quality na ma-possess natin dapat dyan ay consistency, cat. 29 is cat. 5, 4, 3, 2, 1. 30. Person with OCD usually manifest. Okay. So, kanina, di ba, may mga obsession and compulsion yung client with OCD. So, that leads to feelings of anxiety in the clients. So kaya nga sila nagre-rituals to relieve that anxiety. 30 is boy. 5, 4, 3, 2, 1. In a psychiatric ward, you're assigned to administer all medications for patients admitted. Proper knowledge of the medications and their side effect is crucial. So which information is most important for the nurse to include in a teaching plan for a male schizophrenic client taking clozapine or clozaril? Okay? Okay, teka. Ito yung no. So usually, yung clozapine kasi it's an atypical second generation, atypical or second generation antipsychotic medication. So its known side effect and should be watched out for is a granulocytosis. It is the decrease in granulocytes or WBCs, leading to a risk for infection. So instruct the patient to report fever and sore throat, which is a symptom of infection. Okay? So saan dito yung may agranulocytosis? It's letter boy. Okay? 31 is boy. 5, 4, 3, 2, 1. 32. What is non-antipsychotic medication used to treat some clients with schizoaffective disorder? Okay. So itong imipramine, tofranil, ito na, for the interest of time. Yan. Imipramine, tofranil is a TCA, antidepressant. Chlordiazepoxide is an anxiolytic. Lithium carbonate, it's a MAOI, antidepressant. And itong, yung phenylzinardil, sorry, is a MAOI. Yung lithium carbonate or lithane, this is an anxiolytic wherein evidence suggests that it is effective for the initial treatment of both schizoaffective disorder and mania. Okay, so answer here is cat. 5, 4, 3, 2, 1. 33. Beatrice, a psychiatric client, is to be discharged with orders for haloperidol therapy. When developing a teaching plan for discharge, the nurse should include cautioning the client against. Okay. So haloperidol is typical or first generation antipsychotic. Kapag first gen kasi, it's a typical. Okay. A, driving at night. Actually, sedation is a side effect of antipsychotic. So pwede to. Ingesting wines and cheese, this is actually for MAOI. Okay? Kasi na-avoid natin yung intake of tyramine-rich foods, okay, that will lead into hypertensive crisis. So sa MAOI to, and it's not for Haldol. Taking medications containing aspirin, unrelated, and aspirin causes bleeding. Staying in the sun. So may photosensitivity side effect din ang antipsychotic. So anong kailangan i-prioritize natin dito? Driving at night or staying in the sun? Ang kailangan dito na i-prioritize ay staying in the sun. Bakit? Kasi yung photosensitivity, it causes skin rash, itching, redness, discoloration, or severe burns. Okay, so 33 is dog. Real was newly diagnosed with anxiety disorder. Okay. The physician that prescribed buspirone or Buspar, the nurse is aware that teaching instructions for newly prescribed buspirone should include which of the following? A warning about the incidence of neuroleptic malignant disorder. So actually, buspirone is an anxiolytic. It's for general anxiety disorder. Okay, etong NMS, it's usually a side effect of antipsychotics and not of anxiolytics. Okay, so X to. A reminder of the need to schedule blood work in 1 week to check blood levels of drug. No blood levels need to be checked. A warning about the drug's delayed therapeutic effect, which is from 14 to 30 days. This is actually correct. So onset of action niya is delayed. A warning that immediate sedation can occur with a resultant drop in pulse. So, wala naman siyang sedative effect. So, answer here is cat. 34 is cat. 5, 4, 3, 2, 1. 35. Which of these medications would cause the least dependence and side effects in a bipolar patient? So, itong benzodiazepine, it's an anxiolytic. Teka. It's an anxiolytic. Samantalang itong SSRI, MAUI, tsaka TCAs, these are antidepressants. Kung tinatanong dito, actually antidepressant kasi yung bipolar, it is the mask of depression. So usually may depression sila. Okay? So we need antidepressants for that. Okay? Ngayon dito, ano yung least dependent daw? Nagkakos ng least dependence and side effects. So yung SSRI, this antidepressant has the fastest action and is the safest. So, may low suicidal tendencies yung mga nagtitake nito. And then yung TCAs naman, tricyclic antidepressant, it is the most fatal due to arrhythmias. Okay? So, answer here is boy. Fastest action and the safest. Okay, 35 is boy. 5, 4, 3, 2, 1. Situation. Nurse is assigned in the ICU of Santa Isabel General Hospital. QI in the ICU is needed to ensure patient safety and effective patient care outcomes. The ICU QI team decided to gather data to determine the probable cause of central line infection among the ICU patients. If you were the member of the quality improvement team, which of the following data will you consider as the most appropriate to yield the most probable cause of the central line infection? So mag-focus tayo sa cause. Okay, ano kaya yung cause ng central line infection? Nurses notes on hourly assessment of the sites of central line. So this is about the intervention, not about the cause. Perform central line care interventions as perform about intervention as well. Incidents of central line infection as reported. So may nangyari ng central line infection. So pwede tayong pumunta doon para ma-determine yung cause kung bakit siya nangyari. So pwede to. How about the daily every shift report of central line care measures? Ayan, intervention ulit. Cut is the correct answer for 36. Okay, 5, 4, 3, 2, 1. In Nurse Carlos ward, 50% of sedated patients sustain at least one fall during their hospitalization. Ang taas noon, 50%. The medicals unit QI team has identified the probable cause of the incidences of fall among their hospitalization patients. With the data analyzed and findings organized, which of the following should the QI team do first? Okay. Kapag ganitong mga prioritization, we can use the ADPI. Okay. So let's see. A, implement. So this is implementation. Brainstorm for a plan. This is planning. Propose a list of nursing actions that identify fall risks. Okay, this is planning as well. Do a pilot study. This is implementation. So dito, mas nauna syempre ang planning before the intervention. Pero dalawa siya. It's either boy or cat. So dito, mas magandang maunang muna mag-brainstorm bago mag-propose ng list. So, answer is boy. 5, 4, 3, 2, 1. 38. Nurse Kenneth's leading group of QI team in the ICU. They conducted a study in the ventilator-associated pneumonia, so VAP. So, ventilator-associated pneumonia is an iatrogenic infection. So, ang cause niyan is usually yung mga infection na ang cause niyan ng infection na yan ay yung mga related sa treatment, ganyan sa machines na ginagamit ganon. So ayan. They conducted a study on VAP incidences among ICU patients. If you are a member of his team, which of the following measures will you consider as the most appropriate to be implemented in collaboration with the respiratory therapist? Okay, tingnan natin. Actually, yung VAP pala, most effective way to prevent it is through extubation. And the main cause is the presence of the ET tube. Okay, so tingnan natin. D, suction endotracheal tube as prescribed in the manual procedures. Usually, hindi na natin to kailangan gawin in collaboration pa with the rescue therapist. So, X to. Hindi na rin kailangan to ng collaboration with rescue therapies. Consider orotracheal as preferred route for endotracheal. Endotracheal na nga eh. So, X to. So, best answer here is apple. Kasi, ayun nga, nagkukos ng VAP, yung possible cause ng VAP, yung ET tube. Okay, so 38 is apple. 5, 4, 3, 2, 1. 39. Nurse Carl studied about the noise level in ICU. Which of the following tools can be recommended to Nurse Carl as the most appropriate to determine the level of the noise in the ICU? Questionnaire with clients and patients as responded, observation checklist, interview scheduled for and with nurses, clients and relatives as interviewees. And of course, ito yung answer. Kailangan natin na accurate na pag-level ng pag-measure ng level ng noise. Okay, kaya gagamit tayo ng measurement device na yan kahit may observation checklist pa. Okay, 39 is cut. 5, 4, 3, 2, 1. Situation. Nurse Venus is assigned in the ortho ward of Del Carmen Medical Hospital. Various orthopedic cases, include RA, rheumatoid arthritis, were encountered. Mr. I, 65 years old, had an acute attack of pain, soreness, and swelling on both knees. He was diagnosed with rheumatoid arthritis. Nurse Venus is assessing the client. Which of the following is most likely to be assessed? Okay. Okay, so rheumatoid arthritis. Ayan. It's a chronic systemic disease characterized by inflammatory changes in the joint and related structures such as the synovial membrane. Okay. Tingnan natin yung option. Ano daw yung most likely na ma-assess natin with client na may RA. So, early morning stiffness. This is actually true. Because yung stiffness na nangyayari sa RA, sa rheumatoid arthritis, it's usually after periods of inactivity. Di ba kapag natutulog, hindi gumagalaw, so pagising niya may stiffness kasi period of inactivity yung sleep. Okay? How about nodules along the knees? There are no nodules. Joint deformities, yes, but only in long-term rheumatoid arthritis. Okay? And it's called the crippling deformity. Yung dog, yes, there's limited motions of the joint, but most characteristic talaga is early morning stiffness. So the answer here is apple. 40 is apple. 5, 4, 3, 2, 1. Mr. Ice is in the acute phase of rheumatoid arthritis. In addition to the prescribed medication, the physician orders application of heat and cold to manage arthritis pain. Which of the following statements indicate that the client lacks understanding in the application of heat and cold? So we're looking for something negative kasi lacks understanding. The heat-producing liniments can be used while applying heat and cold. Tama yan, positive. Heat and cold can be applied as needed. Tama. Hot water bag should be covered with flannel to prevent burns. Tama. Ang mali dito ang apple. Kasi sa heat and cold application, we have to apply wait lang. We have to do cold application for 20 minutes and then rest for 15 minutes tapos hot naman application. Okay, so alternate siya with 15 minutes rest. So this is wrong. Apple is the correct answer for 41. 5, 4, 3, 2, 1. Nurse Venus is helping the client who is immobilized by pain towards self. Liniments. Okay, sige. Babalikan ko kayo dyan. Kailangan ko kasing i-consult muna with the research team every time may mga changes sa answers. Kasi usually sa kanila din ang gagaling yung answer. Sige. Ano yun? Dog. 41 dog. Ay, 41. This is NP2. Sige. Kailangan namin i-unify yung answer. Ayan. Thank you guys for for telling me that. Ayan. Sige. 42 na tayo. Nurse Venus is helping the client who is immobilized by pain towards self-reliance and independence. The nurse should approach the problem with which of the following? So underline lang natin tong self-reliance and independence. Ayan. So the nurse should approach the problem with which of the following? Okay, so we're looking for something positive. Set a specific goal. Yes, tama to. Let's check also the other option. Set a positive attitude toward an eventful outcome. Yes, tama rin naman. Need for a member of the family during the pain episode. So, since pinapromote natin yung self-reliance and independence, negative to. Recognize that little can be accomplished, negative yung statement. So, we're looking at apple and boy as the answer. And ang best answer here is the set a specific goal. Kasi yung set positive attitude dapat given na yan. Okay? Apple is 42. 5, 4, 3, 2, 1. 43. Nurse Venus should note that the client with rheumatoid arthritis will most often have pain and limited movements of the joints. Okay? So, okay, check natin yung choices. Resulting from non-adherence to prescribed diet. Wait lang. Hindi naman yan dahil doon. Yan dahil sa excessive exercise, hindi dahil sa cold weather. As explained kanina, di ba nga, nagkakaroon ng stiffness after periods of inactivity. So, C is the correct answer, cat. Because of inactivity upon waking in the morning, 43 is cat. Yan. 5, 4, 3, 2, 1. 44. To prevent deformities of Mr. Ice, the nursing care plan. Ayan. So dapat positive yung mahanap natin kasi preventing deformities. Massaging the joint with oil liniment. Hindi naman mapaprevent ang deformity kapag ganyan din. So negative. Implementation of strictly prescribed diet, not needed. Performing isometric exercises twice a day. Performing isometric exercises twice a day. Ito isometric exercises na yan, contractions lang yan sa muscle. So it's not that effective in preventing deformities. Okay, so negative yan. Best answer here is alternate rest periods with active exercises. 44 is todo. Teka lang . Ito pala yung nag-iingay. Pinakamaingay ito. Si Ellie. Kita nyo ba? Hindi. Ito siya. Ayan. Dito ka muna, Ellie, ha? Para hindi mag-ingay. Ayan. So, 44 is dog. Ayan. So, 5, 4, 3, 2, 1. 45. Janina has been experiencing musculoskeletal pain. The nurse anticipates that the treatment for this client's level of discomfort will include which of the following. So, treatment tayo dito. And gamot yung mga option. Okay? So, for the benefit of time, ito siya. Yan. So, yung diazepam, teka lang. This can also be used for as an anxiolytic, diba? And also used for seizures to, diba? So not exactly for musculoskeletal pain. Yung meperidine naman, it's an opiate and analgesics for moderate to severe pain. Yung acetaminophen, diba? Musculoskeletal pain, it's the safest and first-line therapy. Yung fentanyl naman, it's an opioid also for moderate to severe pain na yan. So basic lang naman, 'di ba? Usually kapag sobrang sakit na talaga, inuman mo 'yan ng paracetamol or acetaminophen. So answer here is cat. Cat. 45 cat. Situation, you're a nurse responsible and accountable to work toward effectively managing the patient's pain or the lack thereof through assessment, intervention, and patient advocacy. Nurse Will was about to inject the COVID-19 vaccine intramuscularly to another elderly patient. Before injecting, the nurse explained that the client may feel some discomfort. Okay, so kaya sinasabi beforehand para ma-anticipate na ng patient na may discomfort na mangyayari pagka-inject. And that is anticipatory response, CAT. So 5, 4, 3, 2, 1. Yolo, 68, has a history of chronic back pain. He thinks that his family perceives him as a weakling because he often asks for pain medication. Which of the following is the most therapeutic response of the nurse? A, which matters to you more? What will people say, or getting relief from your pain? So this statement actually challenges the patient. So hindi siya most therapeutic. Taking pain medication as prescribed will help you become more active. Pwede to because you're helping Piolo see yung kung ano yung benefit ng pain medication, and yun yung magiging more active siya. See, chronic back pain is very difficult to manage. She's pain medication because this is what it is for. So parang very difficult to manage. May pagka-negative din to, so it's not the most therapeutic. Don't you think your family wants you to be more comfortable and the only way is to take your medicine? Diba? Parang may tinatanong mo pa siya. So it's not the most therapeutic. Boy is the best answer here. Boy. Yan. 47 is boy. 5, 4, 3, 2, 1. Ayan. Sevi has chronic pain due to osteoarthritis but has impaired speech. Which of the following is the most appropriate to determine his medication needs for pain? So kapag ganito, may impaired speech lang naman, pwede mo nang pasulatan yung pasyente. Okay? Ito masyado siyang nag-rely sa sarili niya, observe typical pain behavior through facial expression. Hindi mo man lang tinanong yung pasyente, di ba? So it's not the most appropriate. Ito appropriate siya, asking the client to rate by writing on a magic slate. Medicate the client with analgesics as often as ordered. So hindi naman usually kailangan as often yan, di ba? Usually as needed lang. So X yan. Record frequency of patients complain of pain and administer medication accordingly. So not all the time, di ba? Kailangan ng pasyente. So X rin yan. Best answer here is boy. 48 is boy. 5, 4, 3, 2, 1. 49. Mr. Renz is 65 years old with DM. He complained of elevated blood glucose since he strained his back a week ago, despite following his diet and drug prescription. Your best explanation would be, so kapag ganito, he strained his back, so that causes him to have a physiologic stress, diba? And that leads to, according to research din to, it leads to an elevated blood glucose level kahit na he follows his diet and drug prescription. So the best explanation here is apple. Hindi siya dahil nagko-consume ng more food, ganyan. Hindi rin naman siya usual occurrence, not apparent parasympathetic stimulation. So apple is the best answer. 5, 4, 3, 2, 1. Lola Nene, 76 years old, is living alone. Her married daughter visits her from time to time. She can do activities of daily living with limited assistance. And seems to be independent physically. Wala namang sinabi na nahirapan siya mag-hold ng pen. Anong number ba yun? Wait lang. Tsaka best answer to dito kasi hindi tayo pwedeng mag-assume lang based sa observation, ganyan, and as ordered. Yan. So best answer pa rin tong letter boy. Okay, ulit. She can do activities of daily living with limited assistance and seems to be independent physically. Ayan. Which of the following measures should be recommended to reduce sensory deprivation? So sensory deprivation is the absence of a stimuli. It results to boredom, confusion, irritability, disorientation, and anxiety to a client. So Ano bang pwedeng gawin? Okay? D, invite friends often to share meals at home. Diba? Ito kasi, this include cost pa. Pwede sana to, kaso lang, baka ma-discourage yung pasyente kasi kailangan pang gumastos ng pagkain, di ba? So, X to. Provide pictures of family members. Pwede, pero it's not that effective to reduce sensory deprivation. So, X. Similar to letter C, itong redecorating the house and provide a separate room. Diba? It's not enough. So, ang best answer here is to encourage acquaintances to come to house for a chat. And so, answer is Apple. 50 is A. Okay. 5, 4, 3, 2, 1. Situation, your staff nurse in the psych ward of Seattle General Hospital when we're assigned the following patients. Kika is a patient taking an experimental antipsychotic drug. You have read in her chart that the patient experienced akathisia, causing change in the medication. This is, so yung antipsychotic drugs, marami talaga yung side effects. Okay, and isa doon yung akathisia. Ang palatandaan ko dyan, lalagyan ko lang ng M dito, nagiging akathisia. So kapag akathisia, hindi siya mapakali, so there is inability to sit or stand still. Answer is boy. Okay? 5, 4, 3, 2, 1. Health instructions about haloperidol has been given to Mako while in hospital and before her discharge. Client correctly understood health techniques of nurses when she says, A, I will immediately report any episode of diarrhea or vomiting to my doctor. This is actually a symptom of lithium toxicity. Okay? Ayan. Ito kasing haloperidol, this is, again, an antipsychotic. And ang side effect niya ay photosensitivity. Okay, pero check pa rin natin. So, mali to kasi lithium toxicity to. I will drink about 2 liters of fluids daily and expect to urinate frequently. This is for clients also taking lithium. Kasi yung lithium, it decreases sodium, levels of sodium in the body. Eh kung walang sodium, there's potential for dehydration. So, kailangan na i-increase yung water intake. So, this is for lithium. I will wear long sleeve clothing and sunblock when I go out. Tama, kasi side effect, photosensitivity. I will avoid pizza, any food with cheese and processed meat. This is for Maui. Okay, so answer here is cat. Photosensitivity side effect of Haldol. 5, 4, 3, 2, 1. Okay. So ito yung notes ko noon. Is this from Sir Azardon? I think, yeah. PS CAT-TOG yung side effects of antipsychotic medication. So photosensitivity, sedation, constipation, agranulocytosis. Ayan, kapag sinabi niyang lagyan niyo ng star, nilalagyan ko talaga ng star. Tooth decay, dry mouth, orthostatic hypotension, galactorrhea, EPS, NMS, and tardive dyskinesia. Ayan, yan yung mga side effects, PS CAT-TOG. Okay, screenshot niyo na in 5, 4, 3, 2, 1. Wait lang Haldol, haloperidol, yes, first gen siya. Okay, na-screenshot na to, guys. 5, 4, 3, 2, 1. Okay, 53. While giving chlorpromazine, Thorazine to patient Liberty, Nurse Manoy should observe this side effect. Okay, so yung chlorpromazine, this is a typical antipsychotic. Okay? And yun nga, yung side effect na parang dinaanan natin kanina, ito ang side effects na to. Actually, teka. Isa doon ay yung pseudoparkinsonism. Okay? So, it exhibits shuffling gait and tremors. Pero yung tremors niya, it's pill rolling tremors. Wala naman dyan yung yellow sclery, facial grimacing yan. Best is shuffling gait. So 53 is apple. 5, 4, 3, 2, 1. Christian was also given Thorazine, chlorpromazine for his psychotic episodes. Which side effect should cause nurse to be most concerned? Okay, so chlorpromazine is also an antipsychotic. So, di ba, may photosensitivity. Yan. Pwedeng dahil sa agranulocytosis, yung sore throat fever, decreased white blood cell count. Tremors, inability to stand still. Yes. Pseudoparkinsonism. Low blood pressure upon getting up from bed. Yes. Orthostatic hypotension. Lahat yan ay side effect. Pero ano yung most concerned daw tayo? That is boy. Kasi this already exhibits infection. Okay? 5, 4, 3, 2, 1. 55. Jolly had been taking a typical antipsychotic and had been manifesting shuffling gait. What medication would the nurse expect the client to receive? Okay. Lang. Okay. So usually kapag may psychosis yung pasyente, there is an increase in dopamine and serotonin. Now, antipsychotics are given to decrease dopamine. Kasi kapag may increased dopamine, may problem sa, nagkakaroon ng problem sa control in the disturbances in thought and perception. So, nagbibigay ng antipsychotic to decrease the dopamine para makontrol niya yung mga disturbances na yon. Pero kasi 'di ba, yung antipsychotic, may side effect siya na pseudoparkinsonism. Okay. Okay, teka. Kaya nagkakaroon ng shuffling gait. Okay? Okay, so ano daw yung kailangan na i-expect ng nurse na ibigay sa pasyente? Okay. For the interest of time, siya. So yung fluoxetine, Prozac, it's an antidepressant. Okay? While itong flufenazine, Polixin, it's a first-generation antipsychotic. Nardil is a MOE antidepressant, and cogentin benztropine is an anticholinergic that stops the blockage of dopamine from being released. Okay. So, yung pseudoparkinsonism, masyado na mababa yung dopamine. So, kailangan ng anticholinergics para ma-increase kahit konti yung dopamine. Okay? So, 55 is apple. 5, 4, 3, 2, 1. Patient Maddie asked the nurse to have an out-on-pass privilege for the weekend, but her request was not granted. Was not granted by the nurse. She remarked, I thought you really like me. A therapeutic response of the nurse would be, say, I understand you feel bad, but of course, I like you. So, malito kasi dapat professional pa rin. Okay? B, say, as a matter of fact, your behavior did not meet criteria for an out-on-pass privilege. Pwede to. Never ignore the patient. Okay? Be transparent and express disapproval openly. You upset me with your remark. Parang naging personal naman na to. Okay, so X din to. Best answer here is boy. 56 is boy. 5, 4, 3, 2, 1. The dynamics of behavior underlying manipulative behavior explain that it is a behavior of so ano daw yung cause ng manipulative behavior? Dahil ba may sense of security and control sila? Hindi. Usually nag-cause yan ng insecurity, di ba? And feeling nila wala silang control. Reducing patient's anxiety ba? Hindi. Exhibiting uncooperative and hostile behavior. Yes, tama to. Sensing fear of other people, hindi yan. So best answer here is exhibiting uncooperative and hostile behavior, which explains manipulative behavior. Okay? So 5, 4, 3, 2, 1. 58. Wowie, an elderly client, idealizes some nurses as terrific, the best, or so understanding, but refers to others as mean or different. This behavior can be understood by the staff as avoiding taking responsibility for own behavior and underlying feeling. So, wala namang in-indicate dyan na nag-a-avoid siya ng responsibility, di ba? So, X yan. An understandable behavior for an elderly that must not be taken seriously, pwede to. An invitation to have social intimate relationship with the nurse, so hindi rin yan dahil sa intimacy na nakasulat. Immature and childish behavior, hindi rin negative statement. So, boy is the best answer. 5, 4, 3, 2, 1. Patient Marco with delirium touches the nurse inappropriately. The therapeutic response of the nurse would be 2. So kapag may delirium, usually confusing client and hindi sila aware sa surroundings nila. So we have to orient them, and at the same time, dahil touching yung nurse inappropriately, we have to correct that. Okay, so A, ask for the patient's name and if whether he's aware where he is. So inorient mo lang. Remove the patient's hand while calmly saying, I'm the nurse and this is the hospital. So, in-address mo yung touching inappropriately and at the same time, inorient mo siya. So, this is right. How about C and D? Saying nothing and just go on with the usual nursing intervention. Mali naman yun. Saying your name, I'm Tony, your nurse. So, orientation lang din to. Best answer is boy. 59 is boy. 5, 4, 3, 2, 1. The staff nurses have differing emotional reactions to the use of limit setting. Some staff views it as unprofessionally punitive and uncaring. The most appropriate approach to address the nursing concern is through, so kailangan pag-usapan kapag ganyan. Kasi may differing opinions ang staff. Okay? So, saan pag-uusapan yan? Kailangan ba sa counseling? Hindi naman kailangan. Hindi rin kailangan sa seminar, workshop, sa nursing conference, hindi rin kailangan. Kahit brainstorming session, okay na. 60 is cut. 5, 4, 3, 2, 1. 61. Nurse Maribel observes that the patient in the central ICU is sometimes delirious. She's aware that without protection, the client could fall or be injured. Tama. So which of the following is the least intervention? So underline lang natin to. Please fall or injured as delirious. A, restrain the client to prevent from falling. So, least intervention yung hinahanap natin. And that actually is restraint. Kasi, this should be yung restraint, the last resort. The last resort. Okay? Wait lang. Yan. Okay, so this is the answer. Then let's check then the other options. Give adequate support on turning or moving. Hindi naman siya yung least intervention. Keep the side rails up. Tama din yan. Protect child's head. Tama rin. So yung least intervention dyan is to restrain the client. 61 is apple. 5, 4, 3, 2, 1. The nurse is assigned to the medical ward of Hospital X. Her responsibility as a nurse is to maintain patient safety and prevent harm during the provision of care in both short-term and long-term care. So, safety tayo. Beth is a patient who had undergone hip replacement 24 hours ago. He asked for assistance onto the bedpan. She is placed in an orthopedic bed, and to facilitate the use of bedpan, how should the nurse assist the client? So, ito nga yung sinabi ko kanina, binanggit ko yung about sa trapeze. So, they have to pull on the trapeze and lift their pelvis. Okay? Pero in this case kasi, may hip replacement siya. Okay, tingnan pa natin yung other option. Pero let's consider this. Lifting the pelvis off the bed and turn gently toward the operative side. Assess the client in lifting pelvis. Kailangan i-utilize yung trapeze kasi if wala, kung nurse lang yung tutulong, that is deemed unsafe. Pwede pa ma-injure yung client. Okay? Elevate the pelvis using the trapeze involving the unaffected upper extremity and unoperated leg. So this is the best answer. You must complete to. Dog. 62 is dog. 5, 4, 3, 2, 1. 63. Here's an elderly client is to be discharged after sustaining a sprain from a slip in the bathroom. The doctor asks the nurse how to promote safety In the stairways and hallways in the home, the nurse recommends extra lighting at the stairways and suggests repainting the hallways with, okay, so emphasis dito, elderly yung client. So, nahihirapan i-differentiate ng client yung colors na blue and green. So, hindi to dapat ang gamitin for repainting. Ang mas nakita nila ay red and yellow. So, 63 is apple. 5, 4, 3, 2, 1. 64. Corey, 32 years old, has a disease wherein her olfactory. Yes, okay. Sige, no problem. I will send the screenshots later to Ma'am Bell. Ayan. Corey, 32 years old, has a disease wherein her olfactory nerve was affected. She lives in a thickly populated area and is concerned for the safety of her 3 young children. What measures should the nurse recommend for her home safety? Ayan. So, kung matatandaan natin yung olfactory nerve, this is the cranial nerve 1. 'Di ba sa drawing ng cranial nerves, ang pinakaunang cranial nerve nandito, and that is the nose, 'di ba? So, that is associated with smelling. Okay? So, iniisip natin dito sa question na 'to, baka hindi niya maamoy. Kaya may concerns sa safety. So, baka kapag may sunog, ganyan, hindi niya maamoy. Ganon. So, check the options. Install additional lighting for visibility. Wala namang problema sa lighting. Okay? Participate in the fire prevention training. Kahit mag-participate siya dyan at may problema pa rin siya sa olfactory nerve niya, hindi rin yan makakatulong. Well, makakatulong onte, pero may concern pa rin sa safety, di ba? Mild water temperature, parang unrelated yan. Install smoke detector device. So, kahit hindi niya maamoy na may sunog, meron siyang detector device para ma-detect yan. Ayan. 64, dog. 5, 4, 3, 2, 1. 65. Mrs. Chang asked you during a teleconsultation about her daughter who was newly diagnosed with epilepsy. She asked you what should be a part of your teaching plan for her daughter who is being discharged on a regimen with Dilantin. Which of the following would be your correct answer? Okay. A, reporting signs of infection. This is actually correct. Kasi yung Dilantin, it causes bone marrow depression. So, naapektuhan yung produce ng WBC, RBC, and platelets. That may lead to sore throat, bruising, nose bleeding, ganyan. So, isa na doon yung infection. Report signs of infection, tama. Drink plenty of fluids, medyo unrelated siya with Dilantin. Brushing teeth after each meal, actually tama to. Kasi yung Dilantin, it is known to also cause gingival hyperplasia. So, kailangan i-instruct yung client na magkaroon ng good hygiene, i-massage yung gums, gumamit ng soft bristled toothbrush. Excuse me lang. How about D, having someone with a child during waking hours? Actually, Dilantin causes sedation. So, tama to. Among this, ang pinaka-priority dito is yung safety ng client. Okay? Kasi, lalo na may epilepsy pa. So, baka mag-cause ng falls. Tapos, sedation pa from the Dilantin. So, this is the answer, dog. Answer. So, 65 is dog. 5, 4, 3, 2, 1. You're a nurse that frequently encounters patients with seizures. The following questions apply. During a seminar on seizure which you facilitated, you asked some faculty to do a role play on the management of seizure in the classroom. Which of the following actions, when performed first, indicates that your lecture has been successful? So something positive. Moving the child to the principal's office for privacy. No need yan, lalo na kapag nagsi-seizures, di ba? You don't need to move the client. Placing a padded tongue blade between the child's teeth, baka magkaroon pa ng injury, so hindi yan kailangan gawin. Negative yan. Removing any sharp objects that can harm the child, tama. Asking that other children will happen before the seizure, tama yan. Pero, best answer here is safety. So, cat. 66 is cat. 5, 4, 3, 2, 1. 67. Miss Chris approached you, the school nurse, about what they should do to promote the growth and development of their 7-year-old son, who has just been diagnosed with seizure disorder. You should instruct parents that A, there is potential for a learning disability. Yes, there's a potential. Kasi according to research, there are instances that intellectual ability of the child with epilepsy is affected due to mutation of genes. So, maraming cases niya na kapag may seizure disorder, yung bata, meron din silang learning disability. So, tama to. How about the other options? The child will likely have normal intelligence. So, dahil nga sa research na yun, may chances din na hindi sila magkaroon ng normal intelligence. So, X yan. There will be problems associated with social stigma and home schooling must be considered. Kahit na may social stigma, hindi naman necessarily na homeschooling na agad. So, X na yan. The child will need activity limitation and will not be able to perform as well as his peers. Not needed naman na i-limit yung activity. So, best answer here is apple. Okay? 5, 4, 3, 2, 1. Mrs. Kim has a daughter, Jenny, who has an occasional generalized seizure. She wants her daughter to join a summer camp. Okay, may seizure daw, tapos magka-camp daw. So, Mrs. Kim asked for your advice on planning for the camping experience. Which of the following activities should be avoided? So, among these choices, activities, ayan, ang pinakadelikado dito, that should be avoided? That is rock climbing. Kasi kapag nag-rock climbing yung pasyente and may seizure pa siya, kapag nandun siya sa taas, 'di ba? At nagkaroon ng seizure, pwedeng mag-cause ng fall and maging fatal pa yon. Okay? So 68 is apple. 5, 4, 3, 2, 1. Rubina's mother called via the phone. Rubina was experiencing a febrile seizure. You discussed measures other than a medication to lower temperature of children with febrile seizure. Which of the following statements indicated that the participants understand the topic? So something positive, kasi understand. We'll make the bath water cold enough to make him shiver. This is wrong, kasi dapat yung water, lukewarm water yung gamitin instead of cold. So mali yan. Okay? We'll add extra blankets when he says he is cold. Pwede. We'll do tepid sponge baths for him. This is the best answer kasi kapag sinabing tepid sponge bath, yun nga yung paggamit ng lukewarm water. We'll wrap him in blanket if he starts shivering. Parang same lang to sa boy. So best answer here is cat. 69 is cat. 5, 4, 3, 2, 1. 70. Situation. You're a nurse with an interest leaning into research, which provides a body of knowledge that helps advance nursing practice. The following questions apply. You're assisting in a research study on assessing patients' reactions to the use of a new NGT material. A medical student questions the credibility of the nursing research. So kapag sinabing credibility, it's the quality of being trusted or believed in. So, kina-question niya kung kailangan bang paniwalaan yung nursing research, ganyan. So, as a nurse, we should never just keep quiet. So, B, doing research is one of the competencies of professional nurses. Tama naman. Pero, you have to persuade the medical student kasi why we need to do nursing research. So, eto kasi parang sinasabi, it's part of our competencies, ganyan. Kailangan natin siya gawin. Parang it's not as persuasive. C, nursing practice is based on research findings. So, this focuses on the nursing practice and not on the nursing research, diba? How about D, nursing research is essential for the development of nursing science. So, sinasabi dito yung purpose of nursing research. So, D is the best answer. 70 is dog. 5, 4, 3, 2, 1. 71. Nurse Margot discusses about research utilization in the ward class. Research utilization is an important aspect of safe quality care provided by the nurse to her patients. So from the word itself, research utilization ibig sabihin research use. So this refers to the, okay, kapag research utilization, yun nga, about the use. So ito, the development of nursing knowledge to improve clinical practice. This is not about the use. The application of research findings into clinical practice, tama. The integration of best research evidence. Kapag sinabing integration, parang you coordinate the research findings, ganyan. The research evidences. It's not about the use. The application of tested theories in the care of patients. So, sinabi niya dito, tested theories. Ito kasi mas specific, research talaga, research findings. So, best answer itong boy. 71 is boy. 5, 4, 3, 2, 1. Nurse Margaret discusses about qualitative research. Which of the following research methods has for its purpose to describe social processes present in the human interaction? So, ito. Yan. So, yung phenomenology, it's more on the experiences and meanings of these experiences. Participatory action research, this is the research in the community. Grounded theory, dito ginagawa yung pag-generate ng theory relating to social processes. Yung case study naman, it is an in-depth investigation of a single entity or small number of entities. So, social processes, yan. Grounded theory is the correct answer. 72 is cat. 5, 4, 3, 2, 1. 73. In clinical question, is breastfeeding more effective in increasing the birth weight of the preterm infant than adding corn oil to the infant formula? What is the intervention of interest? So kapag sinabing intervention, syempre, yung breastfeeding, kasi it's either, wait lang, is breastfeeding more effective in increasing the birth weight? Oo, ito yung parang kino-compare mo sa adding corn oil to the infant formula. Okay, kung mas effective ba daw siya yung breastfeeding. So that is the intervention of interest. The answer is apple. 73 apple. 5, 4, 3, 2, 1. In research question, what is the relationship between wound healing and nutrition among elderly patients with hip surgery? Which one of is the dependent variable? Okay. Kapag sinabing independent, it's the cause. Okay, so the cause dito, kung i-analyze nyo, yung nutrition nakaka-affect siya sa wound healing, kung mabilis ba or hindi mabilis yung wound healing, ganyan. Now, the dependent variable, it's the effect, and that is wound healing. Kasi naapektuhan siya ng nutrition. Okay? So, answer here is wound healing dog. 5, 4, 3, 2, 1. 75. Mona recently passed a nursing licensure examination. Which of the following situations will have her liable for misrepresentation? Okay, kapag sinabing misrepresentation, you're representing yourself, you're representing as other than yourself. Okay? So tingnan natin. A, if she administers phenytoin to a wrong patient, malpractice yan. If she uses her husband's license when she signs off her chart, yes, this is misrepresentation. Kasi, nirepresentan niya na siya yung husband niya. Okay? Using fake certificate and license for applying in different hospitals. So, parang nagsinungaling siya. Pwede itong dishonesty or fraud. So, boy ay misrepresentation. 5, 4, 3, 2, 1. Situation, Parkinson's disease is a slowly progressing neurologic movement disorder that eventually leads to disability. Although the cause of most cases is unknown, research suggests several causative factors, including genetics, atherosclerosis, and etc., and some environmental exposure. Parkinson's disease, a progressive neurologic disorder, is characterized by, so kanina, pinag-usapan natin yung Parkinsonism. Parkinson's disease is similar, has a similar characteristics to Parkinsonism. Okay? Ito. Ayan. So Parkinson's disease or paralysis agitans, it affects the extrapyramidal system, which is a part of the brain, leading to decreased dopamine production. Okay? So dito, sa muscle rigidity, actually kasi yung dopamine, it promotes muscle relaxation. So kapag decrease yung dopamine, di ba, sa Parkinson, so walang muscle relaxation, it's more of contraction. Kaya nagkakaroon ng rigidity, tremors, and bradykinesia, or yung mabagal na pag-move. Ayan. So, all of the above yung sagot dito. 76. 5, 4, 3, 2, 1. 77. The client is on anti-Parkinsonian medication which acts releasing dopamine from the neuronal storage sites. This antiviral agent used early in the Parkinson's treatment is. Yan, kasi nga diba, Parkinson's decreases the dopamine. Kaya, kailangan niya ng medication to counter that. Okay. Lakihan ko lang konti. Ayan. So Artane is an anticholinergic. It is used but not in the early treatment. Kasi sabi dito, used early in the treatment of Parkinson's disease. Okay? Yung Simetral naman, it's dopamine agonist. It is, yes, for the early treatment. It is used but for the early treatment. So this is the answer. Simetral. Yung C naman, it's an antihistamine. It increases the dopamine. Pero kasi, ito kasing Simetral, mas direct na siya. It's a dopamine agonist. Ito kasi, kailangan niya pang maapektuhan yung histamine. Okay? Elavil is a TCA. So, ito naman, it doesn't release dopamine, but instead, yung paggamit nito, yung history of use nito, linked siya with the occurrence of Parkinson's disease. So, answer is boy. 5, 4, 3, 2, 1. Ayan. The nurse will administer benztropine 1 milligram per RM daily, which finding suggests its desired effect. Okay, so yung benztropine, ayan, or cogentin, it's an anticholinergic blocking acetylcholine receptors. So, wait lang. Okay, so through that, nalilesen yung stiffness or rigidity of the muscles. Kaya, ang sagot dito, ang desired effect dito ay decreased muscle rigidity. Lalo na, patient natin dito, pinag-uusapan natin dito is Parkinson's disease, diba? So, ang characteristic effect talaga nun, yung effect ng dopamine, decreased dopamine is yung rigidity. Kaya yun yung i-decrease natin. Boy. Boy yung correct answer. 78 is boy. 5, 4, 3, 2, 1. 79. The client finds the resting tremor he is experiencing in his right hand very frustrating. Yan. The nurse will advise this client to take diazepam as needed. Hindi kailangan ang medication kung pwede naman tayo may ibang masuggest. Okay? Practice deep breathing. Hindi rin tong warm bath. And the answer here is to hold an object. So yung tremor sa Parkinson's disease, it's called the pill rolling tremor. And the reason behind that is we encourage the client to roll a pill sa hand para ma-decrease yung tremors. Okay, so 79 is apple. 5, 4, 3, 2, 1. 80. A patient with Parkinson's disease has a nursing diagnosis of impaired physical mobility related to neuromuscular impairment. You observe a nursing assistant performing all of these actions. For which action must you intervene? So we're looking for a negative action here kasi kailangan mo pang i-intervene, di ba? Then I assist the patient to ambulate to the bathroom and back to the bed. Okay naman, wala namang masama doon. The NA reminds the patient not to look at his feet when he is walking. Tama, kasi baka matumba yung client. The NA sets up the patient straight and encourages patient to feed himself. Yes, this is to promote independence. The NA performs the patient's complete bath and oral care. So this is negative kasi yung NA na gumagawa ng lahat. Pwede namang I know may impaired physical mobility siya, pero you still have to encourage the client kung ano yung kaya niya, 'di ba? Hindi ka pwede mag-assume na hindi niya kaya lahat. Okay? So D is the correct answer. 5, 4, 3, 2, 1. Situation: Barry, 35 years old, driver, experienced fatigue, visual disturbances, and paresthesia in his arms and legs. He later developed spastic paralysis of the legs. His physician says he has multiple sclerosis. Upon assessment, a nurse should address which of the following behavior related with the disease. Okay? So dito, ano daw yung kailangan nating i-address? Okay. So coping ba, actual potentials and needs ang i-address, lifestyle, plan for the future. Okay, syempre, kung ano yung needs niya, yun yung mga kailangan natin i-address, both actual and potential. Okay, so boy is the correct answer for 81. 5, 4, 3, 2, 1. At saka pala, it's holistic na, di ba? Kung may need siya sa coping, sa lifestyle, sa plano niya in the future, ayun. Okay, so 81 boy. 5, 4, 3, 2, 1. 82. The client is concerned about his fluctuating physical condition and generalized weakness. What is the priority? Nursing intervention for Barry. A. Teach measures for activity limitation. We don't need to limit the activity of the patient or to restrict the activity of the patient. Kahit na may generalized weakness siya. And usually kasi, di ba si Barry may multiple sclerosis siya, meron siyang fatigue. So yung fatigue niya hindi lang simple. As in, kahit konting galaw lang, napapagod na siya. So in that case, kahit na ganun, hindi natin kailangan i-limit yung activity or i-restrict. So hindi to yung priority, A and D. Have an immediate family member stay with him. Pwede. Pero ang concern kasi is weakness. And then, yun nga, may fatigue nga si Barry dahil sa MS. So we have to space activities throughout the day. Okay? Ito din, activities yung pinag-uusapan dito. Ayan. So, cat is the best answer. 5, 4, 3, 2, 1. During exacerbation of MS, Barry will experience which of the following? So, teka. Okay. So sa MS, walang sudden burst of energy kasi nga 'di ba may fatigue sila. Resting tremors, wala silang resting tremors. Yung tremors nila, it's usually precipitated by movement. So kapag mag-move sila, may tremors. Boy, mental retardation unrelated, wala namang ganyan sa MS. Diplopia and nystagmus, yes. Barry will experience this during exacerbation. So yung multiple sclerosis, may epekto siya sa eye. Ayun, may epekto siya sa eye. So pwede siyang magkaroon ng nystagmus, which is the repetitive uncontrolled movement of the eye, and vision loss, such as tsaka diplopia, in double vision. Okay, so 83 is apple. 5, 4, 3, 2, 1. Mr. Barry experiences bladder incontinence. Which of the following should the nurse do? So kapag bladder incontinence, ito hindi niya napipigilan yung ihi niya. Okay, so pwede siyang biglang maihi. So what should the nurse do in this case? A. Limit fluid intake to 1,200 ml per day to 2,000 ml per 24 hours. So this is not needed kahit may bladder incontinence. Di ba kapag may bladder incontinence, kailangan lang i-exercising muscles ng bladder. So kailangan dyan, magkaroon ng bladder training. Hindi kailangan ng indwelling catheter, hindi rin kailangan ng antibiotic. So, establish lang tayo ng regular voiding schedule and then doon yung bladder training. Okay? 84 is CAT. 5, 4, 3, 2, 1. 85. Nurse is preparing Mary for discharge from the hospital. Which of the following is an appropriate instruction? So, ito si Barry. Teka. Siya yung may multiple sclerosis. Okay. So, keep active, less stressful activities and avoid fatigue. Tama to kasi nga may fatigue nga yung MS, di ba? Learn to use walking aids in anticipation of future disabilities. Hindi naman kailangan. Observe quiet and active lifestyle. Kailangan natin ng active lifestyle. Maintain good health habits and regular exercise. So sa client with fatigue, usually yung regular exercise, it is limited kasi baka mas lalong ma-aggravate yung fatigue ng client. So kahit active lifestyle na, okay lang. Okay na. So 85 is apple. 5, 4, 3, 2, 1. Ay. Teka lang. Situation. Badong, 35 years old male diagnosed with delusional schizophrenia is on pharmacotherapy as part of medical management. Ayan. So an order of chlorpromazine, antipsychotic, was given to Badong. As a responsible nurse, Aya is reviewing the nurse's notes, which assessment would alert her as the most serious side effect of this drug. So postural hypertension, as mentioned, yes, it is a side effect. Tingnan pa natin yung iba, photosensitivity side effect into decreased libido. And ang most serious side effect dyan ay yung granulocytosis. Kasi itong postural hypertension, once na nag-stabilize na yung pasyente, pwede nang mawala yung hypotension. Okay? Ayan. So, dog is the answer for 86. 5, 4, 3, 2, 1. 87. Which of these written notes by the nurse on the Cardex would need further discussion on nursing actions related to antipsychotic medications administration? So, antipsychotic ulit. A. Teach the patient about expected extrapyramidal effects. Ang kailangan natin dito, further discussion. So, something negative. Okay? About the antipsychotic medication. So, this is positive kasi we have to teach the patient about the EPS side effects. Monitor the patient's blood pressure. Pwede for the orthostatic hypotension. Give parenteral meds only when the patient is properly restrained. So, hindi kailangan i-restrain yung client. So, negative yan. Check to make sure the client does not hide medication. Pwede. Okay? So, best answer here is CAT. 5, 4, 3, 2, 1. Yung ibang mga clients, hindi nila tinitake yung gamot nila. Minsan, kaya kailangan pa i-inspect yan ng nurse sa mouth. Okay? So, D is possible talaga. And correct. 87 is CAT. 5, 4, 3, 2, 1. 88. With the administration of chlorpromazine, ay wait lang. Ayan. Ulit. 88. With the administration of chlorpromazine, which is an antipsychotic, the client complains of dry mouth and constipation. Which appropriate intervention should nurse Aya write in the nursing care plan? Ayan. So a question the client about amount and type of his daily exercise. So this is unrelated. Yan. Encourage the client to rinse mouth with water and drink 6 to 8 glasses of fluid each day. Yes. So itong rinsing mouth with water, this is for the dry mouth. Yung drink 6 to 8 glasses of fluid each day is for the constipation. Kasi one of the major causes of constipation is dehydration. So to prevent that, we have to drink 6 to 8 glasses of fluid each day. C. Consult with a physician about changing the antipsychotic medication. Mali yan. Advise the client to chew sugarless gum and eliminate gas-forming food. Itong chewing of sugarless gum. This is recommended actually for dry mouth. Kaso lang, ito, eliminate gas-forming food. Ang main purpose nito is to para hindi mag-feel bloated yung client. It's not directly parang solving the constipation or helping treat the constipation. So, ang best answer dito ay boy. Okay? 5, 4, 3, 2, 1. During nurse-patient interaction, the client states that the ants are crawling all over her body. You would document this in which part of the mental status. Okay, so dito, di ba yung crawling, it's a sensation. So it's not about the emotions, it's not about talking, it's not about thought. It's about sensorium. Okay, so dog is the best answer. 5, 4, 3, 2, 1. 90. For proper documentation and accountability of all entries to the client's chart, it is important for Nurse Aya to inspect that. Anong i-inspect? Staff must, so wait lang, emphasis lang on proper documentation and accountability dito. The staff must not abbreviate soap. Pwede naman, actually, especially, ayun, especially, alam naman natin yung SOAP, di ba? Yung Subjective Objective Assessment Plan. So, wag lang natin to i-abbreviate kapag sinabing wag i-abbreviate. Tsaka, policy siya na wag mag-abbreviate. Ayun. B, client's problem in the medical record must bear date of entry and numbers of client's problem. Pwede. All notes must have signatures and title of the person making the entry. Tama to. Kasi emphasis dito nga sa accountability, kailangan may signature and title ng nagsusulat ng entry na yon. Nurses implement the use of problem-oriented progress notes. So, mas okay itong answer na to. Kasi it shows proper documentation and accountability as well. So, 90 is cat. 5, 4, 3, 2, 1. Situation. Drogo, 50, male, client arrived in the emergency room with complaints of frequent headaches, left side body weakness, and difficulty in balancing. An MRI was conducted and result shows a brain tumor. Okay, patient Drogo has undergone a supratentorial craniotomy to obtain tissue sample for biopsy. What immediate nursing action should be done after the procedure? Okay, so dalawa yan actually kapag kumuha ng biopsy. Okay, dalawa yung craniotomy. It can either be supratentorial or infratentorial. Kapag supratentorial, dito siya sa front part of the head. Kapag infratentorial, dito sa ilalim. Okay. So, what immediate nursing action should be done after the procedure? Okay, A, lying flat in the bed. Actually, itong lying flat in the bed, this is for infratentorial craniotomy. Kapag sinabing for the positioning of the client after supratentorial craniotomy, ang recommended ay semi-Fowler's. Ay. Type ko na lang. Ayan, semi-Fowler's kapag supratentorial craniotomy. Buhay neurologic checks and vital signs every 4 hours. Tama, pero it's not an immediate nursing action. Okay, so we will not consider that. Limit fluids to 1.5 to 2 liters in 24 hours. This is actually correct to prevent cerebral edema and prevent increasing the intracranial pressure. Okay, so we have to limit fluids. Allowing no pillows under the head. Actually, pillows are allowed because it reduces ICP. Okay, so answer here is cat. 91 is cat. 5, 4, 3, 2, 1. Okay, sige, yung mga taga-Unciano colleges, isi-send ko na lang yung screenshot. Thank you. Okay. Drainage on a craniotomy dressing must be measured and marked. Which of the following should be reported by Nurse Khalil immediately to the doctor? Okay, kapag ganyan, Nurse Khalil should immediately report a bloody drainage kasi this may indicate hemorrhage. Ayun, hemorrhage, which is an emergency. So, 92 is apple. 5, 4, 3, 2, 1. 93, neurologic assessment should be performed every hour after the procedure to monitor an increased intracranial pressure. Using the Glasgow Coma Scale, which of the following score indicates that the client Drogo has the best neurological function? Okay, dito, eye-opening is 3, motor response is 8. Sumobra na siya kasi yung eye-opening, it's just until 4, verbal is until 5, motor is until 6 only. Okay, itong motor nag-exceed na siya. So, mali yan. So, eye-opening, nag-exceed na rin yung eye-opening, mali na to. Option. Eye-opening is 4, motor is 6, verbal is 5. Tama. How about this one? Eye-opening is 6, nag-exceed na siya. So, best answer here is cat. 5, 4, 3, 2, 1. Nurse Khalil must stay alert for signs and symptoms of increased ICP. Which cardiovascular findings are late indicators of increased ICP? So, ito. Ayan. So, ang earliest usually is altered level of consciousness. So, yung restlessness, confusion, sleepiness, disorientation, ganyan. Samantalang yung late naman, yun yung Cushing's triad. So, there's rise in systolic BP, bradycardia, bradypnea, and a widening pulse pressure. So, saan yan dito? Lang. So, rising blood pressure and bradycardia, tama to. Hypotension, dapat hypertension to, so mali. Hypertension and narrowing, dapat widening pulse pressure. So, answer is apple. 5, 4, 3, 2, 1. 95. To evaluate the extent of the increasing ICP, Nurse Khalil alerts the client for Doll's eye reflex. When the nurse turns the client's head to the left, the client's eyes remain in the right. This may indicate. Okay. So for the findings of Doll's eye reflex, yeah, so it's also called as the oculocephalic reflex. It is for unconscious patients only. So normally, yung findings niya, yung eye, ay tinatawag na positive. So, ibig sabihin nun, brainstem is preserved. So, makita natin sa pasyente na hindi siya sunod sa movement. Okay, so dito sa situation na to, sa question na to, the eyes remain in the right side. So, hindi siya sumunod. Okay, so normal siya, positive. Answer is letter D. Okay. Kapag negative naman, brainstem is affected, so nag-follow siya sa movement. Kung nanggaling siya sa left, papunta sa right, hindi nag-remain sa left yung eye ng pasyente, pumunta talaga sa right. So 95 is dog. 5, 4, 3, 2, 1. Situation, Fabian, 35 years old, has been admitted to the psychiatric unit because he has been negligent of his personal hygiene, withdrawn himself from relating with others, seemed to have a world of his own. He was observed to be talking to himself. During the nurse's rounds, Nurse Ariel observed that Fabian is lying on his bed in fetal position, covered face with foul-smelling body odor. Nurse Ariel noted this behavior as a state of. So kapag ganito, matanda na siya, tapos naka-fetal position siya, it's usually a sign of regression. In Fabian's case, it's severe regression. Okay, 5, 4, 3, 2, 1. In order to establish trust with Fabian, which of the following approaches is most important to consider? Assign him to the friendliest nurse in every interaction. Hindi naman necessary. Assign to male nurse, not necessary. Have a nurse who portrays as a parent, not necessary. Have a nurse interact with him in every interaction. So same nurse, consistency, diba? Promotes trust. Okay, so 5, 4, 3, 2, 1. 98. Fabian remained aloof for several days, and the nurse had difficulty relating to him because he was often agitated, incoherent, and irrelevant in his thoughts. Okay, medication was started. Which medication will the psychiatrist recommend? So si client, he is exhibiting symptoms of depression. Okay, hindi siya manic, hindi siya psychotic, hindi siya anxious. But, yun nga, depression nga. So, SSRI is an antidepressant. Okay, so dog is the correct answer for 98. 99. Nurse Ariel is conducting health teaching to Fabian about newly prescribed SSRI antidepressant for the treatment of depression. Which of the following points should Nurse Ariel to dapat include in her teaching plan? This drug acts to increase the level of mood, elevating chemical in the brain called serotonin. Tama to? Positive. So, we're looking for something positive here kasi dapat i-include daw sa teaching plan. Number 2, this drug acts quickly, so feelings of depression will decrease in a few days. This is negative. This is wrong. Kasi, ang onset niya pa is 2 to 4 weeks after. So, kailangan mag-wait. Manny should avoid alcohol or taking antihistamine medications with this drug. Tama to? Like any drug, kailangan i-avoid yung alcohol when taking it. Okay? Lang. If Manny finds it difficult to sleep at night during intake of the medication, he can try it in the morning. Manny should have a special diet. Hindi naman kailangan ng special diet. So, dito kasi, yung number 4, it's questionable kasi SSRIs are known to help sleep and improve mood. So, kung hindi siya makatulog, kailangan lang siya mag-take ng medication. Okay? Ayun. So, tingnan na lang natin yung mga positive. 1 and 3. So, saan dito yung may 1 and 3? 1. 1 and 3. So, eto. It's either, hindi to pwedeng number 2, di ba? Hindi rin pwede to, number 2. Walang number 5. So, best answer here is cat. Ayan. 5, 4, 3, 2, 1. 100. Given a client like Fabian, which of the following is a common nurse's behavior during the initial phase, which is the orientation of the nurse-patient relationship, which nurse area should be aware of? So usually, nangyayari dyan ang ambivalence, which is mixed feelings. Kasi kakamit nyo pa lang, di ba? So, 100 is apple. Okay. 5, 4, 3, 2, 1. Okay. Yung distrust kasi, negative statement siya eh. As much as possible, kung may positive naman sa options, yun yung piliin natin. Which is ambivalence. Neither negative, neither positive din. Kasi mixed feelings siya. Yung withdrawal, usually it's in the terminal phase. Ayan. Yes, break na tayo. Lunchtime. So, for our break, 20 minutes ulit. Okay lang? Okay. Sige. 1 hour? Wala na, tapos na yung ano. Wala na, tapos na. Hanggang 1 lang tayo. Ayan, may remaining 50 questions pa tayo. Okay, so let's resume at 12:24. Ay, 12:26. Okay, 12:26. Thank you guys. See you later. Hi, everyone. Yeah, 12:26 na. Nandito na ba lahat? Paki-type nga 1 ulit. If nandito na kayo. Okay, marami-rami na. Sige. Konting kembot na lang, 50 items. Teka. Yes, NP3. Open ko lang. Ayan. Yung first half. Okay. Sige, start na tayo guys ha. G? G. Okay, sige. Situation. Nurse Connie knows that it is her primary task to ensure that every child is well equipped with the necessary materials against known infections. Nurse Connie is handling Barangay Tabora in Bailen, Cavite. With a total population of 3,200, the following questions apply. It was noted that there were 700 infants in the area. How many patients can be computed as part of the eligible population for vaccine requirements? So, bonggang-bongga yung NP3, no? First question pa lang may computation na. Ayan. So, ito yung formula for eligible population. So, magkaiba yung computation for infant and pregnant. Yung 2.7 tsaka 3.5 dyan, constant yan. Okay, so since infants yung given dito, we will be using the formula for the infants. And that is 700, yung total population, times 2.7%. So kapag mag-multiply tayo, just move the decimal point 2 places to the left. So, magiging 0.027 siya, yung i-multiply sa 700. And the answer should be 18.9. Okay, round up mo yan, magiging 19. So the answer should be C, cat. So 1 is cat. Okay? 5, 4, 3, 2, 1. 2. Given the eligible population, what would be the computed vaccine requirement for the year for DPT? So, ang hinahanap natin dito yung annual vaccine required for DPT. So, ang formula naman dyan yan, ito. So, eligible population, yung kanina, 18.9, times number of dose, DPT doses ay 3, and yung wastage factor. So, ito yung formula for wastage factor. Pero para mas madali, meron na ditong given dito sa table na to ng wastage factor. Kapag BCG, it's 2.5, MMR or measles 2, Hepa B, 1.11. Balik po, ma'am, sa number 1. Okay, sure. Ayan. Ito yung computation dyan. Okay, 5, 4, 3, 2, 1. Okay, balik tayo dito sa number 2 na, ha? Ayan. Okay, so ito na nga yung sa wastage factor. So kapag hindi kasama dito, other vaccine siya papasok and the wastage factor is 1.67. Since DPT is not here, dito siya papasok sa other vaccine. So times 1.67 equals 94.689 or 95. So the answer here is boy. Okay, 2 is boy. 5, 4, 3, 2, 1. Okay, next 3. A group of pregnant women was also noted to be low immunization to tetanus. The total population of all pregnant women were 400. How many were eligible? So again, ito yung formula and pregnant women na tayo. So given ito is 400. So 400 times 0.035 and the answer is 14. So 3 is cat. Okay, 5, 4, 3, 2, 1. Next. Given the eligible population, what would be the computed vaccine requirement for the year for tetanus? So again, ito yung formula dyan. Yung eligible population natin kanina is 14. 5 doses yung tetanus, so times 5, times yung wastage factor niya, which is 1.67. The answer is 116.9. And if i-round up yan, the answer is boy. Kailangan sa calculator mo, 3.5%. Huwag mo kakalimutan pindutin yung percent. Kasi kung i-multiply mo lang siya ng 3.5, iba yung sagot. Okay. Kasi may nagtanong dito, ma'am, paano po kapag 3.5% ang gamit? Same answer po ba ang lalabas? Ayan. Okay. Okay, ayan. So 4 is boy. 5, 4, 3, 2, 1.
Si Kuya, balibag ng pinto.
Kuya. Yung pinto na, labi niyang binabalibag na ano.
Ayan. Number 5. What is the wastage multiplier of tetanus given that an ampule can give 20 doses and that the number of doses used is 3? Okay. So dito, ang hinahanap natin dito ay wastage multiplier or yung tinatawag na wastage factor. So ang given dyan ay yung used dosage is 3 daw. Ayan. Ang given ay 20 doses. So ang hindi nagamit or ang total wasted dose ay 17. Okay? So dito sa wastage rate, ito yung formula niya. Total wasted dosage, which is 17. Ayan, 17 divided by number of doses administered is 3 plus 17. Okay? Times yung multiplier, which is 100. So kapag dinivide yan and minultiply, magiging 85% yung sagot. And gagamitin natin yan dito sa pagkumpute ng wastage factor or wastage multiplier. So 1/1 minus, again, i-transform to into decimal point yung percent, magiging 0.85, magiging 1/0.15, and ang final answer ay 6.67. Kung i-round up yan, ang magiging sagot ay boy. So, 5 is boy. Walang lumabas na ganito sa board exam namin dati, pero kinabusado ko pa rin. Saan po nakuha yung 17? Ito siya, kasi diba yung total wasted dose is stock dose minus used dose. So, 20 minus 3 is 17. Okay, kaya yung total wasted doses kasi hindi siya nagamit. Yung available mo is 20. 3 lang nagamit mo. So, hindi mo nagamit yung wasted 17. Okay? Ayan. 5 is boy. Okay. 5, 4, 3, 2, 1. Nurse Katrina is a newly hired staff nurse in Batong Mahiwaga General Hospital. She is learning about the guidelines in their hospital regarding documentation. The following questions apply. Nurse Katrina observed that her senior nurse is documenting nursing care for the morning shift. She writes the patient's normal findings, problems, and routine nursing interventions and evaluation measures she performed using, emphasis dito, paragraphs. Which of the following documentation systems did the nurse use? So kapag paragraphs yung ginagamit, narrative charting yung tawag doon. Okay? Yung SOPI documentation, of course, yan yung subjective, objective, assessment, planning, in implementation, and evaluation. Yung POMR, tinatawag na problem-oriented medical record, ito naman yung SOAP lang. Hindi kasama yung IE. So, ganun din, subjective, objective, assessment, and planning. Yung focus charting, ito yung FDAR, tinatawag. Yung focus, data, action, and response. Okay? So, 6 is boy. 5, 4, 3, 2, 1. Nurse Katrina is starting her nursing care for a patient in their ward who has been admitted for 20 days already. She documents abnormal and significant findings only. Which documentation system did she use? Okay, so sa focus charting, di ba FDAR yan? So yung focus, yung data yan, hindi yun yung significant findings only. Kapag problem-oriented medical record, yung SOAP ulit, Yan. Charting by exception, ito yung sagot. Kasi kung ano lang yung kailangan na isulat, yun lang talaga yung isusulat. Yung narrative paragraph yan. So, 7 is cat. 5, 4, 3, 2, 1. Nurse Katrina is rotated to Ward 3 and she observed that the nurses are documenting patient care using focus charting. Which of the following is appropriate documentation using focus charting? So, again, FDAR, ay, ito na lang, para may notes kayo. Hitan ko lang onte. Ayan. So yung focus, it refers to the nursing diagnosis, behavior, or client's condition. Yung data, assessment findings. Action, nursing intervention. Response is the evaluation. So dito sa A, tama to, nursing diagnosis. Data, ito kasing administered, dapat intervention to. So action siya. Diba? Hindi siya data. Facial grimacing with pain rating. This is assessment. So, dapat data siya. Ang rate pain at 1/10, this looks like, kasi bumaba na yung rate niya, evaluation na to. Or response. Okay? So, ang tama lang ay ang A. Focus is pain. 5, 4, 3, 2, 1. Most agencies have specific policies about telephone orders. Which of the following is not true about telephone orders? So, negative yung hahanapin nating statement dito kasi not true. It is the physician's responsibility to sign the order within 24 hours. Tama to. Orders that seem inappropriate must be questioned. Tama rin. The order is transcribed to the doctor's order sheet. Tama. While the physician gives the order, the nurse listens carefully and writes the order. Tama naman to. Pero kulang siya. Kasi while the physician gives the order, the nurse listens carefully and writes order and should read the order back. So kulang siya ng reading order back. Okay, so 9 is dog. 5, 4, 3, 2, 1. Situation. Clay is a community health nurse in Barangay Noli. She knows that she plays an important role in the community as the primary agent of information and dissemination on certain infectious diseases. The following questions apply. One of the important roles of Nurse Clay is on the prevention and control of dengue, which includes, okay, so what prevents and control dengue? Advising the elimination of vectors by keeping water containers covered. So, ito naman, focus siya sa covering water containers. Okay. Be conducting strong health education drives or campaign directed toward proper garbage disposal. Naka-focus siya dito, proper garbage disposal. So, as much as possible, focus tayo sa dengue. Explaining to the individual families, clients, groups, communities, and the nature of the disease and its causation. Tama. Practicing residual spraying with insecticides. Okay, pwede yan, pero best pa rin tong cat. About dengue. So 5, 4, 3, 2, 1. Nurse Clay should be alert in observing a dengue suspect. The following is not an indicator. Is not an indicator for hospitalization of hemorrhagic fever suspects. So we're looking for something negative na hindi indicator ng dengue. So this is positive, persistent headache, positive tong increased hematocrit, positive din tong anorexia, abdominal pain, and vomiting. Ang hindi nakasama dyan ay ang cough of 30 days. Walang cough of 30 days sa dengue. So 11 is apple. 5, 4, 3, 2, 1. Nurse Clyde's primary concern in the immediate control of hemorrhagic dengue among patients with dengue is, so immediate, A, advising low fiber and non-fat diet. So, actually, pwede to. This helps in diarrhea. Pero kasi yung diarrhea, rare siya. And, di ba, ang problema natin dito ay bleeding. So, it doesn't, hindi siya nag-immediately control the bleeding. So, X to. Providing warm through lightweight covers, not directly about about bleeding, tsaka light covers. So, paano mo mapoprovide yung warmth dyan? Observing closely the patient for vital signs leading to shock, yes. Keeping the patient at rest, yes. Ngayon, C and D, ano kaya yung sagot? Okay. So dito, kapag kasi in-observe mo lang yung client closely, walang immediate control yun ng hemorrhage. Sa dog, pwede pa, keep the patient at rest kasi this will limit physiologic functioning and decrease risk for trauma. So answer is dog. Okay, 5, 4, 3, 2, 1. Which of these signs may not be regarded as a truly positive signs indicative of dengue? So, something negative. Ayan. Wait. Yung iba, walang 11 sa G-form. Okay. So, please take note na lang yung number 11. Ayan. And the answer is A. Okay? Okay. Number 13 tayo. Not regarded as truly positive signs indicative of dengue. So, dito, we're looking for something negative, no? So, this is something positive, sign siya ng dengue. Positive din to. Prolonged bleeding time, suddenly increasing hematocrit count, positive din to. Ang hindi positive dito ay yung A. Kasi, ang positive dapat ay ito. So, dapat 20 or more petty K in 1 inch or 2.5 centimeter square. Ito kasi 1 centimeter square lang siya. So, kulang. Okay? The answer is apple. 13 apple. 5, 4, 3, 2, 1. 14. Which of the following is the most important treatment of patients with dengue? Ice cap over abdomen in case of melena. I think this is not really effective kasi over the abdomen lang. Give aspirin for fever. Aspirin causes bleeding, so contraindicated yan. Replacement of body fluids. Tama. Avoid unnecessary movement. So, hindi mo na papagalawin yung pasyente. X yan. Okay, so answer here is C. This is to prevent hypovolemia due to bleeding. Yan, 14 cat. 5, 4, 3, 2, 1. Nurse verb caring for patients in emergency and disaster situation. Yan, following questions apply. As an emergency and disaster nurse, nurse verb knows that which among the following population groups have the greatest risk during a disaster. Okay, wait lang. Ito. So, vulnerable during disaster, yan yung children, pregnant women, elderly people, malnourished people, and people who are ill or immunocompromised. Kapag naman walang disaster, usually those who are vulnerable are those part of low-income families. So answer is 3 and 4. Okay. 15 is dog. 5, 4, 3, 2, 1. During a burn therapy, potent opioids such as nalbuphine, Nubain is primarily administered intravenously for pain management because this route, okay, di ba kapag may burn, hindi dependable yung muscles ng client. Kaya sa IV tayo nagpapadaan, hindi IM. Okay? So, saan yan doon? Ayan. Facilitates absorption because absorption from muscles is not dependable. The answer is POY. 16 is POY. 5, 4, 3, 2, 1. Nurse Jean is a public health nurse of Barangay Gusali. Nurse Jean have just finished implementing the programs for the identified community health problems last month. Nurse Jean is now preparing to check if the target goals and objectives are met. The following question apply. Evaluation involves which of the following processes? So it involves observation as well as measurement, but not exploration. Okay, so the answer is dog. 17 is dog. 5, 4, 3, 2, 1. Yeah, nurse verbs caring for patients in emergency and disaster situation. As an emergency and disaster nurse, nurse verb knows that which among the following population groups have the greatest risk during... Ay, wait lang, parang bumalik. Bumalik nga. Sorry. Which of the following phases of the proceed model correspond to the evaluation if the objectives and sub-objectives have been met? Okay. Eto. For the interest of time. Ayan. So yung effect evaluation, walang ganyan na evaluation according to the precede and proceed model. So papagulo lang yan. Yung outcome evaluation, this measures long-term effects of the program as well as the goal. Yung process evaluation naman, it measures activities, quality, and who is reaching out. So it measures strategy objectives. Yung impact naman, it measures immediate effects and whether objectives have been met. So minimeasure yung objective and sub-objectives. So answer dito ay letter A, apple. Okay, 5, 4, 3, 2, 1. Which of the following evaluation indicators is described by the statement, what proportion of those who need something are actually receiving it? Ayan. So ito, loading lang. Wait lang ah. Ayan. So fresh from Maglaya. Ayan. Ito, so yung tanong, it's about showing what proportion or those who need something are actually receiving it. This is coverage, okay? Ayan. So the answer here is cat. Okay, 5, 4, 3, 2, 1. What is the ultimate goal of community health nursing? So dapat yung goal natin is towards self-reliance of the community. Para kapag umalis na tayo sa community, kaya na nilang mag-isa. So that is community competence. Okay, 21 is apple. 5, 4, 3, 2, 1. The community health nurse of Barangay Vito Cruz, Nurse Cristal, performed a rapid appraisal of their community. After the assessment, she concludes that there is a high prevalence of alcoholism. Among their community's youth. She decided to start a program entitled Pag-inom, Bawasan. So, underline lang din natin yung youth upang buhay ay may dagdagan. During the initial planning of the program, Nurse Cristal knows that she can collaborate with which of the following persons. So, we can collaborate with the Chief of Police, Municipal Officer, Health Officer, Guidance Counselor, SK Chairman, but not the Parish Priest and the NGO representative. Para malayo na yan. Okay? So, all but 5 and 6. 22 is dog. 5, 4, 3, 2, 1. Nurse Cristal knows that her advocacy will best work and will be effective if the following principle is used as a guide. Yes. Na-skip ko yung 19? Sige, pasensya na. Thank you. Okay. Sige, ito namang 19. Si ma'am. Uy, 11 minutes na lang, guys. Sorry naman, ako mali. Ito na. Chill lang. Okay. Ayan. So, which of the following is evaluated by the outcome evaluation? So, yung strategy objectives, minimeasure yan ng process eval. Yung objectives, minimeasure yan ng impact eval. Yung goal, minimeasure ng outcome. And yung sub-objectives, minimeasure ng impact. So, answer is cat. Okay, 19 is cat. 5, 4, 3, 2, 1. Okay, yun na ba tayo? Ayan. Nurse Cristal knows that her advocacy will best work and will be effective if the following principle is used as a guide. Okay, di ba ang topic dito, alcoholism? So usually, yung mga alcoholic, meron yung mga groups, tinatawag na Alcoholics Anonymous. Kasi, it is said that group therapy can be more beneficial than the individual therapy kasi they know that they are not alone in dealing with this and that others are dealing with the same problem. Ayan. Kaya ang sagot dito ay a group therapy. 23 is apple. 5, 4, 3, 2, 1. 24. Nurse Crystal makes a plan for the program. She constructs the program aim as, so dito, moderate withdrawal from alcohol, 1 at a time step towards total alcohol withdrawal, abstinence from alcohol, and total withdrawal from alcohol. So dito mapapansin nyo sa A, B, and D, nakafocus siya sa withdrawal, which is actually something na parang negative siya, di ba? Kasi sino bang gustong magkaroon ng withdrawal symptoms, di ba? It's an unpleasant experience. So mag-focus tayo sa something positive, which is abstinence. Focuses on the ability of the client to control himself or herself. So cat is the answer. 24 is cat. 5, 4, 3, 2, 1. After making a program plan, Nurse Crystal decides that a seminar on the legal implications of substance abuse must be implemented. She knows that the person with the ability to handle and implement the activity is so something that has a background on the legal implications, and that is the Chief of Police. No. Yung Chief of Police siya rin yung may kakayahan na mag-enforce ng mga ng law about that. So dog is the answer for 25. 5, 4, 3, 2, 1. 26. Before making the program plan, Nurse Crystal knows that she must understand the factors leading to this behavior of the youth. She understands that the person with the most influence on the development of alcoholism among the youth are so usually, di ba, youth, adolescents, yung ang peers ang pinaka nakaka-influence sa kanila. Okay, so C is the answer for 26, cat. So 26 is cat. 5, 4, 3, 2, 1. Situation: infant born 12 hours ago. Nurse Catalina has been instructed to collect blood by heel stick for newborn screening for congenital hypothyroidism before the baby will be discharged. Nurse Catalina questions the order of the pedia because 12 hours after birth is not the optimum time to collect this specimen. For which reason? So usually hindi tayo nagko-collect 12 hours after birth kasi ito yung reason. Kasi collection 24 to 48 hours after results in false positive result. And kapag naman tinas natin yung critically ill or post-transfusion infants, nag-result siya into a false negative. Okay? So, saan yun dito? Ayan, there's immediate rise of thyroid-stimulating hormone after birth. Okay, so A is the correct answer. Yung dog, malito kasi it's usually low kapag may congenital hypothyroidism. Not really tong thyroid scan. Should not be done first before. The baby needs to digest the formula before a blood sample can be taken. And formula is contraindicated, breastfeeding is promoted. So 27 is apple. 5, 4, 3, 2, 1. 28. At 4 months, a child was diagnosed with hypothyroidism. The mother asked symptoms consistent with the diagnosis. Which of the following is an expected symptom of hypothyroidism? So itong prolonged jaundice, this is one of the most important and earliest signs of hypothyroidism. Tapos, yung quiet and good baby, usually this happens because of decreased neuromuscular irritability. So, nangyayari din to, as well as umbilical hernia. So, the answer is dog, all of the above. 28 is dog. 5, 4, 3, 2, 1. What will be the priority nursing diagnosis for this child? So, ito yung effect kapag merong hypothyroidism. So, there's low metabolic rate due to low T3, low body heat production due to low T4, and decreased neuromuscular irritability due to hypercalcemia. So, yung A dapat hypothermia yan. This is true kasi nga may low metabolic rate yung bata. So, konting lele lang, may it can be fatal. So there's high risk for ineffective health maintenance. Yung imbalanced nutrition, not necessarily pati ito. Okay? So answer is boy. 29 is boy. 5, 4, 3, 2, 1. 30, if not diagnosed early, irreversible damage can occur to what major organ of the body? So kapag hindi na-treat tong hypothyroidism, it can result to permanent mental disability. So yung brain yung affected. So 30 is dog. 5, 4, 3, 2, 1. 31, thyroid hormone replacement to eliminate signs of hypothyroidism is a lifetime management. Prior to administration to such drug, the nurse will check which of the following. So, normally, nagkakos ng bradycardia kapag nagbibigay ng thyroid hormone replacement. So, kailangan i-monitor yan kasi baka nag-indicate na yon ng overdose and toxicity. Okay, so, boy is the correct answer. 5, 4, 3, 2, 1. Nurse Shona is working as a principal investigator on a research project sponsored by their hospital. She must be knowledgeable about research concepts. Ayan. This refers to the use of findings from a discipline research in a practical application that is unrelated to the original research, tsaka the use of findings. Ayan. So, pwede yan, evidence-based practice, diba? Tsaka research utilization. Pero kapag sinabing unrelated to the original research, that is research utilization. Kapag related naman to the original research, that is evidence-based practice. So the answer here is cat. 32 is cat. 5, 4, 3, 2, 1. 33. This refers to the integration of research findings where the practical application is related to the original research. So this is evidence-based practice. Ayan. 33, boy. 5, 4, 3, 2, 1. 34. You are a nurse. You wanted to study the relationship between post-traumatic growth of soldiers and social support from their families. What is the independent variable? Okay, so dito, ang independent, yun yung cause, di ba? Yung social support. So yung social support, it affects the level of post-traumatic growth of the soldiers. Okay? Which is the dependent, yung effect. Okay? So dito tinatanong independent. So ang answer dito ay social support, dog. 34 is dog. 5, 4, 3, 2, 1. 35, based on the question above. Based on the question above, which is the outcome variable? So yung outcome variable, it's the effect or dependent variable. Kanina, ang outcome or effect is the post-traumatic growth. So that is the answer. D. 35, dog. 5, 4, 3, 2, 1. 36. Research being conducted to study the effect of 3 different generational oral contraceptives to the development of myocardial infarction. Which of the following is the independent variable? So kapag dito, kapag may effect of, usually, ito yung independent variable. Okay? So ang sagot dito ay 3 generations of OC. So apple. 36 is apple. Samantalang ang dependent, kasi nagdepende siya sa effect ng OC, di ba? Dependent is MI. Okay? So 36 is A. 5, 4, 3, 2, 1. Based on the above situation, does the research need to establish a control group to determine which among the 3 generations of OC is most likely to cause the development of MI? So dito, ito yung definition ng control group. So it's also called comparison group. So they usually receive placebo or they don't receive intervention at all. So saan dito yon? The answer is dog. Okay, 5, 4, 3, 2, 1. Yan na, 1 o'clock na, pasensya guys. Yan. A nurse is preparing a research proposal wherein she will compute the size sample from a population of 1,500 with a margin of error of 5%. What is the computed sample size using Sloven's formula? So this is Sloven's formula where the big N is the total population. So let's just substitute. Okay? And ito pala yung margin of error is yung E, yung small e. So substitute na natin 1,5 divided by 1 plus 1,5 times. So yung 5% dito, convert lang again to decimal point. So magiging 0.05 siya squared. Okay, so 0.05 times 0.05 times 1.5 is 3.75. I-add mo yan ng 1, so magiging 4.75. Divide this, magiging sagot 315.789. Round up, that's 316. So the answer is C. Okay, 5, 4, 3, 2, 1. A nurse researcher conducts a case control study on the association of long-term use of tamoxifen and breast cancer and found out an odds ratio of 0.99. The nurse correctly infers that. Okay, so ito yung findings. So ito yung interpretation pala. So yung 0.99 is less than 1. So yung protective factor, which is the long-term use of tamoxifen, protective siya against the disease, against breast cancer. So yung paggamit daw ng tamoxifen, mas hindi siya nagkakaroon ng breast cancer than yung mga hindi gumagamit ng tamoxifen. Ayun. So saan yun dito? Letter D. The risk of breast cancer among those who have history of long-term use of tamoxifen is 0.99 less compared to those who have no history. Okay? So, kapag equal to 1 naman, it's not a risk factor. Kapag greater than 1, it is a risk factor. Okay? Kapag less than 1, protective factor siya. Okay? 5, 4, 3, 2, 1. 40. In a research proposal, a nurse mentioned that purposive sampling will be used as a sampling method. The nurse understands that they will select samples by using the research knowledge about the population to handpick sample members. Yes, this is actually the purposive sampling, which is yung hinahanap natin. Okay? Ay. Ilang pasensya. Dapat purposive yan. Ayan. Asking early sample members to refer other people who meet the eligibility criteria. Kapag nagpaparefer ka, that is snowball sampling. Dividing the population into subsets, which elements are selected at random. This is stratified random sampling. Establishing a sampling frame where the sample members are chosen at random. This is the simple random sampling. Okay, since we're looking for purposive sampling here, the answer is apple. 40A. 5, 4, 3, 2, 1. 41. A public health nurse recorded 10 new cases of measles for the months of July to December. Currently, 15 are being treated at the health center since the start of the year. What is the incidence considering a population of 125? So ito kasi, di ba ang formula dyan, new cases in a period of time divided by the population at risk, di ba? Times yung factor, which is in this case 100,000. So, teka lang. Teka lang ah. So, new cases. Actually, ito, medyo magulo siya. Ika-clarify ko lang to and babalikan ko kayo, ha? Regarding this. So, i-park nyo muna yung 41. Okay? So, proceed tayo with 42. Situation, Mr. Maluto, a lawyer, has been under medical treatment for multiple gastric ulcer for the last 5 years and has been advised surgery by his doctor. Okay, the patient has to undergo Billroth 1. Which of the following is done in this procedure? So yung A, partial removal upper 1/3 anastomosis to lower esophageal sphincter. So, walang ganito na surgery ha. Yung B naman, half of stomach is removed, entire jejunum is excluded from GI, duodenum is disconnected. This is the biliopancreatic diversion with duodenal switch. It is a type of bariatric surgery for weight loss and long-term problems can occur. Okay? Ito namang partial removal of the distal 2/3 of the stomach. Ayan. So, anastomosis of the stomach to the jejunum. Kapag jejunum, it's a Billroth 2. Kapag naman duodenum, Billroth 1. Ang palatandaan ko niyan, from the stomach, ang pagkakasunod nila ay DJI. So, duodenum, jejunum, ileum. Since nauna ang duodenum, Billroth 1 siya, pangalawa ang jejunum. Okay? So, ang sagot dito ay dog kasi hinanap natin Billroth 1. So, 5, 4, 3, 2, 1. Prior to surgery, you were asked by Mr. Maluto why atropine sulfate is ordered. Your best response is, so kapag kasi mag-surgery, di ba, may anesthesia, and that increases gastric mucus secretion. So, kailangan ng atropine to counteract this effect. So, magde-decrease siya ng mucus secretion due to its anticholinergic effect. Ayan. So, ang answer dyan ay ito, cat. 43 is cat. 5, 4, 3, 2, 1. 44, you just finished your pre-op teaching. Which of the following statements indicates further teaching is needed? So something negative to. I will place my hand or a pillow on my abdomen whenever I have to cough or exert force. Tama to, splinting. I must lie down for 30 minutes after eating. Tama rin to. This is to prevent dumping syndrome. Okay, yung diarrhea. I can ambulate as soon as I'm transferred to the recovery room to prevent blood clot. This is negative kasi anesthesia may still be in effect. So, magkakaroon ng wrist and falls. D, I should be eating more amount of fried chicken than a bowl of porridge. Tama rin to. Dapat the client will eat more protein than carbohydrates because this can slow down the risk for dumping syndrome. Okay? Yan. So, answer is cat. 44 is cat. 5, 4, 3, 2, 1. Which of the following assessment would be your indication that Mr. Maluto has recovered from anesthesia? Di ba yung anesthesia nag-wala ng sensation? So, to know na wala yung anesthesia, dapat may sensation na siya. So, there is feeling of warmth in the room. 45 is dog. 5, 4, 3, 2, 1. 46. After Billroth 1 surgery, Mr. Maluto reported that he was having diarrhea after meals. So, this must be the dumping syndrome. Ma'am, 40. Sorry. 41. Ayun nga yung sabi ko sa inyo, babalik natin yan. Kasi nga, ang new cases nga ay 10. Ayan. Okay? Okay, nasa ba tayo? Ayan, ito na tayo. After Billroth 1 surgery, Mr. Maluto reported he was having diarrhea after meals. So this is dumping syndrome. Okay? What should the nurse recommend to prevent this condition? So yung A, avoid taking fluids. This is true. Kasi kapag nag-take pa siya ng fluid, di mas lalong bababa yung pagkain. That will contribute to the diarrhea more. Okay? So, tama to. Consume 3 meals a day. Ang recommended ay small, frequent feeding. Okay? Hindi lang 3 meals a day. Lie flat while eating meals. Malito. Dapat ang position ay low Fowler's. Kasi ang concept kasi ng dumping syndrome, kapag naka-upright ka, through gravity, mas bababa yung pagkain ng mas mabilis. Diba? Kaya while eating meals, low Fowler lang. Okay? And then, after meals naman, lie flat para hindi mabilis yung pagbaba ng pagkain. Okay? Lie flat. So, mali din to. The answer is apple. Tama yan. It's recommended. Okay? Para hindi mabilis yung pagbaba ng pagkain. 5, 4, 3, 2, 1. Nurse Selena handles various patients with elimination problems. She always performs her best nursing care to these patients. Nurse Selena teaches an incontinent patient bowel training. Which among the following will Selena not include in her health teaching? So something negative. Leaning back at the hip while sitting on the toilet that helps simulate colon emptying. Wrong. Dapat leaning forward, hindi leaning backward. Okay? Opioids are avoided to prevent decrease in bowel peristalsis. Tama. Regular exercise encouraged. Tama. Hot tea or fruit juice may be taken before the patient defecate. Tama. So answer is apple. 47 is apple. 5, 4, 3, 2, 1. An enema to provide relief from gaseous distension is prescribed to a patient. Nurse Selena knows that this is so palatandaan ko nito kapag kailangan ng ma-relieve yung flatus, kailangan si Carmina. Okay? Kapag naman oil retention enema, mag-apply ka lang ng oil sa may anus. Mag-inject ka ng oil sa may anus kasi it softens the stool. Kapag soap suds naman, pinaghalo siya ng konting soap and distilled water. And that stimulates the bowel movement. Kapag feed enema naman, this is also called saline enema. So, it contains salt, no? So, the salt pulls more water into the intestines, making the stool soft. Okay. So, ang answer dito ay, ulit, carminative enema. So, yun lang yung primary purpose niya. It is to relieve gaseous distension or flatus. 5, 4, 3, 2, 1. 49. After inserting nasogastric tube, Nurse Cara checks its placement by measuring the pH of the aspirate. Nurse Cara knows that the proper placement has likely been made if the aspirate has a pH of. So nasogastric tube sa gastric siya dapat. 5.5 or less. Okay, so saan dyan? Letter D, dog. Okay, intestinal 6 or greater, respiratory 7 or greater. Okay, 5, 4, 3, 2, 1. Last, yan. Municipality A made to local newspaper headline. Ayan. Because of the occurrence of some unusual events in just 10 days, 2 pregnant women died. 2 children died. 2 elderly died. The mayor of the town called a meeting for the municipal health office personnel. Public health nurse Maria assigned to make the action plan to prevent another similar event to happen. Which of the following could have been the top contributors to this situation? So, dito, this is to postponement of people in seeking medical care. Yan yung mga delays. Adherence to cultural practices, hindi to kasama kasi not all cultural beliefs and practices naman are contributors. Okay? So kung hindi kasama ang 2, hindi kasama yung A, hindi kasama yung B. So it's either 4 or 3. So dito, delay in receiving appropriate adequate care, mas pipiliin natin to kaysa sa lack of ambulance drivers kasi mas holistic to. So answer I, dog. 50 is dog. Ayan. Kamusta kayo? Ma'am, babalik po sa number 42. Paulit po ng enema. Okay, wait. Paulit po ng enema. Ito na lang. Para notes nyo na rin. Ayan. Sorry. Ayan na. May klase pa kasi ako ng 2 o'clock. Kayo naman. Ayan. Pero marami ba kayo natutunan? Sobrang punong-puno yung NP 1 to 3.5. Oo nga eh. Ayun. Ayan. So, any questions pa, guys? Yan. Thank you so much. If may questions kayo, you can PM me sa Facebook or sa Instagram. Thank you so much again, guys. Yan. Isasend ko na lang kay Ma'am Bell yung mga screenshot. Okay? Bye!
Bye!
Sheila! Oy, Motet. Tata, Torio. Tara, shot. Sityo. Ra.
Justine. Bilangin. Nuesca.